హలో హలో మేడం
ఎవరు సార్? సార్
నేను
చెప్పండి సార్.
రాఘవన్ మ్యామ్.
రాఘవ
ఓకే
గారు
మ్యామ్.
చెప్పండి.
అది లైవ్ లింక్ మీకు వాట్సాప్ చేశాను చూడండి యూట్యూబ్ లింక్.
అలాగే సార్, తప్పకుండా సార్. ఓకే సార్. విశ్వాసం అక్కర్లేదు.
అదిగో నిన్న బ్యాంక్ వెళ్ళిన ఏటీఎం పని చేయలేదంటే సగం జీతం వేశారు వచ్చినా కొంచెం లేట్ అవుతుందండి ఇంట్లో ఉన్నాం కదా. నువ్వు కొట్టేసావు.
Hello, everybody. Can you hear me?
Yes, ma'am, we can. Yes, ma'am.
Yes, sir. Sir.
Good morning, ma'am.
Hello. Hello.
Yes, ma'am.
Sir, we'll wait for 2 more minutes. Few more minutes, sir.
Yeah, absolutely.
So that there will be more participants.
Correct.
Good morning, madam.
Sir, am I speaking to Dr. Mihir Parekh?
Yes, you are talking to me, ma'am.
Yes, sir. Most welcome, sir.
Thank you.
Meanwhile, you
Good
can
morning,
adjust your PPT and all, sir.
Yeah, I just need the screen sharing rights.
Okay. I'll ask. Sir, webmaster, sir. Webmaster gar Raghava, sir. Hello.
మేడం.
సార్ ఇప్పుడు సార్ ఉన్నారు కదా మిహిర్ పరేఖ్ అని, డాక్టర్ మిహిర్ పరేఖ్, ఆయనకి స్క్రీన్ షేరింగ్ ఇవ్వండి సార్.
అవుతుంది
సార్, ఇట్ ఈస్ గివెన్ టు యూ ఆల్రెడీ, ఇట్ సీమ్స్.
No, after clicking on that, it says only the host can share in this meeting.
Okay. Sir, host, please give him hostship, sir. Webmaster.
హలో
Sir.
ఇచ్చాను మ్యామ్, ఒకసారి షేర్ చేయమనండి సార్.
Sir,
Yes,
now.
Yes, ma'am.
Okay, sir.
Mihir Parekh ji, welcome on behalf of all of us. Namaste.
Namaste,
Sir,
sir. Thank you so much. Thank you.
My humble request to all the participants is don't call me on this phone number, because once you call me again, I have to go back and come back to meeting again. Otherwise, my.
You have any alternate? You have any alternate number, madam?
Alternate number I have given. I'll give you again. Okay, sir.
Madam.
I'll keep in the chat box.
Okay, madam. Okay, madam.
Okay. Sorry for the inconvenience.
Mihir ji, shall we wait for another 5 minutes or 10 minutes? Because only
we'll
44 has come.
Absolutely,
Sir,
sir.
we'll wait for just 5 minutes, sir.
Yes, madam. Yes, madam. Madam.
Yes, sir.
PRO is waiting for you, madam.
PRO, sir, is waiting for what, sir?
For which I sent the message. I sent no for the message to be. You may include some couple of names.
Sir,
I forgot.
he writes very well, sir.
That's what he needs, some information, because he didn't attend. He needs it, madam. Kindly send him, madam.
I shared yesterday's program sheet, sir.
No, not sheet, madam. The one which I have sent to you, kindly modify it and send, madam. Forward it, madam.
Sir, now I cannot modify. Meeting started now.
Shall I send it, madam, with if you have trust on me?
Yeah, definitely you are doing it already.
Just see, madam, please.
Now meeting started now, sir. Now we cannot. So actually, PRO sir writes very well.
No, madam, that's right, madam. He will modify, but he wants you to send it through you only.
Because the other day he only called me and took all the points. And,
Okay, madam.
did. So yesterday he called you, so it is your responsibility.
Yeah. He didn't call me, madam. I only called him.
Day before yesterday he called me, sir. I gave information.
Yeah. Yesterday he said he called you, but he didn't want to disturb you, madam.
Okay.
Kindly forward it, madam, as it is, or you modify it and send it. WhatsApp.
Sir, Rajsekhar sir's profile is with you
No, madam.
because I will introduce him.
Hmm.
Now, Mr. Parekh's I shared with you, see. Dr. Mihir Parekh.
Yeah, what,
Yeah.
ma'am, what have you shared?
No, sir, not for you. We are talking
Okay.
because
Okay.
we have to introduce, you know.
Yes.
Every day we'll discuss who will introduce.
Okay. Okay.
Even though we know we have given assigned, sometimes we may change also. That is the reason.
Right.
It is a type of entertainment also.
So, ma'am, hope your health is good now.
Yes, sir. Actually, we are 4 members, sir, in the house.
Yes. So
And
everybody is good, right?
good. But like my youngest daughter still having fever.
Oh,
Sir, it is like no, sir. 21 days we have to pass through.
yes. Even
So
my
we count.
parents,
We,
even my
we count
parents,
days.
okay. My parents had also got it and they were quarantined for 21 days.
Yeah.
7 days they were in the hospital and the remaining 14 days they were at home.
Yes, sir. So for me, today is 14th day.
Oh, so you must be feeling.
Last webinar day I got, sir, Tuesday evening. So today, yesterday I completed 14 days.
That's really commendable because you are running a great marathon.
So like no, my eldest daughter is 3 days ahead of me. She completed 17th day.
Okay.
And my son is 1 day after me. So he is on 14th day. But my youngest daughter is still today is 5th day for her.
Okay.
Recently she got, and we have Rajahmundry strain. It is not coming. We get fever 5 days, it will subside. We 3 are in the same line, but she came from Anantapur. That is different strain.
Oh, okay.
So she's getting 104, 103, again reducing, again coming. So the strains differ, sir.
Yes, absolutely.
Yeah. So, sir, I think we can start, sir. I'll introduce. Hello, all participants. Good morning to everybody.
Yeah, we reached half century to +2. Okay. Start,
Sir,
madam.
okay, you start, sir. You introduce. You got it?
Yeah.
I thought you are busy sending message to PRO.
Yeah, you introduce him, sir. That is a honor we have to give to Dr. Parekh, Mihir Parekh.
Sir, you
He's
start.
young.
Sir, it's always good for you only. Your hand is good. Start.
Yeah, glad to introduce Dr. Mihir Parekh by his smile and all. You see, if you meet him once, you'll find an everlasting friend in him. We could get introduced to him on March last month, 27th and 28th. He became a part and parcel of our psychology department and all other allied associations. I appreciate your voluntary gesture of coming and giving us a message to all the people out here with your experience and expertise. And Dr. Mihir Parekh is a rehabilitation psychologist and specialist educator. He's in the field of rehabilitation for the last 13 years. A very pragmatic and a very positive person he is. He is the founder director of Urja Counseling and Remedial Center, a center for children with special needs in Mumbai, Maharashtra. He has completed PhD in psychology. His research topic in PhD was effect of hypotonia on children with learning disabilities. Great subject, sir.
Thank you.
He is the head counselor in more than 11 schools in Mumbai. Hats off to you for your services which you are rendering. Really immense services with pragmatic, positive and penetrating approach, I assume. And I really believe and trust. He has published many research papers on learning disability in international journals. His area of interest is diagnosis and remediating CWSN and also counseling their parents. Oh, exactly, sir. That's what is needed. Counseling parents is the need of the hour. Is an author of the book Life Tweets for Parents, which runs in 2 volumes. Oh, great. He has written many articles in the local newspaper Midday. Over to Mihir Parekh with a hearty and affectionate welcome on behalf of all the associations over here, and on behalf of Adikavanana University, on behalf of Department of Psychology, on behalf of Dr. Mandramna, Madam. Over to Mihir Parekh. Thank you, sir. Thank you for giving an opportunity to introduce a very resourceful person today. Thank you.
Well, good morning, everyone. Thank you, Nagendra sir, for such a wonderful introduction and your kind words. Well, let me share my joy with you today that I'm so glad and privileged to be one of the speakers of the 2-day national webinar. And I feel at the onset, I would like to take this opportunity to thank Dr. Maniramana ma'am, who has given me a chance to present today. Well, let me tell all of you, those who are listening to me, we are in association with each other, I think just we know each other for the last 1 month, but the kind of trust, the kind of confidence that ma'am has shown in me, ma'am, thank you very much. I have seen her coordination, I would say a stupendous coordination for the past 1 week. I see it in the group where despite of the fact that her family was under the weather, she has managed the entire program so beautifully. So ma'am, thank you once again for inviting me. I would also like to take this opportunity to thank Dr. Nachiketa, the director, and definitely Nagendra sir. Well, I would like to make a special mention here. I was a participant last time in the national webinar, which was conducted last month. And sir was introducing everyone. He was hosting the event beautifully. And one thing that I really loved about sir, and I have to learn from sir, is that the speakers delivered for 1 hour, 1.5 hours. But sir has a wonderful skill of summarizing things so well that in 5 minutes the entire lecture was summarized so beautifully that it actually hit the right buttons. So thank you, sir. It's really a pleasure to know you and be in touch with you. And last but not the least, I would like to thank all the participants here who are present today in such a large number, and your enthusiasm has come to the fore. I can see so many enthusiastic participants who have enrolled in the program for not only for the CRE, but also to gain knowledge. Well, CRE is something that everybody wants to go in for because they have to collect points for their upgradation practice. But learning and attending the seminar throughout for 2 days is really a big commendable job. So I appreciate all of you who are doing such a wonderful job in the field. Well, I feel that all the educators here who are listening to me, all the professionals here who are listening to me, we are not parents of 1 or 2 children, but we are parents of so many children with special needs who really need us. And by attending,
Sir,
yes.
1 minute, sir. Sir, thank you, sir. You mentioned very well all of us. And first moment itself, we came to know you are having knowledge. So that is the reason we brought you here, sir.
Oh, thank you so
we
much.
we want to continue this relationship for further webinars. And
I look forward to it.
Vice Chancellor, Honorable Vice Chancellor, Professor Mokka Jagannatha Rao garu encourages a lot to invite all the resource persons like you from all over India and to share their knowledge, sir. Thank you very much, sir.
Yeah, pleasure is all mine. And thanks to the Vice Chancellor, sir. I'm sorry, I do not know. I have a lot of difficulty pronouncing the names. So if I have mispronounced anybody's name, so apologies for the same. Yeah, so before, let's get started. So today my topic is Down syndrome and various areas in Down syndrome. So I am sure everybody who is participating, who have participated today, know about Down syndrome. If you do not have much knowledge about Down syndrome, because when we study, ma'am, I would just like to ask you which language is okay. Can I talk in only English or English and Hindi?
English, sir, pure English.
Purely English. Okay, no problem.
Hindi means problem.
Okay. So there are so many educators where, you know, when we study special education, so one of the disability that we study is Down syndrome. Okay, but after we start practicing, and if you don't practice with children having Down syndrome, then so many information or a lot of information is just lost. So let us kind of go through the information about Down syndrome. Let us first set a stage about knowing what is Down syndrome, and then let us dive into the topic. So I would like to share my screen, and also I would like to share that why I have chosen this topic. When ma'am called me and she said that the one second. Yeah. Is my screen visible by any chance?
No, sir.
The screen is not visible, sir.
Okay. Just give me a minute.
అంటే హరిణి వచ్చిందా?
మ్యూట్ చేసుకోండి మేడం.
Yes, sir. Now it is visible.
Yeah, so I want all of you to please sit with a pen and paper, because there's loads to write, loads to click. So if you want, you can also click, and if you want, you can also write. But the early morning hour, the way we do a lot of gymming at home nowadays, we can also do some brain gym today. So I'm going to ask you some questions, which feel free, you can unmute with ma'am's permission, or you can just write your answers in the chat box. So my topic is Down syndrome and why I have chosen this topic. So I still recollect the last time when I attended the session, there was a wonderful speaker. I do not remember the sir's name. He had spoken that there is a lot of need, to do a lot of research in the field of disability, and therefore we need to know that the researches that have happened, how can we apply the implications of the research. Number two, that definitely you all are caretakers, and therefore that amount and that kind of knowledge is very much necessary for all of you to take away today. When we are educators and when we are dealing with children with special needs, it is very important that you understand their problem holistically. It's just not about when the child comes to you and you start teaching the child, or you start intervening the child. It is important that you understand the child as a whole, because there are so many small things that matters when you are doing intervention. And at times, if those particular problems are not taken care of, then that somewhere puts you into a lot of frustration, that, why am I not able to achieve my goals? And last but not the least is understanding the limitations of the child. Because if you do not know what the research says, and if you keep on expecting a lot from children, then despite of the fact that the child is facing this particular problem, and then also you keep expecting a lot from children, then there is a lot of frustration in the professional. So it is very much important to understand the limitations. All right, so I'll share some example. Well, I have certain children who with different disabilities who come to me. The parents, first of all, do not have much acceptance about the child's problem. So when they come to a specialist, when they come to people like us, we the first point that we do is we do a lot of counseling with these parents, that they somewhere need to deep down understand the child's problem and also accept the child's limitations. Accepting the child limitations somewhat put the parents at ease. Number two, they come to a fact where how much to expect from these children. Number three, it also gets the parents to this fact that a very limited amount of help I can expect from the educator, from the professional. So even though if the parent is paying us money, that doesn't mean that we are able or we can do a lot of magic. Even we have some limitations because the child displays limitations. So whatever limitations the child is displaying, we have to keep that in mind and work according to the limitations. All right. So as I mentioned about the brain gym, so I'm going to ask you some 5-6 questions. All right. What you can do is you can either unmute yourself or you can type it in the chat box. So the first question goes, are humans made of one cell or many? I'm expecting good participation. Okay. Are human made of one cell or many?
Many.
Okay. Yes, perfect. Yes, so humans are multicellular organisms, so we are made up of many cells. Perfect. The second question goes, how many chromosomes does one cell carry? How many chromosomes does one cell carry? No answer? You can try.
Yeah, 23 pairs of autosomal chromosomes and 1 pair of sex chromosomes.
Perfect. So there are in all how many chromosomes in one cell?
24 pairs.
So the answer is 46.
Yeah.
So you have rightly mentioned, Satyanarayana, 23 pair, which means 23 multiplied by 2 is 46. Perfect. Next one, what do chromosomes carry? Lovely. Yes. So all the genetic information that we get from our parents, chromosomes are the carriers. Perfect. Lovely. Next, name the sex chromosomes.
XY.
XY.
Excellent. It is XX
Y.
and XY. Perfect.
X.
Now, very interesting question. Who is weaker? The XX or XY?
XY.
Lovely. Yes, the XY is weaker. Those who do not know why XY is weaker, I'll tell you. But would anybody like to try why XY?
Because Y is having less chromosome.
X is proper.
Okay, so I'll give you one reason through this picture. If you see that there are two X's, okay, and both are of the same height, both are of the same size, both have similar genetic information, okay, but when it comes to XY, the Y is smaller, and if you look at the table, so it is that table with a very small leg, or in some cases no leg. So the table is topsy-turvy, the table has no balance, and therefore we now know that biologically females or women are more stronger as compared to men. All right, so this is one of the findings, one of the researches, that why disability is seen more among boys and less among girls. So this is one of the answers for you to know. Okay, last question. If XX and XY are sex chromosomes, then what are the other chromosomes called?
Autosomal chromosomes.
Lovely. Yes, and here we begin. So XX and XY are sex chromosomes, and now we will talk about autosomes. So what are autosomes? it's going to get a little technical, but it is interesting. So if you see that we have got 23 pairs of chromosomes, when these chromosomes are numbered in pairs, they are called as autosomes. So if you see, we have 22 autosomes and one pair of sex chromosome, which is X and Y. All right.
Yeah.
So now we are going to talk about not the sex chromosome problem. We are going to talk about the autosome problem. And one of the problems of autosome is today's topic, which is Down syndrome. So that was just a kind of a background for you to know that Down syndrome is not a sex chromosome related problem. It is an autosome related problem.
Yeah.
So a little bit information about Down syndrome. It was described by this gentleman, Langdon Down. His surname was Langdon Down, and therefore this problem is called as Down syndrome. But after some years, almost after 100 years, there was this gentleman, Dr. Jerome, who actually established the fact that this problem actually lies on autosome or chromosome number 21. So all the other chromes were good, but autosome 21 had a problem, and therefore it is a genetic condition. If you see, there are many children in India who suffer from Down syndrome. So unfortunately, they are described in very different ways. Somebody says that the boy looks like Chinese. Some says that he looks like a Mongol. Yes, very true. And then what happens? Then these races, Mongolians and Chinese and all, got angry. And they said that we are not problematic. So you better don't say that. And therefore, people started now labeling these children as T21 children. Perfect. So it is called as trisomy 21. So let us first see what is trisomy 21. It's a big fat name. So have you guys heard of this test, triple marker test?
Yeah.
Okay. So those who have not heard, just a quick information. So when the mother is pregnant, okay, so one of the researchers here says that when the mother is pregnant, the mother should undergo this test called as the triple marker test. Right? And especially those mothers or those couples, especially who have histories of mental retardation or intellectual disability in the family. Right? Because what does it measure? See, there are three types of trisomy 21, which you can see on the screen. Trisomy 21, trisomy 18, and trisomy 13, which means chromosome number 21 can be a problem, 18 can be a problem, or 13 can be a problem. And this can easily be identified by this triple marker test, and you can actually prevent trisomy 21 cases by just going through a small triple marker test.
Yes.
So this could be one of the preventive measures for all of us who are into the field to at least do counseling to those parents who are that ignorant to undergo these kind of tests. Right? Next, when I say trisomy, tri means 3. And if you see trisomy 21, so chromosome number 21 has 3 chromosomes instead of 2. So that is called as Down syndrome. Trisomy 18, which is called as Edwards syndrome, it has 3 chromosomes instead of 2. And trisomy 13, which is called as the Patau syndrome, it has 3 chromosomes in 13 chromosome as in place of 2. So these are well established fact that trisomy 13, trisomy 18, and trisomy 21 can lead to intellectual disability later. So better, why not to prevent it? So can anybody unmute and tell me that what test do you do to identify this? Quickly, a recap.
In a pregnancy, 5th month, we can go for test.
But what test did I mention? If you want to rule out these 3, yes. Triple marker test. Perfect. Okay. Next. So if you see that this extra copy results into very distinct facial appearance. So every cell has this one extra copy. And because of this, it creates a havoc in the body. And what kind of havoc does it create? So the child with Down syndrome has a very different, distinct facial appearance. If you see in the pictures down, it also results into intellectual disability, which is mental retardation. But I would say not all, only some or most of them. And they also have developmental delays, which means that their growth is very slow as compared to the regular children. Look at this interesting fact that it is seen more in boys than girls. And by now, you have the answer that why is it seen more in boys? Definitely because half of it could be attributed to the XX and the XY chromosome. So boys are weaker as compared to girls. So if you go back, and if you've heard that somebody has had a miscarriage, check out with them that when the doctor, so when the child got miscarried, what did the doctor say? That was that particular child a boy or a girl? And in most of the cases, you will have that the child was a boy, because girls can genetically survive those adversities, but boys usually don't, because of the XX and XY play. Okay, so as I said, distinct facial features. So those who do not know, let's get started about this. So children with Down syndrome you can easily identify them. They have an upward slanting eye, a flat nose, okay? Their lips are very thin, but they have a protruding tongue. Can anybody tell me why do they have protruding tongue? Any answer?
Tongue is also a muscle. It has low muscle tone. They will have.
Oh, lovely. Yes. One of the reasons, wonderfully put up. Low muscle tone, and number two, that the palate that they have is hollow. We have
hierarchy palate.
Yes, we have a deep palate, and therefore our tongue can rest. They have a hollow palate, and therefore the tongue keeps on coming out. They have a short neck. Okay, small ears, very cute ears they have, and they have something which is called as the nuchal skin. I will talk to you about nuchal skin. So there is one test which is called as the nuchal transculency, and if you see the USG, which is the sonography. So normal kids do not have that much of thickness behind the neck. See in the picture you can see, but a child with Down syndrome has extra fold of skins there, and that is it. And if you, from this only, the doctor is able to identify that the child has a depressed nasal ridge, which means that the nose is flat. There is this extra fold of skin behind the neck. And with these tests also, you are able to identify that whether the child has Down syndrome when the mother is pregnant. Right, so look at the advancement in the technology and medical sciences, that now this problem can easily be prevented, right? Okay, now let us talk about types of Down syndrome. So there are two types of Down syndrome specifically. Ideally there are three, but I would like to talk about two types of Down syndrome. One is the T21, very, very common, where instead of 2, you have 3 copies of chromosome number 21. And the other is, I'm sorry, it's the number is cut. It's called as the mosaic Down syndrome. It's also called as the mosaicism. Now here, not necessary that only in place of chromosome 21 there are 3 pairs. There can be 3 pairs in any number of chromosome. So it could be in 19, it could be in 21, it could be in 4, it could be in 7. So it's a mixture of cells. And when these kind of things are, they come to the fore, the doctors are confused. So I'll tell you one personal example. So one of this child who comes to me, when he was born, the doctor advised that you get a karyotyping done. And when the karyotyping was done, there was no presence of T21. Right? So everybody was surprised that the child looks Down syndrome. How come he doesn't have T21? And then later on, he was asked to get into the mosaic Down syndrome test. And there they could identify that the child had mosaic kind of Down syndrome and not the T21. So these two are different conditions, right? So please understand this for your knowledge. So if the parent says that all the reports are wrong, see, they are just putting us into, the people are just minting money here and there. No, there are so many tests that can identify even the type of Down syndrome, right? Okay.
Madam, can I ask you one question, madam, here?
Yes.
The physical appearances will be the same, or any differences in intellectual disability and the physical appearance of the child with translocation and the trisomy and the mosaic?
A lovely question. Children with T21 are affected the most in terms of the physical features, in terms of intellectual disability, in terms of the physical stature and developmental delays. Mosaic and translocation Down syndrome are much better in terms of IQ, in terms of developmental milestones, and also in terms of facial features. They appear more like a normal child with little distinct facial features. Otherwise, most of them are good in terms of, are better at prognosis when it comes to language development, developmental milestones, and also the physical development and
Speech
intellectual
development also much better in the mosaic and translocation also, madam.
Yes, but I will also like to add something on this when we are talking about speech. So just hang on for some time about the speech part, because I'll tell you that why they are not that good in speech because of some ABCD reasons that we will talk about the researches. Okay.
Yeah, no, ma'am.
So perfectly fine, going everything going good. Any changes?
Very nice, sir. Go on, sir.
Okay, thank you. So we can definitely take, so one was the screening thing that can be taken care of. Second is the causal factor that can be taken care of. So what could be the causal factor? Now we are going to get a little theoretical, so please have patience. I have tried to back up all these researches with their researcher's name. Down syndrome, okay, the rate of Down syndrome is seen more among parents who are 40 or over 40 years. Okay, so 60 per 10,000 births is seen. So say, okay, let me put it this way. The rate of Down syndrome among parents over 40 was 60 per 10,000 birth, which is 6 times higher than the rate found among couples under 35 years old. Therefore, there is always a pressure from our society, our ancestors. I think one of the answers to this is here we are here, that the more we are older, the chromosome starts mutating. Okay, because the body starts preparing for the middle adulthood and beginning of old age. So therefore the body starts mutating, the chromosome starts mutating, and over 40 years of age, the chances rises 6 times. So if you get married early, there are chances where at least you can control that 6% of the times the chances. Number 2, beautiful finding. Older fathers who are over 40 had twice the rate of Down syndrome birth compared to men who were just 24 years old, because 24-year-old man, his chromosomes will be well intact as compared to a person who is 40, whose chromosomes have started deteriorating. And younger when the child, when they had children with women over 35. So same goes with women also. Next, the probability increases from less than 0.1% in 20-year-old mothers to 3% in the age of 45. So the best wedlock period is till the age of 27. By 27, everyone should get married. You should quickly have children. So the chances of getting a special child automatically reduces. Okay, I'm saying it reduces. It doesn't guarantee that you will not have, but it definitely reduces, and that is in our hands. Very interesting finding here. males with Down syndrome were born to young couples, age less than 35 years. So 35 years and less had more of male Down syndrome boys, and elderly couples have more of Down syndrome girls. So when you see, and now I want you to check out, check out with all your children that if the girl child is born, then check the parents' age, at what age they conceived. Okay. And if the male child was born, check out at what age they conceived. I think most of it will be supported by this finding. So there's this beautiful graph which shows that the chances of Down syndrome with the mother's age increases between the ages of 35 to 40 plus. So always have children by the age of 30 years. One thing that we can actually take care of. So that was the causal factor. Now we get into the physical development. Why this? We are not medical people, but we should know that when you are teaching the child, when you are intervening the child, or when you are dealing with the child with Down syndrome, some physical problems starts interfering. So Down syndrome and hypotonia. Can anybody tell me what do you mean by hypotonia?
Tone, madam.
Sorry?
Low muscular tone.
Very good. Muscle tone is called as hypotonia, the strength of the muscles. So Down syndrome suffer from a condition called, you can make a note, called as generalized hypotonia. The entire body is weak in its muscles. So because of this, it causes joint laxity. All the joints are very, very lax. Lax, which means the muscles are very weak there. Control is very poor. If you see, these children can do yoga very nicely. They bend down, they stretch, they turn around, and the yoga teacher is very happy. See how flexible he is. But it is not his flexibility, it is his muscle tone that is interfering. And because of which there is a decreased gait stability. So they suffer from falls, they have balance issues. And whenever they have to pedal a cycle or do swimming, they get tired very easily. And therefore you see these Down syndrome children do not like much physical activity. Why? Because they have to exert a double of pressure as compared to a regular child. Number two, they are prone to decrease bone mass and increased risk of fractures. And therefore, this physical activity goes down. So the fracture also increases. So you have to be very careful if you're a sports teacher, if you are an occupational therapist, physiotherapist, or just a special educator, you have to first check the child's muscle tone and then accordingly plan the activities. Because of this low muscle tone, they show a lot of developmental delays. So the fine motor, the gross motor, the sucking of mother's milk, standing on one feet, crawling, all these milestones starts getting affected. These children are at an increased risk of developing the musculoskeletal problems, and they suffer from a condition which is called as the pes planus. I'll tell you in simple words what is pes planus. It is a flat foot. So if you see children with Down syndrome have a flat feet, and therefore it is very much important at a very early age to give them a supportive footwear, because then their legs start becoming pigeon-toed. Okay, so if you give a supportive footwear in the beginning, this is also one of the preventive ways where you can prevent further damages in the muscle and further contractures to happen. One of the study also says that these children suffer from arthritis. So you should not overlook the fact or not ignore if the child complains that the child has pain in the joints. Okay, so give a patient hearing there. Now, so that was about the physical part, the musculoskeletal area. Now we talk about the congenital cardiac defects. I'll share my child's example. So one of my student who was 2.5-year-old used to come to me for remediation. The child was very brilliant, but the mother always used to cry. So we asked her what happened. So she said, sir, he has holes in the heart. I said that how many holes he has, and there were more than 5 holes in the heart. Okay, so that's a very popular condition called as VSD. And after, I will share this, after this operation was done, the VSD operation was done, there was more blood flow to the heart, therefore more blood flow to the brain, and therefore more blood flow, and therefore more better increased academic performance. So imagine how connected each of this are, right? So 50% of the children with Down syndrome have cardiac difficulties. So AVSD, which is the, we don't need to know the name, simple holes in the heart, makes up to 40%, and total patients of ASD and VSD totals up to 32% of the cases, right? So this is very interesting. COVID-19, everybody must be excited to know. This is a recent study in Feb 2021, which investigators found that adults with Down syndrome were roughly 3 times more likely to die from COVID-19 than general population. And why is that so? The answer is down. Because they are more likely to get infections that affect their lungs and breathing. As it is, they have cardiac problems. And if they suffer from COVID-19, then definitely these children are at a greater risk of developing health issues. So again, a word of caution. This is the time where you cannot force any parents to move out of the house and come down for therapies, especially Down syndrome babies. The reason being that they are more prone to develop these kind of problems as compared to the other disabilities. So please make a note of this. Next is the gastrointestinal tract abnormalities. So there is something which is called as.
Sir, excuse me, sir.
Yes, yes.
Sir, how can we find out this? The most of the children have this cardiac defect. You said. What are the symptoms for this thing, sir?
Yes. So usually these particular children will have they pant easily. They would they will not do physical activity much. Then their response time usually goes quite slow. They will have yes, one very important point. They will have a lot of breathing issues, lung infections. They are prone to infections and cold very easily, and therefore it is necessary, and therefore it gives us an indication that let's get this thing done and rule out that what is the problem. And then the doctor says, oh, he has a hole in the heart, that way.
Okay, thank you, sir.
Welcome. Now there was this one child who always used to chew, and we always used to tell him that what have you eaten, tell me what is there in your mouth. And when he used to open the mouth, his mouth used to smell. And then we figured out that he suffered from a condition called as the esophageal reflux. What is reflux? So there is, whatever you eat, after some time it comes back to your mouth in the form of acidity. And these children, most of the Down syndrome children have this kind of problem. So parents here and the educators here have to ensure that they chew well and they eat, because they already suffer from a lot of oral issues. Chewing well and eating, they should not overeat. You should not accuse the child that he's eating something, because unfortunately these children suffer from these kind of problems. Also, because of these reflux issues, these children have a lot of acidity issues, ulcers issues. Why? Because the acid that runs in the esophagus, that starts causing the damage. These children also suffer from chronic constipation. Diarrhea is also very common. And 5% of the children often suffer from the celiac disease. Now, what is celiac disease? The moment they eat wheat. Now, in India, we eat wheat, right? So wheat has a lot of gluten. And when this gluten enters the body, it starts inflammating the intestines. And then the child suffers from a lot of constipation, diarrhea, and intestinal issues. So one of the ways to prevent this thing is make the child go off from the gluten diet. So it's called as the gluten-free diet. So this is also, you should know why your child is saying, I have a stomach ache, why your child is feeling that I have some kind of acidity issues. So the reason that I've got all these points, that you start relating, right? Next, we talk about the endocrinal disorders, thyroid, very common. So children
Madam,
with,
one question, sir, one question, sir.
yes,
Sir,
yes.
many of the Down syndrome children will have abdominal fat, more pear-shaped abdomen.
So
Cause
abdomen,
for it?
so, yes. So one of the causes would be lack of physical activity. Number two, you have rightly asked, you have asked me the question at the right time. The second question is about thyroidism. So children with Down syndrome suffer from a condition called as thyroidism, and hypothyroidism is seen in these children. So what happens? Children with thyroid issues are either too thin or they are too fat. So it leads to a condition called as obesity. And that obesity, because of less of physical activity, thyroid issues, children they tend to put on a lot of weight. Also, the insulin, which is produced in the pancreas, they also have difficulties. The hormones undergo some changes, and therefore they have difficulties with the growth hormone, and therefore if you see, they are very short in height. Short in height, one, thyroid problems, if they are always on the stouter side, not necessarily only thyroid problems, it could also be because of the lack of physical activity. So one of my child's parent, I still remember, she was behind the child's life to learn swimming, because swimming is a very good activity for muscle tone. For balancing, she used to teach this child pedaling. So if you see children at the age of 11 years, 12 years, they are also not able to pedal a cycle because of the poor muscle tone, because of these skeletal maturation issues, right? Okay, so physical area is done. Now we talk about the developmental area. This syndrome causes about a third of cases of intellectual disability. So if you see that a lot of children with Down syndrome have intellectual disability, which was also proved by one of the researchers in 2010. And because of this, they also suffer from delayed milestones. Delayed milestones are more because of the muscle tone. Okay, I'm reiterating this again and again, repeating this again and again, because the milestones are very important and they are closely related to the child's muscle tone. Let's jump into sensory modalities now. So children with Down syndrome, their ear structure is in such a way that predisposes them to hearing deficits. Okay, they suffer from a condition which is called as the inner ear. I'm sure everybody knows that we have 3 ears. There's a picture given there. The external ear, then the middle ear is called as the ear drum, and the inner ear, which is the cochlea. Okay, so the internal ear is narrow in children with Down syndrome. Sorry, one second. Hearing problems are found in 50 to 90% of children with Down syndrome. So it is very important, again, as educators, professionals, ask and educate the parent, please go and get an eye test and the ear test done every six months. Because you look at the next point, they suffer from a condition called as otitis media. Otitis media, which means the middle ear infection, the eardrum infection, which is seen in 50 to 70% of the children. Okay, and the liquid oozes out, the pus oozes out, and the child shows temporary hearing loss. So therefore, I have covered up this point that if you are putting your 100% to teach the child, but if the child is silently suffering from hearing problems, then your efforts goes for a toss. Vision problems. So again, 38 to 80% suffer from vision problems, and see the kind of problems that they suffer. Start relating to your kids. 20 to 50% have strabismus. What is strabismus? In which 2 eyes will not move together. Okay. People, can you please go on mute? Yeah. Two eyes do not go together. So one eyeball is fixated in the center. One eyeball is stuck in the center and one eyeball is gone at the corner. Cataracts are very common. So if you see so many children with Down syndrome suffer from low vision, and that low vision is because of the cataracts. Glaucoma, in normal people, it happens after age of 40 years, but here it happens very early. So you have to keep on telling the parents, go to the doctor every 6 months and 1 year because of these issues, because they are spending time, money, energy, and so is the educator. So you should keep this thing in mind. Ear wax is also common. So their ear should always be clean. And here comes a point. Because of this hearing loss, these children suffer big time to pick up speech, language, and even understanding of the academics. And therefore, these children usually fall behind because hearing being one of the issues. All right. Yes. Now the gentleman who asked me the question about speech. So in connection to his question, one of the reasons could be you have to first rule out that whether the hearing is going well or not. Number two, stuttering and cluttering occurs in 10 to 45%. So it is a request to all the audience here. Do not run behind the child's clarity. I see so many parents, sir, he's able to talk, but when will he speak clearly? Why do you want him to speak clearly? Our entire idea has to be that the child should express himself. Okay. Second is, they will not be able to talk like you and me. And why is that so? Because they suffer from intellectual disability and the intelligibility, which is how well you understand the speech, how well you understand turn taking, how well you understand what the other person is talking, shows greater limitations in this area, right? Individuals with Down syndrome have better language understanding than ability to speak. So everybody reflect. I'm sure you must have come across children who self-talk. And why do Down syndrome self-talk? One of the reasons here is that they are able to understand the language properly, but they are not able to speak. They are not able to match up that pace. So they keep on talking to their self. So don't stop, because somewhere it is helping them to relive whatever he has heard. So again, one of the takeaways for today. 10 to 45% either have a stutter or a rapid and irregular speech, making it difficult to understand them. So if there is a stranger, the stranger will say, what? I didn't understand what your child is saying. It is because their speech is very fast. And you see I come across so many parents who say, sir, when he was small, he used to talk so much. But now as he's growing big, he's not talking that much. Why is that so? And here comes the answer. In the second paragraph, delay in speech. So in the developmental process, this child has picked up speech very late. And the silent speech. And what does the silent speech cover? Thinking, reasoning, and remembering is not developed only because he has picked up the speech late, and therefore he is not able to hold a conversation. He is not proactive in his conversation, and therefore there is a lot of social rejection by the other children, because the other kids would want reciprocation. They would want that my friend should talk, and when this particular Down syndrome child doesn't talk, the other children drift away because there is no reciprocation. So talking is a function of thinking, right? And lastly, research says that Down syndrome experience a significant difference between what they understand and what they're able to communicate, and therefore they are silent talkers. They are self-talkers, sorry. They have difficulty mastering many rules for talking in grammatically correct sentence. So I'll again share one example. One of my parent, she says that, sir, I want my child to go to America. She should study there. So see, first of all, there is no acceptance. Okay. And then she should be able to talk well in English. She should be able to form grammatically correct sentences. Unfortunately, a child with Down syndrome with very limited intellectual ability will be able to form sentences because grammar is incorrect. How will they say? Look at the second paragraph. They will only speak in short telegraphic speech, need-based language. If you keep on pestering the child, talk in full sentence, talk in full sentence, the child will start drifting away. The child will not like to talk. So this will backfire. Your child will stop talking. So and don't keep on working on the pronunciations, because the more you correct the child, more the child will go into the shell. Okay. And then God forbid, but if something happens to the child will not be able to express well. So therefore focus more on the expression rather than clarity. Quickly, ma'am, how much time do we have?
Can I ask you one question here?
Yes, yes.
Yeah, here I am thinking that their dental structure and the muscle tonicity of the tongue and hierarchical palate and the short neck and the weakness in the chest muscle also is the one of the important cause for speech producing accurately, I think.
Thank you very much. Thank you very much for getting this point. Yes, you rightly said, sir, that this is one of the important contributors to speech. Perfect, perfect. Neurological. 5 to 13% of children with Down syndrome have seizures. They suffer from convulsions. They have fits. So always keep a track. What kind of fits are they suffering from? If the child starts forgetting, if the child doesn't remember what you've taught, this is the answer. That because the child has this problem, therefore, how much ever effort you are putting, the child is not able to remember. Some children also at later age suffer from Alzheimer's. And this increases as the child grows, and dementia also, right? Let's quickly jump to the psychological area.
Mihit,
So
you have another 15-20 minutes time. You can take more
perfect,
off.
perfect.
Okay.
I will be done by then, sir.
11:30 or so, 11:15,
Yeah.
11:20, 25. Okay, thank you.
Yeah, thanks, sir. So mental health and Down syndrome, if we check out this area, 30% mental illness is seen in Down syndrome. Down syndrome children suffer from these following conditions. What are these? Anxiety. What kind of anxiety? The anxiety that we put in our children. Talk properly, sit properly, behave properly.
Bhagyalakshmi garu, మీరు మ్యూట్ చేసుకోవాలండి. Okay, thank you.
They have some kind of repetitive and obsessive compulsive behaviors. So they keep on moving the pen, they keep on moving their legs, they keep on scribbling something, they keep on self-talking. Inattention is one of the major problems seen, and I'm sure each one of you will concur to this fact that inattention is a major problem in Down syndrome. They also have sleep related difficulties because they have problems in breathing. Okay, they have problems with the adenoids, which means that there are some kind of formations in the nose and they have difficulty breathing. Depression. Okay, because there could be a lot of comparison in the family, comparison between other children, so they are not that poor on their intellect that they don't understand. At times you also see autism spectrum in Down syndrome, and a lot of cognitive skills starts deteriorating day by day because of the inattention issues, right? Next area is behavioral. So when research was conducted, they show Down syndrome children had more behavior problems. Why could be that so? One of the reasons would be they are not able to express themselves well, right? So as parents, as educators, as teachers, as professionals, you should start finding out ways where the child can express himself well. One of the ways would be the AAC, alternative augmentative communication, where the child uses keyboards, the child uses cards, the child uses the PECS, picture exchange communication system. These are all the different ways where you should encourage the child to express himself. And you will automatically see that the behavior problems have start coming down. A lot of behavioral strategies works beautifully with Down syndrome. The schedules of reinforcement, which is the fixed schedule reinforcement, the variable schedule reinforcement by giving rewards and punishments can really work well. Older adults show fewer externalizing symptoms and subtle increase in withdrawal. Very, very important point. As they grow, they start withdrawing. They are very scared. They are very loving people. Loving children. They love water play a lot. Okay. The more you talk to them, the more comfortable they feel, they will talk. The more critical you are, they will start shunning away. The more angry you become with them, the more they will withdraw. So this is one of the takeaways for all the professionals here. Let's cover the next point, socio-emotional. Children with Down syndrome between the ages of 4 to 12 show deficits in social cognition and executive function. Again, an important point. Executive functioning means what? Thinking, problem solving, memory, decision making, conflict resolution, attention. All the prefrontal lobe activities are executive function. And that is majorly affected in children with Down syndrome. Okay. If we have only limited ability to talk, we will be more isolated from others, and therefore our social and emotional lives will also be impoverished. People will not like to talk, right? So this get into self-talk. Depression in people with Down syndrome is rarely verbalized. How will that child know? I am facing crying spells. I am not feeling hungry. I feel like dying. How will that child verbalize? And therefore the child only keeps on crying, and there are a lot of mood changes in these children. So here, as a very sensitive professional and an educator, you have to have that kind of an eye to check that what is bringing changes in the child. You cannot change the child. You have to change your approach. Okay, and therefore the child will start changing. Lastly, we move on to a very important area, scholastic. So let us see the research in this area. Individuals with Down syndrome may learn better visually. This is my experience, and I would also like to add, which I could not find much researches on. They also learn better with gestures. Okay, so you can try, and if somebody has tried, you can share once we are done with the session. So visual learners and gestural learners are, I would say, the best kind of learning that they could have. So start changing your approach. Drawing may help with language, speech, and reading skills. So when I talk about drawing, if you draw something for the child, it will improve their comprehension skills. If you take a child through an IQ assessment, you will also see that these children suffer from mild to moderate learning disability. And why is that so? It is because of 3 reasons. 1, their intellectual capacities are limited. 2, they have attention deficits. 3, they have visual and auditory perception issues, and therefore they have mild to moderate learning disabilities. So you have a diagnosis, especially in cities like Mumbai, because recently I was attending one of the conferences in the northern part of India, and our sir who was teaching us had this thing to say that no, learning disability is not a diagnosis in children with intellectual disability. Okay, but in cities like Mumbai, we give a diagnosis where there is learning disability and where there is intellectual disability, both together. So you can see features of learning disability, right? Down syndrome and IQ. This is also one of the hot potato in the field of research. Usually, and in my 14 years of practice, I must have dealt with more than 100 Downs, and I could see that most of them had an IQ between 50 to 70, which is in the mild intellectual disability range or in the slow learners range. So their mental age is around 8 to 9 years. Now, trust me, I'm sure each of you will concur to this idea. When they are small children, they pick up faster, they talk better, but as they grow adults, they start deteriorating. And one of the reasons is that the adults feel or the caretakers feel that there is not much scope. And why there is not much scope? Because the professionals and the adults focus shifts, because our entire focus is education. No, the focus has to be more vocational training. That's the key word for today. Next, children with Down syndrome have different kinds of IQs. We'll just run through this: mild IQ, moderate IQ, and severe IQ. Everybody knows about this. Children with mosaic Down syndrome, again answering to the gentleman's question, they definitely are 10 to 30 points higher as compared to the T21 children. Okay, as they age, people with Down syndrome start performing worse than their same age peers. So again, the parents feel more dejected that now my child is deteriorating more. One of the interesting studies in 1985 by Sharav, who says that maternal education correlates with higher developmental scores. So if the mother is educated, you don't need to teach them which is the highest peak of India. No, but some basic things like what animal gives us milk. Okay, how many fingers are there in one hand? How many grams are there in 1 kilogram? And how many 50 rupees notes make rupees 100? So any mother can teach this. So maternal education plays a very important role. This last research, which I somewhere do not agree with, maybe because I have not come across these kind of children, female scores higher in IQ than males, because I have had Down syndrome boys who are so sharp, intelligent, verbal, and they have scored much more higher as compared to girls. So my experience here is different. So again, everybody's confused whether they should go to a normal school or a special school. So there is a lot. So the new education policy, NEP 2020, the Right of Person with Disability Act, stresses a lot of importance on inclusion. But how much inclusion actually is practiced? That's the question, right? If you have a school where inclusion is practiced right from the time the child enters the school bus or enters the school gate, in the canteen, in the classroom, in the sports playground, then I think that's beautiful. But if it's just for namesake, then it is always better to be in a special school. One of the interesting findings in 2017 says what the teachers have to share. The teachers said that if we receive targeted information about the child with Down syndrome, if the teacher is aware about what is Down syndrome, the problems, okay, if the teacher gets good support from all her colleagues, if the parents also understand things well, then it is better to work in an inclusive setup. So one of my parents, whom I have been counseling for the last 10 years, but I have failed. The parent is asking me a question because the child completed her 10th standard with the help of a writer. And we all know, and I know this very well, that the child cannot even answer how many fingers you have in one hand, and the child has passed 10th standard. So with the help of a writer, the child has done this. The mother is telling me, what course should I take up after 10th standard where my child can teach special kids? So number one, no acceptance. Number two, I want her to become a choreographer. Number three, the reason I'm asking all this is because once she becomes a choreographer, once she becomes independent, so I can get her married. Okay, so she becomes independent and her people in her in-laws house will feel that the girl is independent. So imagine that there is something that we have to start from the scratch because the mother is not ready to face this grave problem which is lying up on the surface by when the child is already 17 years old. Students with Down syndrome face many problems and hurdles in their learning because of the IQ, because of the memory problems, communication, behavior problems, and distraction, right? And to sum up, I would like to quickly jump on early intervention. So why early intervention and when should it be done? Especially, it should be done shortly after birth and usually should continue until the child reaches the age of 3, because in the early formative years, the early intervention helps big time. There are physical benefits if the child undergoes physiotherapy. So what does the physiotherapy teaches? So there are so many parents who ask us why physiotherapy we have to do, why we have to do special education. The reason is because the physiotherapist will help us to make the child turn over, crawl, reach different objects, and most importantly, address the muscle tone, which is one of the burning problems in children with Down syndrome. How will a speech therapy helps right from the time with imitating sounds, breastfeeding, getting clarity in speech, remembering new words, improving comprehension, the AAC, alternative augmentative communication. Okay, when should we start speech therapy? So the good time is when the child is 9 months old. Okay, children with Down syndrome are good at learning gestures, as I said. So learning sign language would be a wonderful technique, but encourage sign learning only when you feel that there is not much scope in picking up language now. Just for you to make a note, by the age of, so the window period of getting speech is still 11 years. Sorry, till 8 years. So till 8 years, the child will get speech. Till 11 years, the child will develop communication. After 11 years, try sticking more to the AAC. I'm repeating, alternative augmentative communication, which is the next point. And lastly, Down syndrome and occupational therapy. Parents always feel, why do you need occupational therapy? What is the need? We only make him do all the ball activities. No. The occupational therapist also teaches your child a lot of self-care skills, which is activities of daily living, how to count money, how to use money, how to use a calculator, how to wear an underwear, how to hold a pencil, how to go out and do shopping, how to make billing, how to teach profit loss discount. Please write down what is important to teach: time, money, clock, calendar. Okay, basic functions of banking, and addition, subtraction, multiplication, division, profit and loss, discount, interest. If your child knows this much, your child will be able to survive very well in the society. Okay.
So functional academics.
Functional academics, yes. Very important use of hands. So always encourage more of bilateral hand usage, using both the hands, and do not fail to address the visual and the auditory perception, because visual and auditory perception plays a very important role when we are building the child's overall development of the child with Down syndrome. So thank you very much. I hope the session has benefited all of you.
Sir,
And-
just cover about the translocation downs also, sir. Just 1 minute. 1 minute, just cover that also.
Yes, so translocation Down syndrome, again, we see this one particular chromosome gets separated from one pair of chromosome and attaches itself to another set of chromosome. Okay, so therefore it has translocated itself not on chromosome number 13, 18, and 21, but onto the other number of chromosome, autosome, and therefore we call it as a translocation Down syndrome. And the kind of concerns that we see with translocation Down syndrome are all similar and identical to the mosaic Down syndrome and the T21 cases. Right.
Okay,
Thank you so much.
Thank
Any
you,
other
sir.
questions, please? Oh, Mihir Parekh ji, you are really excelled. You are
Oh, thank
enthralled
you,
us, and I appreciate your committed learning and committed sharing. Whatever the knowledge you acquired, you are sharing it in a brilliant way, very pragmatic, very positive way. You elaborated the medical, technical, anatomical, physiological, psychological, and physical, whatnot, every aspect of it in a very big, beautiful nutshell. And I should confess, as a sportsman, as a science student, I really learned. It is a good eye opener, and I am able to, for on my behalf and on the behalf of all the special educators, on behalf of the organizers and coordinator Mandramna Madam and Department of Psychology and Vice Chancellor and others, I appreciate your really resourceful and very penetrating positive messages and information which you have given. And you have very beautiful depth of knowledge and with commitment to help others. God bless
Thank
you.
you.
And I am remembering Atul Parekh, a renowned table tennis player, who is having as good concentration and confidence as you are having. I know him,
Sir,
but
Mani,
he doesn't know me.
Kishore sir, Maniramana madam ni malli in cheyandi.
Okay. Maniramana madam. Yo.
Excuse me, Mihir Parekh sir.
Yes, ma'am.
सर आप जो बताए हैं ना अभी चाइल्ड का, मैं एक डाउन सिंड्रोम चाइल्ड को ऐसे ही क्लास में बताती थी। वो क्या है ना, मेरा कॉपी करती थी, मतलब जैसे वो नीट से नहीं आती थी, एकदम गंदा, बाल नहीं ठीक से करना, ये सब मैं ठीक से तैयार होकर आने से मेरे पास में ये करती थी। फिर बाद में धीरे धीरे उस बच्चे में काफी, मतलब चाइल्ड में परिवर्तन आया है, मतलब नीट से तैयार होना, अपना लंच, हम लोग लंच लेने वक्त खड़े होकर देखती थी कैसे खा रहे हैं, क्या है, वो भी वैसे ही खाने का कोशिश करना, नीट से रखना, अपना बिलोंगिंग का केयर बहुत अच्छा लेती थी। थैंक यू सर, आप आज जो नॉलेज दिए ना उसमें बहुत सारा हम लोग को नया टॉपिक मालूम हुआ है, वो हमारे वर्क में हेल्प होगा। थैंक यू सर।
Thank you.
Sir, I am Dr. Krishna Kumari. Very excellent presentation. A complete picture of Down syndrome, sir. Very nice presentation,
so much,
sir.
ma'am. Thank you so much.
Beautiful.
I got a chance to listen to you, ma'am, yesterday for a very brief time. In fact, since the conversation went in some other language, so I messaged Dr. Manirama ma'am that sorry, I couldn't comprehend the language and then I had to leave. But I could actually catch up the keywords, so it was very nice listening to you, ma'am.
Thank you, sir. Thank you very much, sir.
That shows your in-depth commitment and responsibility towards these people.
Thank you, ma'am.
You are serving. I should call you as a service warriors.
Thank you, sir. Thank you.
Thank you,
Sir,
sir.
Dr. Parekh, sir, I would like
Yes.
to mention few words. Sir, Kishore sir, can you hear me?
Yes, we can.
Yeah, yes. Sir, actually, you spoke about Down syndrome. Full thing, you gave a complete 100% picture about it. And you know, the education system and all will take care of individualized abilities by taking into their individualized abilities. But you dealt with hundreds and thousands of Down syndromes, but I dealt with some tens, okay, handful of students. I always look in the point of view of the special educator, how this the special educator must think before helping the Down syndrome child. Sir, what I feel is, suppose for Down, how we have syllabus for medical people, how we have syllabus for engineering people, like that, with a little variation, we know who are Down syndrome, and we have identified in the fetus itself, they could identify now. And you know the lifespan of the Down syndrome, how much it is,
Yes.
and if a lot of care is taken, how long they live, everything we know now about Down syndrome. I feel we have about 99% knowledge now, both physically, mentally, emotionally, psychologically, and everything. We can say that is a race of its kind, with always happy moods and all. Usually they keep smiling, and also they enjoy the music. They dance. If you go to any institute who are looking after differently abled people, the entertainment committee consists of Down syndrome children.
Perfect.
Mostly.
I agree.
They entertain a lot. So what I feel is, instead of parents thinking to get married because they cannot look after their children again. See, marriage is with responsibility, no? So if you write like no sir, if experts like you join and you can add me also, we will write a book of syllabus for Down syndrome, and we like no sir vocational guidance instead of wasting time in identifying Down syndrome again, analyzing and all. From the day one itself, once we identify the Down syndrome, from day one, if we start along with the self-help skills and other skills, vocational skills also, what we can do is we can train them in some vocation where they can enjoy rest of their life. They need not depend on somebody else. And we can organize, like develop organizations and also funding where these people know, sir, in suppose bakery or anything easy vocational things, assisting somebody in the kitchen, like that.
Yes.
So we can train them, and from the day one, instead of wasting time on parents' expectations. See, parents, they don't accept the reality.
don't.
It takes time, but it is the scientific field, the education field, which has to accept it and create a world for him before his birth. That means we are like no, we are having a goal to reach for every Down syndrome child, because we know their limitations. So what I feel is we have to prepare a vocational book for them, and also we have to identify physically, mentally, emotionally the skills which they can acquire. And as you said, they by seeing into our eyes, no sir, they take suggestions also. If you say dance, they will dance. This by seeing, no need of telling, listening to us. They seeing our face, we are enjoying, they enjoy. So like that, we can prepare a book, I think, sir, for them to develop in a some goal-oriented book. That is what I feel, sir.
Yes, ma'am. I'm very much in for the same. So, I mean, after this, let us start working on that thing too. So, whatever, to the best of my capacity, I will definitely contribute.
Kishore sir, I
Yes,
want
sir.
to ask you one more question, sir.
Yes,
Sir,
yes,
I want to join with you in that aspect.
yes,
Okay,
ma'am.
sir.
Me too, ma'am. Thank you.
Madam, your
Because
intellectual interventions, I'm really thrilled. You both can talk with each other in depth, and most of us would love to see that a book is published. Great gesture, madam.
Kishore
Yes,
sir, I want to ask
it
you
is not
one
the
more
book,
question,
sir,
sir.
like skill development, sir. For them,
Yeah.
it is
Yes.
vocational skill development. Like.
Yes, madam. Yes, madam. I appreciate your gesture,
So much
madam.
research
Excellent.
is done already,
Excellent,
but
excellent, madam. An
but so much
intellectual,
time is getting wasted for
an
the child.
intellectual approach towards a more pragmatic way, which will have an impact on the uh, Down syndrome.
Krishna Kumari madam
process.
wants to speak something, it seems.
Yeah, madam.
After
Kindly
Krishna
be
Kumari
brief,
madam,
madam.
we'll
We
go
have
to
we are running
power
short of 15 minutes
sir.
time, madam.
Yeah. Very brief. Very briefly, I will ask one more question to Kishore sir. Sir, you didn't cover about the fertility rate of Down syndrome in children, sir.
Yeah, about their sexual life, family life.
Yeah, fertility rate also, I read it in some research articles. There are a lot of interesting factors. So please just share it 2 to 3 sentences at least.
Okay, so quickly I'll speak about it. The fatality rate in children with Down syndrome have greatly reduced because the advancement of science and technology are taking care of this. But at the same time, we also see that they are on the risk because they suffer more from the congenital heart conditions. So that is something that we cannot overlook. Number two, with regards to their lifespan, one of the researchers say that apart from all the other disabilities, children with Down syndrome have good lifespan. So they go up to the age of 60 to 65 years, or 55 to 60 years is their lifespan. With regards to sexuality, girls show more. So both of them definitely show delay in their physical growth and maturation. However, women are seen more fertile as compared to males, and I think the childbearing capacity in male is I think it's not there. and women have poor childbearing capacity for the reason being that the woman doesn't know that how to take care of herself. So that could be one of the reasons that we can attribute to their poor sexual life. Yeah.
Okay.
Sir,
Actually,
sir,
I am observing that monarchy is getting in the exact time only, sir.
Yeah, they get it at the right time, but
Pawan
how
Kumar,
do
yeah,
they
yeah.
handle that? The hygiene and all becomes a big challenge for these children.
Okay, sir. Thank you very much, sir.
Sir, Pavan,
Welcome.
Pavan sir is ready, sir. Kishore.
పవన్ కనబట్టలేదు మేడం ఇక్కడ.
sir, excuse me, sir.
Ma'am, good morning.
పవన్,
He is there.
yeah,
Mani madam, Kishore sir, good morning.
Sir,
yeah, good morning sir.
Parekh sir, Dr.
Welcome.
Parekh sir, thank you very much for your excellent
Most
Excellent Parekh ji.
information about Down syndrome.
Thank you so much. Thank you to all the lovely audience for listening to me. Thank you so much.
Sir, one question is there, sir. Sir,
Yeah.
why does children need more, sir? Down syndrome. Why
Yes,
these
madam.
children? Why these children need more, sir? More food they use to take.
Sorry, I'm not able to hear her.
Any eating disorder is there, sir, in these children?
Well, eating disorder, as I said, that the gastroesophageal reflex is seen in children, but there is no specific disorder of eating like the anorexia or bulimia as such. Children usually overeat because maybe they are suffering from any other mental health issues. Therefore, they are eating a lot, or maybe because of the endocrinal dysfunction that is that can also interfere with their eating habits. So therefore it is necessary to rule out that also, but no specific findings on eating disorders as such, or maybe if I have missed.
But actually, chewing problem is observing, sir.
Yeah, that is because of the dental problem.
And dental problem and the high arch palate also, sir.
Yes, and overcrowding of the teeth.
Thank you all of you. May I intervene kindly,
Sure.
Parekh ji. If so people are having any questions, you can keep them in chat box. I request Parekh ji for once again, I congratulate him for his extraordinary presentation. He is connecting genetic till the end of the life and everything of Down syndrome student. Thank you, sir. God bless you with everything excellent. Now, I once again coming to another highly resourceful person, ever smiling. He keeps whatever the theory he learns, he keeps into practice. That is Pawan Kumar Bada, a certified cognitive behavior therapist in anxiety, personality disorder, and depression from Beck Institute, Philadelphia, USA, in association with distance learning, professional continuing education by the Institute of Better Health, formerly IAHB, Santa Rosa, USA, approved by the American Psychological Association. His achievements include intensive leadership training from University of Minnesota in inclusive education and award of excellence from International Association of Education for his work in inclusive education and special education involved with learning disabilities. Our appreciation and kudos to you, Pawan, for your excellent accomplishments. I should say they are not achievements, they are qualitative accomplishments also. He is currently working as assistant professor in CDVL, Jain University, Jain University. He was PhD scholar who had investigated and identifying protective factor fostering resilience among persons with locomotor disability. He has attended one international internship, American Disability Act Leadership Training Program for Inclusive Education, April-June 2017, organized by University of Minnesota and Arizona State University sponsored by United States government. International scholarships, he has Magnus Kappa Scholarship for attending International Conference IASC Australia 2017, member in IASC International Association of Special Education, associate member in APA American Psychological Association, an international affiliate membership, National Positive Psychology Association New Delhi, and luckily Pavanji, even I am a member of American Psychological Association too. Internship supervised May 24th to 27th June 2012 4 students from hospital universities of Geneva, Switzerland. June 15 to 20th September 2019, 9 students from AIESEC, International Association of Students in Economic and Commercial Sciences, January 2012, 6 students of 3 professors from Buena Vista University, USA. Sports, 2013, certified coach for Boschia game, trained and certified B. Jaspal Bennett, special ability sports coach, Canada. Participated in 2013 district level sports Special Olympics, Bharat. At Bharat. Yeah, you are very dynamic and you look like a real sportsman in your approach, in your attitude also. Best. He has 9 research publications. Best Researcher Award at Indian School of Psychological Association International Conference. Projects, International 2 projects and National 2 projects. Papers presented are more than 18 papers. Workshops and seminars conducted 6 seminars. Workshops attended 18. As a resource person, as a speaker, is a you can see is a eloquent speaker also. Consultant at Army Defence Academy, Gopalpur, Orissa. Leading transformational change at National Conference on Inclusive Education organized by Aditya Vinaya University, Rajahmundry. And 2012 volunteer ventura conducted by Global Aid topic active volunteering, and the volunteers also, as we can see from now, building a better understanding in disability and active rehabilitation conducted by ability people topic assistive technology and independent mobility. University exhibition 12th to 16th September 2011 participated in Andhra University academic exhibition with working model entitled Stress and Counseling, and he got a letter of appreciation also from Emina Dominic, Vice President, Ability 360 Disability Resource Center, Sports and Fitness Center, Arizona, USA, a very reputed organization. Don Lyven, ARC, Minnesota, Advocacy and Research Center for Persons with Disability, Minnesota, USA. Dr. T.V. Sairam, President, NADA Center for Music Therapy, New Delhi, for PAPA, President on Music and Psychology, and actively participating in Raga Therapy for Leben Shelfie. This is also a penetrating organization which is having a positive impact on disability. Currently is teaching by State Department of Psychology, Andhra University, Visakhapatnam, 2014 to till date. November 2011 to 2018, lecturer in psychology at Care Voltaire College of Nursing. June 2011 to February 2005, psychologist, counselor and behavior therapist with Leben Shelfie, a special school for children with intellectual disabilities, Visakhapatnam. I feel proud to introduce Pawan. Over to Pawan, a great friend of all of us. And before that, Madam may say a few words about him. She knows him personally more than I do. A great friend to me too. Madam, unmute చేసుకోండి.
Sir, I know. Thank you very much, sir. Sir, Pawan is known to me as student also. And by seeing his knowledge and everything at that stage, first I invited him as resource person. So after that, he has grown a lot. Now, when I was looking for resource persons, one person is suggesting me, Madam, there is one person called Pawan, we called him. So like that, now he is growing very nicely. It is nice seeing, like no sir, like Pawan, like knowledgeable people growing. It's very nice, sir. Pawan sir, congratulations.
Thank you, madam. Thank you very much. Thank you, Kishore sir, for that patience reading of my all brief CV. I thought I had sent you my brief CV, but madam had given you my full CV, I think.
Yes, sir. We have to encourage you also. I know you are very young.
And madam is the first person who had introduced me as a resource person to the to this field of psychology and to this field of special education. Because of madam's blessing, today I had conducted more than almost like 30 to 40 different sessions with different people as a resource person. I thank you, ma'am. And I know Kishore sir, he is very dynamic, and I know him when he was a student at the Tanai University, and I never thought that anyone can do such a big contribution with the university for the society. Sir, I really applaud you, sir, because you are able to found a council.
We met at Nadavulu also, Pawan.
Pardon,
Sir, Pawan sir, Pavan later went to Australia and he got so many international awards. And within a short period, sir, with his abilities, he's having very keen interest in the knowledge and also very good helper. If you ask anything, he will do that. So that is the blessing for him, sir. He's very nice person. As a person also, he's very nice person. So he will come up in his life. I know that. Thank you, sir.
Thank you, ma'am. Dear audience, good morning to everyone. And today my topic is on research methods in rehabilitation. So this is more a theoretical paper than what we can say is not like a research, or this is more a theoretical paper. And I wish I will be able to help individuals who are much interested in doing the research or formulating a research while working with children with special needs. So to my presentation, can everyone see my screen? Kishore sir?
No, sir, not able to see.
We are not able to see. It started screen sharing.
Yes, ma'am.
It's in the process, sir.
Okay.
Started screen sharing. You have to share it, sir.
Yeah, I shared it, but here I can see, please restart screen sharing it.
రాఘవ కొంచెం హెల్ప్ చేయండి సార్ ఆయనకి వెబ్ మాస్టర్ గారు కొంచెం హెల్ప్ చేయండి సార్ యా ఇట్ has come. It has come.
Yes, sir.
Pavan, you are on the way. Good going. Carry on, sir.
So we are going to look at the different research in rehabilitation. This is pure theoretical paper and with a few examples. And in this, we are going to discuss about different types of research methods. Okay. So before going to like any further, I just like to share my views or the views of what is the meaning of rehabilitation. When we want to do research, we should be able to identify what we are trying to do or how we are going to proceed, and before that, why we want to do it. So if we want to do something, in which thing we want to do it. Sir, I can use a mixed language, right? Kishore sir?
Okay, sir, you carry on.
Sir, mostly try to use English, sir. Because
okay, no problem also. Even if it's...
Yeah, I'll be doing English, but
okay, sir.
Okay, ma'am. Okay then. So the thing is, when we are going to say rehabilitation is a process of restoration of abilities. So restoration means you have to pull the minimum abilities which were previously functional, or the things which are already existing and need a shape to become functional. Okay, so this is what to patients with an injury or disability, illness, to achieve maximum functioning and independence. So whenever we do a rehabilitation, we look forward for the people's maximum functioning. So they must be able to perform to their fullest, and they should become independent. So both we look for. So this is what I feel the meaning of rehabilitation is. That is restoring the abilities and making an individual to function to his fullest towards independence. Okay. Now, how we define disability studies? We can define disability, but what are disability studies? Disability studies are multidisciplinary approaches. So they are always work in different directions, not only in one direction. They may not be psychological, they may not be physiological, they may not be cognitive, they may not be sociological, they may be also political issues with in relation with the disability studies. social studies are there. Okay, all theoretical and empirical things are there, legal and biomedical, technological. These are the different areas what we try to study when we are doing a disability research or disability studies. So today morning, sir was explaining about Down syndromes, different dimensions of Down syndrome. Yesterday afternoon, one madam was discussing about autism and different spectrums of autism. And yesterday in the morning session, Revati madam was discussing about ethical issues and different types of ethics, norms, and consent forms, how we have to follow, and all these things. And in the yesterday's morning, one more sir, he was speaking on a research. What is research? How we conduct research in disabilities in actual school settings. By working in a school, how we can do the small minimum research methods. But in this presentation, we are going to see how to formulate it theoretically, to present a paper, or to publish a paper, or to publish an article, or to find out whether your intervention is working with all the people or only with some people. Okay, so for that, making into a theoretical one, making into a very standard or what we can very significant way of doing research, we are going to see. And when we are doing this disability studies, it also involves in empowering and evaluation of persons' experience of persons with disabilities. So we try to empower them, and also at the same time we try to evaluate them, evaluate the individuals, evaluate the individuals' experiences. See, every experience matters. Okay, every small experience of a person with disability matters. So how they are feeling. If you go for any foreign countries, they say not the name, but the people first. That is why we call people with disability. Disabled people is replaced by word called people with disability, because this focus should be person first, not the disability. So the experience of the individual has to be evaluated towards empowering the individual. So in this case, our research should focus on the empowerment of the individual in view of evaluating the person with his experiences. This is also we call it in research terms, we call it as a retrospective study. Retrospective study, that means studying the experiences or studying the past events which had built the individual's future objectives. Right? సో మన పాస్ట్ ఎక్స్పీరియన్సెస్ బట్టే మనం ఫ్యూచర్ లో ఏ పని అయినా చేస్తాం. సో ఆ పాస్ట్ ఎక్స్పీరియన్సెస్ మనం కంపల్సరీగా ఎవాల్యుయేట్ చేస్తేనే ఫ్యూచర్ లో ఆ పర్సన్ ఎలా ఎంపవర్ చేయాలన్నది మనం చేయగలుగుతాం. ఓకే, the next concept is research rehabilitation science. How do you call rehabilitation as a science?
We have Pawan, one second, Pawan.
Yes, sir.
Kindly adjust your speaker. Your voice is not audible. Number two, may I invite sub collector from which place I don't know to the August audience. He or she has come just now entered. May I request the sub collector to mute or introduce themselves. Thank you. There is a normal name has come in as sub collector. Okay, I heartily welcome her or him on our behalf. And Pawan, you kindly keep your microphone or something like that so that your voice is audible, right? Thank you, Pawan.
Sir, now it's audible?
Your voice is not clearly audible. So it's a
Now,
small
sir?
disturbance is there. Kindly adjust, okay?
Give me
Carry on,
one
Pawan.
minute. Yes, sir.
Hello?
Yes, sir. Yes.
Hello? Pawan?
Hello, sir.
Yeah, now it's audible, right? Carry on, please.
Sir, can you hear me?
Yeah. Carry on.
Yes, sir. So now we have defined previously what is a disability studies. Okay. Now we are going to define what is rehabilitation as science. Or we should see, we must be, rehabilitation is not empowering one individual. Rehabilitation is empowering each and every individual having disability, supporting disability, working with disability, or working with people with disability, working in the environments of the disability, environments, not only working, but also the environments where the persons with disability are functioning. Okay, so all this together comes as a rehabilitation science. So it encompasses the basic and applied aspects. So what are the basic aspects, or what are the applied aspects? The science, the health sciences, social sciences, engineering sciences, all these different fields together becomes a applied or or basic aspects of this rehabilitation. Now, why this rehabilitation science is used? To restore the functional capacity in a person and improving their interaction with the surrounding environment. So what rehabilitation always focuses? Rehabilitation always focuses to make the individual to include the individual with the disability in the society. That is what we call rehabilitation. Now, what is meaning of in the society? Not taking him to some function hall or a open place. That is making him to able to access all the areas in the society, making him to capable to get interaction with the all the areas in the society. So that is what the interaction, that is what rehabilitation means. Now, how it becomes science? Science always is giving a proof or a reapplicability. What we call is a reapplicability. If anything can be reapplicable, only then we call it as a science. So rehabilitation science makes the individual's functional capacities to be restored with interaction with the surroundings and the environments. Okay, and understanding the nature of enabling disabling process. So how to enable an individual and how to disable his barriers. We have to enable individual, and we must also able to disable the barriers or the obstacles what the individual faces. If we are able to do it in a systematic process, then we call it as a rehabilitation science. Okay. Now, what are the different principles of rehabilitation science? Rehabilitation should begin during the initial contact with the patient. So when we start contacting the patient or the client, our rehabilitation process should start. So when I was working with Arizona State University, I asked the faculty over there, like how will they get the information about the persons with disabilities. So what happens is, when they enroll into the school for the first time, their information will be distributed among all the different associations or organizations that are working with persons with disabilities through the web portal. When they just enter the information that this person is having some form of disability. So the network where like now we have Aadhaar card. Okay, if we enter our Aadhaar number, we will be known all over the India. Wherever you go, anyone can. Like that, whenever a student gets enrolled into a school at the age of 3.5 years or 4 years, or pre-primary school, his information is distributed toward all the different organizations which work with children or people with disabilities. Okay, and the emphasis of rehabilitation is to restore the patient the independence and pre-illness and or pre-injury level of functioning in as short a time as possible. So at the shortest time, we must be able to restore or rehabilitate the individual. he must rehabilitation. The meaning of rehabilitation or the principle of rehabilitation is making him active participation, motivating the patient and helping him to attain social independence. So if we are able to motivate the individual and and make him to attain social independence, we can say that we are making him rehabilitated. And the focus is on needs of groups of people with specific conditions. So the rehabilitation focus is always very specific to the conditions of the people with disability. And every patient has a right to the rehabilitation services. Not only individuals with physical disability or born disabilities, even individuals with or individuals who have been disabled. Okay, now scope of rehabilitation research. Now, what is the scope of rehabilitation research? First thing is to repair. So, why we do rehabilitation research? Because we want to repair certain things. The basic research to repair ancestral. Hello,
Pavanji,
sir.
Pavan, is there any problem?
I think I got disconnected totally.
Okay, get back. Don't worry. It's all. I was telling the other day to err is computer, to forgive is human. You youngsters are well versed with technological advancements.
Yes, sir.
Okay, Pavan, carry on.
Okay. My screen. Can you see
Yeah.
my screen, sir?
Yeah, it's a screen is seen. Yes,
Okay.
carry on. Don't worry. Yeah.
Yeah. So the scope of rehabilitation research is, first one is to repair. The second thing is to replace. What do we replace? We try to replace the physical body parts with the artificial body parts, or we try to replace the assistive devices, okay, with the physical normal functioning or abnormal functioning parts of the individual, okay, or the environments. Even the environments we have to replace, okay. So where we have to make an individual to access the society. So this is what helps us to in rehabilitation research, replacing one aspect what we do. And restoration, physiological functioning, we try to restore the physiological functioning and social interaction or integration, okay. So including return to work. When you say replace, okay, in US countries, they replaced the slides or incliners with curb cuts. Individual can move with a wheelchair on the road, from on the road to footpath, okay. So that is what we are trying to replace. So replacing the small gap between a height and the lower part with a curb cut. We call it as a curb cut, where it is a C-type cut, which will join the road and the footpath with a single thing. Okay, so they replaced all those things. We are also nowadays in India also, you can see different places where there are accessibility resources for the people with disability. These are all things for making individual to more access. And the third one is restoration. Restoration means when we use it, we have to keep it back, or we have to restore the lost physical functioning.
Check your microphone, Pavan. మీ దగ్గర నుంచి మాట్లాడితే బెటర్ ఏమో.
If you say a person with normal mental functioning has went under depression. Microphone, sir. Up and down. Hello.
కొంచెం దగ్గరికి కానీ కొంచెం దూరం కానీ కొంచెం అడ్జస్ట్ చేసుకోండి. వాయిస్ ఒకసారి కట్ అవుతుంది. క్యారీ ఆన్ సార్, పర్లేదు.
అచ్చా. Okay. So restoration is physical functioning or social integration. Okay. So the next concept is, what is the mission of rehabilitation research? To discover knowledge and create innovation. So first thing is, when we are doing rehabilitation research, we must be able to discover knowledge and create innovative ideas. For whom? To the persons, their families, communities, and their workplaces. So rehabilitate a person.
Webmaster, kindly help Pavan. Pavanji.
Sir, there is a rain here, so there is a network issue.
Yeah, I know. Everyone is facing
Hello?
the same thing. Right. Carry on. Zooming around.
Okay.
Yeah, carry on, Pavan.
Zooming
please.
around, yes, sir.
Over zooming. Take the literal meaning of it. Yeah. Okay.
True.
Hello.
Or rehabilitation research. Hello. Can you hear me, sir?
Yes, sir. Continue, sir.
Continue, Pavanji.
Okay.
Yes,
So
sir, we
why
can hear
now we want? So why we have to do a rehabilitation research? We had identified the different areas. Now we are trying to identify the purpose. So the purpose of doing research is promoting social and vocational reintegration. So when we are able to reintegrate the individual with the society or with the vocational setup, we will be able to do justice for doing a rehabilitation research. So develop outcomes measures for social reintegration, develop meaningful and appropriate outcome measures to work, determine the best incentive structures to optimize social reintegration and to work. And these innovations could revolutionize research in social and vocational rehabilitation. So when our research is focusing not only to do an intervention on or some kind of investigation, our focus should aim for social and vocational reintegration. Unless we will not be able to do justice for our research. Now, what are the basic concepts of research? So basic scientific methods are making observations in a systematic way, following strict rules of evidences, and critical thinking about evidences. Now, how? Empirical and operational. So when we are able to do empirical evidences and operational definitions, automatically our research will have a standard rehabilitation. Research will have a standard view of helping people with different disabilities or different forms of persons with disabilities. Now, what are the empirical evidences? Observations of public publicity and behaviors, and operational deficiency using operations of measurements to describe observations. Okay. Now, After doing research, what we are going to do? Either is nothing but a prediction. What we want to check. So theories are tentative explanations of facts and relationships in science, and hypothesis is a prediction based on a theory. Testing to confirm or refute. So we want to test something whether to confirm or we want to refute it. Can be revised or abandoned. We can revise the already tested theories or we can abandon the theories after doing the testing. Okay. Next, a representativeness of sample. Now, whom we are going to testing and how much sample or how many people, if we test, we can represent it to other people or to the particular group. Okay. If you want to test something for a person with autism, okay, first we have to identify how many autism individuals are there in that particular location. If you're going for a school, you will check with one school. If you're going for a college, you will go to one college. If you're going for a city, you have to see how many individuals approximately exist in that particular city. And from that group, we will take a small number, which we call it as a representative sample, representative group. Okay. సో ఒక పెద్ద గుంపు నుంచి కొంతమందిని తీసుకోవడాన్ని రిప్రజెంటేటివ్ శాంపిల్ అంటారు. A small group of individual. Unrepresentative sample misleads or biased tests of hypothesis. If we take unrelated sample or unrepresentative sample, our research will be biased or misled. It will not be accurate. Now, if you want to test for example, if you want to test the ability of a child to write an alphabet a special child of 6 years. Okay. Now you are going to a school and you are taking 10 children. Those 10 children should have equal abilities before they learn writing A. But if you take 5 children with 8 children, 5 children with normal ability and 5 children with physical disability, where they cannot properly hold the pencil or a pen, you cannot justify your representativeness of the sample, right? So you cannot justify that children with mental retardation cannot write properly. You cannot say that. Okay, because already half of the participants are having physical disability. So with physical disability, automatically there is a chance that they cannot write properly. So you should take mentally retarded children who are not having any physical disability. Then you can represent. That is called representative sample. Okay. And what is research now? It is a systematic, rigorous investigation of situations or problems in order to generate new knowledge and valid existing knowledge. Now we'll see what are the different types of research. The first one is applied research. So applied research, we try to not working. So applied is to solve practical problems. Okay, everyday problems, cure illnesses, develop innovation technologies, rather than to acquire knowledge for knowledge sake. ఏదో నేర్చుకున్నాం కదా లేకపోతే ఏదో చేయాలి కదా అని చేసే కంటే ఒక అవుట్కమ్ గురించి వర్క్ చేసి ఏదో మనకు తెలిసిన దాన్ని అప్లై చేసి ఒక కొత్త పద్ధతిని కొత్త టెక్నాలజీ ఇన్వెంట్ చేయగలిగితే దాన్ని అప్లైడ్ రీసెర్చ్ అంటాం. Okay, like for example, improving a range of motions of particular joints, or treat or cure a specific muscle, improve the energy of efficiency in muscle, like this. Okay. Now, second one is basic research. In this basic research is derived by scientists' curiosity or interest in a scientific question. Okay, the main motivation is to explain man's knowledge, not to create or investigate something. So in previous thing, we try to learn some new knowledge, but in basic research, we try to apply the existing knowledge. ముందు చేసిందల్లో మనకి ఏదో కొత్త తెలుసుకోవడానికి ట్రై చేస్తాం, ఇక్కడ తెలిసిన దాన్ని అప్లై చేయడానికి ట్రై చేస్తాం. So there is no obvious commercial value to the discoveries that result from basic research. For example, how did the muscle work? What are the neurons and how they compose? Or what is the specific exercise, okay, for patient with stroke works? Okay, so like this. Now when you come to special children, okay, can anyone give me 1 2 examples? ఎవరైనా నాకు 1 2 ఎగ్జాంపుల్స్ చెప్పగలరా బేసిక్ రీసెర్చ్ గురించి? అంటే మనకి తెలిసిన దాన్ని అప్లై చేయడం కోసం. సో వీ హ్యావ్ ఆర్ట్ థెరపీ. మనకి ఆర్ట్ థెరపీ తెలుసు. ఇఫ్ యు ఆర్ ఎ డ్రాయింగ్ టీచర్, ఓకే, నౌ యు ఆర్ గోయింగ్ టు టెస్ట్ హౌ దిస్ డ్రాయింగ్ థెరపీ వర్క్స్ టు హెల్ప్ ద చైల్డ్ టు ఇంప్రూవ్ హిస్ మస్కులర్ మూమెంట్. ఓకే, ఆర్ ఇఫ్ యు నో, if you are a craft teacher, okay, you will be, if you are a craft special educator, okay, you will be able to know how the craft work helps the individual to analyze, synthesize, okay, or make formulations of different shapes and sizes. Okay. So such kind of research, we call it as a basic research. Next one is core 2 or more. So in మన బాగా తెలిసింది, we know it very well as special educators. Every school or every special educator applies this. How yoga works on the improvement of child's mental abilities, or how physiotherapy mental abilities. Okay, how sand play or music therapy or art therapy or dance therapy, how they help the child to improve in other skills. Okay, the more yoga, the better the child. The more dance, the happier the child. The more art therapy, the clever the child, or the level of the intellectual levels will increase. Okay, like this, when we do a research, we saw it as a correlation research. Okay, and next one is descriptive research. The advantage and disadvantages of this correlation research. We can collect much information from many subjects at one time. You can study a wide range of variables and their interrelationships. Study variables that are not easily produced in the laboratory. The disadvantages are correlation does not indicate causation and problems with self-report. Okay, these are the self-report cannot become a we cannot do it as a correlation research. Okay, next one is descriptive research. It refers to research that provides an accurate portrayal of characteristics of a particular individual, situation, or group. And it is also descriptive research, also known as a statistical research. So we will be able to describe things or situations. So descriptive research, what happens is, when an individual or when you are working with an individual, you will be able to describe what or how the process will help the individual, what kind of process or how the process will help the individual in a systematic way. Okay, this is what we call it as a descriptive research. For example, you can see there are more frequent positions or postures that affect the body mechanism. So if you are able to make a child or an individual to sit in a particular body posture, okay, so for example, మనం తెలుగు ఆంధ్ర చూసుకుంటే మనం మఠం వేసుకొని కూర్చుంటాం, like folding legs, and we sit down on the floor. Okay, we say that position helps the child to sit straight, to make his backbone straight, and free flow of blood from head to toe, and any yoga can also. So this is what we see. So that kind of particular description we can give using this research, right? And these are the advantages and disadvantages of descriptive research. So the people individual studies are unaware, so that they are naturally or as they usually do everyday situation. It is less expensive and time consuming than quantitative experiments. Collecting a large amount of notes for a detailed study is very easy, as it is used to describe and not to make conclusions. So in this kind of research, we describe the effectiveness or the process of an individual, but we will not give any conclusions. So disadvantage is it requires more skills. If a person wants to do a descriptive research, he must have a number of skills before conducting the research. He must be able to formulate, organize, analyze all these things, and does not identify cause behind a phenomena. So it does not identify any causes. సో ఒక పని జరుగుతుందంటే దానికి కారణాలు ఏంటి అనేది వెతకదు, ఆ పని ఎలా జరుగుతుందని మాత్రం స్పెసిఫిక్ గా ఎక్స్ప్లెయిన్ చేస్తుంది. Response rate is low in this research, so there are no responses for this type of research, right? And the results of the research can change over the period of time. So ఈ ఇందులో వచ్చే రిజల్ట్స్ మారే అవకాశం అనేది ఉంటుంది. Next one is ethnographic research. Ethnographic research is limited to one particular cultural situation or one particular area. Okay, it refers to investigation of culture through an in-depth study of the members of the culture. ఒక సంస్కృతి అంటే మన తెలుగు, హిందూ, ముస్లిం అలా కాకుండా ఒక ఏరియా ప్రకారం, అంటే విశాఖపట్నంలో ఉన్న వాళ్ళ సంస్కృతి, హౌ ద కల్చర్ బిట్వీన్ ద పీపుల్ లివింగ్ ఇన్ విశాఖపట్నం or the people living around in East Godavari or West Godavari, therapist work. Okay, when you come with special need children, whether it is physically disabled or mentally challenged, okay, all these children enjoy the drum beat. Okay, so drum beat to associate in therapies same unnai. What are the different therapies that are associated with drum beat? One is dance therapy, okay, and music therapy, okay, and sometimes some folk dances. Sometimes even what we call a tiger dance. That is all. Hello. So these are the different kinds of research we can do, okay, when ethnographic studies. And next one is experimental research. When we want to do an experimental research, that we want to test a new way of therapy, ఒక కొత్త రకమైన థెరపీని కనిపెట్టి ఆ థెరపీ వీళ్ళకి ఎంతవరకు యూజ్ అవుతుందో చూడడానికి, or some new form of technique, and we want to see the benefits of the technique, how advantage or how best it is establishing the relationship with the positive note. The webmaster can mute the other individuals. Hello. So we want to test something. We want to test a phenomena, or we can test a phenomena, or we can test a probability, or we can examine a cause and effect relationship. Okay, so these are all the different aspects what we do in experimental research. So can anybody give me one example of this experimental research?
Audience, please answer him now or type in chat box.
ఎవరైనా ఒక ఎగ్జాంపుల్ ఇవ్వగలరా
Audience.
ఎక్స్పెరిమెంటల్ రీసెర్చ్ కి? And disability and feasibility is very less, and sometimes it is if unethical practices happen, the result may not be accurate. Okay, and in experimental research, the simplest experimental design includes two variables. Okay, independent and dependent variable, and we have two groups. We call it as a control versus experimental groups. ఫర్ ఎగ్జాంపుల్ అంటే ఈ 4 అర్థం అవ్వాలంటే ఒక ఎగ్జాంపుల్ చెప్తాను చూడండి. ఇఫ్ యూ వాంట్ టు టెస్ట్ ద ఎఫెక్ట్ ఆఫ్ యోగా ఆన్ ఫిజికల్ ఫ్లెక్సిబిలిటీ. ఓకే, సో యోగా విల్ బి ఇండిపెండెంట్ వేరియబుల్, ఎందుకంటే యోగాలో మీరు డిఫరెంట్ ఆసనాస్ నేర్పించవచ్చు. ఓకే, యూ కెన్ చేంజ్ యోగా, లైక్ యూ కెన్ గివ్ 1 asana or 2 asana or 3 asanas. That depends on the scientific person, but that effect we are seeing on physical mobility or physical flexibility. Okay, physical flexibility will be the dependent variable. And when you say two groups of control and experimental group, control group is the one where you give an intervention and see the result. Okay, or where you don't give anything or you can give the see the result. But experimental group where you will give some intervention and you will see the result. ఇక్కడ 2 groups తీసుకుంటా అండి. ఫర్ ఎగ్జాంపుల్ యోగా అనుకోండి, ఒక గ్రూప్కి యోగా నేర్పిస్తాము, ఇంకో గ్రూప్కి యోగా నేర్పించము. సో ఎవరైతే యోగా నేర్చుకుంటున్నారో వాళ్ళు ఎక్స్పెరిమెంటల్ గ్రూప్ అవుతారు, ఎవరైతే యోగా నేర్చుకోవట్లేదో వాళ్ళు control group author, and we see the result like their physical flexibility on the some exercise. Okay, and the next concept is exploratory research. So the word exploratory itself shows that you want to see different methods or collection of methods on a particular subject. So ఒక సబ్జెక్ట్ మీద ఒక డిఫరెంట్ మెథడ్స్ ని స్టడీ చేయడం ఎక్స్ప్లోరేటరీ రీసెర్చ్ అన్నాం, వేర్ యూ వాంట్ టు ఐడెంటిఫై ఆర్ జనరలైజ్ టు అ లార్జర్ పాపులేషన్స్. Okay, and the results of the exploratory research are not usually useful for decision making themselves, but they can provide significant insight into a given situation. So they can give you a good clear picture of that particular situation. So exploratory research can be quite informal. So exploratory research is mostly informal, relying on a secondary research. What we also call it as a secondary research, like literature, so data or quantitative approaches, etc., as informal decisions with consumers, employees, managements, and competitors, and more formal approach to in-depth interviews, focus groups, project methods, case studies, or pilot studies. So these are the different areas or different aspects where you are going to do exploratory research. For example, if you can see, like if you want to place a special individual for a job, if you want to place a special individual for a job, you have to do exploratory research which area is best suited for that particular individual. ఒక ఇండివిజువల్, ఒక ఫిజికల్ డిజబిలిటీ కానీ లేకపోతే ఒక మెంటల్ డిజబిలిటీ ఉన్న ఇండివిజువల్ కి మనం కానీ జాబ్ ప్లేస్మెంట్ వేయించాలంటే అసలు ఉన్న జాబ్ ఆప్షన్స్ ఏంటి, ఏ ఏరియాలో ఇలాంటి పర్సన్ తీసుకోవచ్చు, ఎన్ని ఆప్షన్స్ అంటే ఎన్ని రకాలైన జాబ్స్ ఉన్నాయి అనేది మనం ఒక రీసెర్చ్ చేయాల్సి ఉంటుంది. దాన్ని వీ కాల్ ఇట్ యాజ్ అ ఎక్స్ప్లోరేటరీ రీసెర్చ్. ఓకే, and ground theory research is a research approach designed to discover what probable existing is a given social environment. ఒక సోషల్ ఎన్విరాన్మెంట్ లో ఏమి ప్రాబ్లమ్స్ ఉన్నాయి, to identify the different problems existing in a particular environment where it is difficult or it is easy for involving an individual with disability in a particular task. Okay, so it involves formulation, testing, reformulation. So if you want to involve a particular individual with a disability in a particular office boy job or a watchman job or a cleaning job in a hotel or something, you must be able to identify what are the different
Kartika Arangar, kindly mute, sir.
so what are the different facilities available. Then you will formulate a process how to keep him, how to make him join the job. Once the person is joined, you will test whether that person is able to do the job. If he is able to do the job, you will go for a new task, or else you will reformulate the his ideas or his concepts, and then again you will place him into that particular job. Okay, so this is called ground theory research. Okay, so in this there are 4 stages: codes, concepts, categories, and theories. Okay, so these are the different areas what we can do. And the next one is historical research. Historical research is studying about the past events or previous phenomena that can help you to identify the future
Sir, Kishore sir, I
prospects.
think you find out whether Sudhakar sir is ready or not. Okay. Sir, Pavan sir,
Yes, madam.
you need more time or just 10 minutes is sufficient?
Just I think 5 more minutes, madam. Only
Okay,
5 more
okay.
minutes.
Thank you, sir. Thank you. Continue.
Okay, madam.
Ji, are
So
you
the
there
steps
here,
along
sir?
in this conduct. So here are few strengths and limitations of this particular research. You can see provide a comprehensive picture of historical trends, use existing information, provide evidences of ongoing trends and problems. So these are the things what we can do on a historical research. Limitations: it is time consuming, resources may be hard to locate, resources may be conflicting, may not identify cause of a problem, and information may be incomplete and inconclusive or inaccurate. Data restricted to what already exists. So we cannot take any further data which we can see in a new dimension. We can see data what is only existing already. Phenomenological research, it indicates or describes research approaches developed from phenomenological philosophy. It aims to describe an experience as it is actually lived by a person. సో ఒక పర్సన్ ఎలాగా ఒక ప్రాసెస్ చేశాడు, ఆ ప్రాసెస్ ని స్టడీ చేసేది ఫినాలజికల్ రీసెర్చ్. ఓకే, and in the broad category we have 2 types of researches. One is qualitative and quantitative. సో ఇప్పుడు నేను చెప్పిన అన్ని డైమెన్షన్స్ లోంచి మనం క్వాలిటేటివ్ రీసెర్చ్ చేయొచ్చు, క్వాంటిటేటివ్ రీసెర్చ్ కూడా చేయొచ్చు. సో వీ కెన్ డూ బోత్ క్వాలిటేటివ్ అండ్ క్వాంటిటేటివ్ research. What do you mean by qualitative research? Is like less sample but more theory, beliefs or meaning, attributes and symbols. But when you go for quantitative, you will have more population, like more number of people and less dimensions. So that means you will have more quantity than the quality of the research. Okay, so now it is open for questions and discussion. If you want to have any questions or discussions, you can just ask me.
Any questions, please? Hello. Pavanji, you have given extremely excellent flowchart, I should say, fundamental research, and everybody has to learn. But of course, I should say that it takes time for them to understand it. And if you can send them
Yes,
PDF
sir.
copy also, they'll be able to gather the information. And anybody wants to
Yes.
ask a question, 450933136. Who is it? Please, you can unmute and ask the question. Bandi Anita says that the information is Excellent, Pavanji, and it's
Thank
quite
you, sir.
good.
Thank you very much.
Any questions, Madam Mandramna, Madam? Pavan is a man with deeds and is quite helpful.
Hello,
Anybody?
sir. You are able to hear me, sir?
Yes, madam. Yes, madam.
Sir, actually, Pavan sir's subject is very valuable, and also, you know that people really have to spare time in research. Okay, so we can share his number because he is very helping nature. If anybody is they want to do any research paper or work on any publication and all, he will assist us a lot, sir. So audience,
Sure,
if you
ma'am.
want to write any paper or anything or do research, you can take his number.
Box they are pouring in, sir. They got the fundamental knowledge, research, and just like a flow chart of what they have to do, you are given in brief, in
Yes.
detail about these things, and they are writing it.
Thank you,
Yeah,
sir.
yeah.
Actually, in this
Yes, sir.
presentation,
Thank you very much,
what
sir.
okay, ma'am.
Yeah,
In this
yeah,
presentation, I tried to just to go very theoretical
yeah. I know,
because
I know.
it is on research, and when
I know,
we
I know.
yesterday all people discussed different aspects.
Yeah, yes,
So-
yes, Pavanji. Yeah,
Very
you remember
nice,
that we
Pavan
met
sir.
at this place
Excellent
also.
presentation, very simple, and also you explained everything very clearly and elaborately. Very nice, sir.
Thank you, madam. Thank you very much, and thank you,
Actually,
Keshwar
we
sir.
can continue, but due to a lack of time, no, we are hurrying you, sir. Hope you completed what you want to say.
Sir, mail
Yes,
ID no
ma'am.
phone number పెట్టండి sir.
సార్ పవన్ గారు మీ మెయిల్ ఐడి ఫోన్ నెంబర్ కావాలండి కొంచెం చాట్ బాక్స్ లో పెట్టండి
షూర్ అండి షూర్
అంటే టైం తక్కువ ఉందన్నారని
పెడతాను.
ఐఎమ్ నాట్ ఆస్కింగ్ పర్సనలీ ఇన్ దిస్ చాట్ సార్.
Yes, sir. There is,
Yes,
madam.
ma'am.
Actually, there is one professor waiting.
Yeah,
for
yeah,
our
that's
next
why.
lecture also.
Yeah.
Since
అందువల్ల నేను
yesterday,
మాట్లాడలేదండి.
Kamaraju sir. Since yesterday, Kamaraju sir skipped and we have changed the program. One presenter now increased in the afternoon session also.
Okay, okay,
So
madam.
we
That's
have
why
to
I'm not
adjust
asking.
time.
Yeah, that's why
Madam,
I'm
I
not
had
asking anything.
posted my email and my phone number in the chat box.
Yeah, thank you, sir. Thank you, sir.
Very
I'll
nice,
speak with
sir.
you
Thank you very
personally.
much.
Any further
And
questions?
all of you
Yeah.
know that
Thank you.
he could overcome his physical disability. Pavan sir is also like many of you have different children, and in the society we have children like Pavan sir, and he could overcome his physical disability and he could become a professor now, and also
I
I am a
visited foreign
person with,
countries on his own.
as madam said, I am a person with cerebral palsy,
Yeah.
affected on my 4 limbs. But I am independent. Tirupati 7 kondalu just 6 hours like
Very glad to hear about it,
Very
sir.
nice, sir. Very nice.
Thank you.
Very glad to hear about it, sir.
That speaks
Very
highly
nice,
of
sir.
your endurance and your willpower and your integrity towards yourself. As you rightly said that in the research you said
Thanks.
that replace and restore and having endurance.
You are
and
an
all.
inspiration to everybody, sir.
Thank
very
you, sir. Thank you very
inspiration
much.
person.
Here many parents know, sir, they feel happy by seeing you.
And
Yeah,
how
very
you how
inspiration person
one
like
person can
Anavaram sir.
reintegrate reintegration within himself and with internal stimuli. Of course, maybe
Like
some
Anavaram
Thank you very much, sir.
Like Anavaram sir also very inspiration person.
Yeah. Madam,
Yes, sir.
Sudhakar sir achara, madam?
Sir, you once call him, no?
I don't have his number,
Because
madam.
for my message, he did not respond.
Yeah,
Sudhakar garu
sir
sir, namaskaram
is
sir.
here.
Available.
Yeah.
The chat box.
He is very much there, madam. Sudhakar garu.
Okay, sir.
Namaskaram
Sir,
sir.
namaste,
Heartily
sir.
welcome. Yes, madam. Kindly
Sir,
introduce,
namaste,
Mandramna
sir.
madam, kindly introduce Professor Sudhakar garu.
Sir, I think you have to do it. Or shall I do?
Namaste.
Yeah, please, madam. Please, madam.
1 minute.
Yes,
1
ma'am.
minute. 1 minute, sir. Sudhakar sir. Actually,
Madam,
Sudhakar sir
madam,
has
brief
given
introduction.
presentation the other day also.
Not, very
On 26th and 27th also, he shared knowledge with us, and everybody felt very happy that time. So again, we requested for this webinar also, sir. Thank you very much. Out of your busy schedule, you agreed, But yesterday he was very busy. So he said second day he participated and today he could take. Dr. Sudhakar Venukapalli is English and foreign language with English and foreign language university, that is Central University, Hyderabad. And at present he is professor of education and dean, School of English Language Education Director, IQAC, and Director University Social Responsibility, USR, member Executive Council, EFL University. And sir is also like he is having academic and administrative experience in different national and international organizations. He is Dean School of English Language Education, the English and Foreign Languages University, Hyderabad. Member, Executive Council, EFL University, Hyderabad. Head the Department of Education, the English and Foreign Language University, Hyderabad. Director, IQSC, the English and Foreign Languages University, Hyderabad. And also he was Director, University Social Responsibility, the English and Foreign Language University, Hyderabad. And also in Usmania University, he completed a lot of service. That is as a Dean, Faculty Education, Head of the Department Education, Chairperson, Board of Studies in Education, Director, CBMDM, and also Coordinator, Center for Curriculum Development, and Chairman of Model School, Usmania University. And also in Wipro Technologies, Bangalore also he worked, and also Head Center of Excellence in Bangalore, and also Principal Wipro Cambridge International Center, Bangalore, in Bangalore City. And other important assignment he has done are, he was member standing committee on academics in NCTE, Government of India, member institutional committee for stem cell research, Center for Cellular and Molecular Biology, ICSCR, Government of India, and member academic council, Maulana Azad National Urban University, Hyderabad. And he is having PhD in education, MSc, MEd, MSc, MS, MA, and various PG degrees in various fields he is having. And especially a special mention is about he is having PG diploma in mental retardation from IGNU, and also he is having computer knowledge also, PG degree in computer knowledge. And he is having about 8 PG degrees. And he got many merit scholarships, National Merit Scholarship, Government of India, 1971 for best performance in school education, ICPR Fellowship, Award of Eminence in the field of teacher education, Best Senior Scientist Award, Global Teacher Award, AKS, and many awards are there. And he is having many certificates and publications. He is feeling very delicate because I am reading. So I'll stop it here. And I request our Sudhakar sir now to continue his lecture on the topic that he is talking about language skills in research. And he's like everybody, by listening to him, we can learn a lot how language skills can be developed in the special children. Actually, other 2-3 pages of his credibilities are there, but I have restricted only for a few lines of it. So you are most welcome, sir. We are all eagerly waiting. All our participants are eagerly waiting for you, sir. Welcome, sir.
Welcome, Sudhakar ji. Continue, sir. Namaste.
Thank you, madam. Thank you very much. At the outset, I thank Dr. Mani Ramana, madam, and Dr. Nagendra Kishore, sir, and the organizers of this event. I am very much thankful to madam for giving me this great opportunity to share some of my ideas with you all. Today, I'll be speaking on language rehabilitation. What kind of research people are thinking about this particular area. As you are all aware that language sciences has become one of the dominant studies in the universities across disability departments, and language has become an important area of exploration. And there are many questions, there are many problems which researchers have been people are moving in the some kind of direction. So friends, let us understand little bit. I'm not an expert in this area, but my students and me, we are doing some kind, a little work in the area of language science, in the interface of language sciences and disability studies. And the kind of insights which I have, I would like to place before you. So let me share the screen so that all of us can have meaningful dialogue with that. Madam, can you allow me to share my screen, madam? The host disabled. I request you, madam, to allow me to share the screen.
Yes, sir. Please, sir. Sir, webmaster. Sir, webmaster is there. Kishore, sir.
Yeah, I'm also seeing for him. Raghav Garu. Just a second, sir. And share చేస్తారండి sir. Thank you, Raghav Garu, for your.
Okay.
Okay, sir.
Okay, sir. You may, webmaster has made you a co-host, sir. You can share your screen, sir. Sudhakar ji.
Okay. Okay, sir.
Yes, sir. Now we can see.
Can
sir.
you see my
Yes, sir. We
presentation,
can
sir?
see.
Is my presentation visible to all?
Yes, sir. Visible, sir. Visible.
Carry on, sir.
Visible, sir.
Sir, you are visible, sir. Kindly proceed, sir. Sudhakar ji, మీరు అన్మ్యూట్ చూసుకుని you are visible, sir. Yes, sir. Carry on, sir, please. సుధాకర్ గారు మీరు అన్మ్యూట్ చేసుకోండి సార్. Yes, sir. Carry
Can
on.
you hear me, sir, now?
Yes, sir. Yes, sir.
Okay.
Well, as a sportsman, I would say start Lawal.
Yes.
Yes, kindly.
Yes, sir. Thank you very much. Thank you very much. I thank Dr. Maniramana Madam and Dr. Nagendra Kishore sir for giving me this great opportunity. And today I'll be addressing a few issues in the area of language rehabilitation. This is the topic given to me by Madam. The language rehabilitation is one of the emerging areas across the universities and research institutions in the world. And you all know, understanding language, especially in the area of disability and in the space of disabled sciences, is a very, very critical area. And children with language difficulties, children with multiple disabilities, with language disabilities, understanding them and rehabilitating them and bringing them into the mainstream is a very, very Herculean task. And we have a number of speech pathology specialists across India. But in spite of that, we are not able to, reach our set goals in this particular area. And just I would like to place before you that, today language rehabilitation has become a multidisciplinary exploration. Insights are flowing from neurolinguistics, neurosciences. Neurosciences are greatly influencing the field of language rehabilitation. understanding our idea about the language itself. And new areas like cognitive neuropsychology, which is emerging area, and also speech pathology is taking insights from these disciplines, and cognitive science and artificial intelligence, which are revealing very interesting research studies are available in this area, and also linguistics and applied linguistics, and research, foundational research in clinical psychology and disability studies. You see, if you look at these disciplines of knowledge, they all come together in addressing language related issues in disability studies. That is the beauty of language rehabilitation. So it is not one single person's job in doing research. To do research in language rehabilitation, we need to consult a number of experts and form a group and take knowledge from different disciplines and design our studies. Friends, neurolinguistics, which is the dominant discipline today, it studies about relationship between language and communication in different aspects of brain function. How does the brain functions? When you are communicating something, how the brain understands, and again, how does it produce language and involve in communication. Very interesting theories are coming up in neurology and neurophysiology with linguistic theory. Most of you are aware that even NIMHANS, Bangalore, is doing commendable work in this area. And neurolinguistics itself is a study of neural mechanism, how the entire brain mechanism, it controls, regulates language acquisition, language production, and language comprehension. Understanding the recent research in this area is very important to do any meaningful work in language rehabilitation. That's a very important. We must acknowledge that its importance in disability studies. Friends, the other important area where I have a lot of grounding, my own students do a lot of work in this area is psycholinguistics. The branch of study which combines disciplines of cognitive psychology and linguistics. It is concerned with the relation between human mind and language. It examines the process that occur in brain while producing and receiving spoken and written discourse. Psycholinguistics is a study of language using methods of experimental psychology, cognitive science, and neuropsychology, which is a very important subject today. Friends, communication, why do children with a disability fail in communication, communicating their feelings, communicating their ideas, communicating their thoughts? Why? We need to understand what is this process called communication and how it is related with brain functioning. When you say language is the process by which thoughts, feelings, and emotions are generated. When I say something, certain emotions are also generated. Language is connected with cognition and emotions. And it includes both receptive and expressive skills, productive and comprehensive skills. Speech is a process of creating sounds and combining them to form words that are understood by a listener. Language is such a beautiful human expression. It requires integration of cognitive and neurologic abilities along with musculoskeletal skills.
Sir, Kishore, 1 minute, sir. Kishore, sir, koncham Maniramana madam ni malli in cheyandi. Hello.
Can I proceed?
Sir, yeah, Kishore sir, Maniramana madam bike kellarata malli rama lopaliki teeskondi sir. Sir, you proceed, sir. Sudhakar sir.
Yeah, thank you, ma'am. Thank you. So what I'm saying here is, when children speak, their speech, if you want to understand what kind of difficulties children face, children with aphasia or children with any kind of language disorders, you need to understand the different mechanisms, interconnected mechanisms like cognitive mechanism and neurologic mechanisms and muscular systems, skeletal system, and how all these things support, language, articulation, and expression. When you speak something, it's not the brain. It's not merely, something connected with neurons. It is connected. So many systems are interconnected, even muscular system, skeletal system. So it is an integrative, thing which we need to understand when we want to do any kind of meaningful research in this area. So, my dear students, what we need to understand is how language rehabilitation is used. If you want to grapple, you need to enter into the network of different mechanisms like cognition, emotions, neural systems, muscular systems, and skeletal systems, how they are integrated and support the language production and comprehension. This is very important. This idea is very important to entertain. Friends, cognition, when you say cognition, what is this cognition? Cognition is very important when it is related to language. It refers to attention. Attention is a very important aspect. My students, they did a lot of work on attention, memory, auditory processing, problem solving, and executive functionings. Some of the cognitive skills that are important for communication: how do you process data? The processing speed, concentration, self-monitoring, thought organization, memory. Some of these skills are very important to communicate. So when children are not able to communicate, they have certain cognitive deficiencies, they have certain low level of cognitive skills. So we need to understand these things. So verbal communication, for example, the most common form, it involves use of speech, language, cognitive skills, and it is supported by facial expressions and gestures. You see how the verbal communication happens, which we all know. How many systems are involved in this kind of expression. Friends, when I talk about cognitive communication impairments, see, when children are not able to communicate their thoughts, there is something why they are not able to communicate, because there may be something wrong with that person's ability to talk, ability to listen, read, or write, because of changes related to cognitive or thinking and skills. The perceptual skills, for example, how the child analyzes, decodes certain visuals. Is there something problem with decoding the visual reading, visual literacy? How strong the child is in understanding the visuals and make meaning? These skills include arousal, attention, executive function, memory, processing speed, spatial function, and emotions and pragmatics. All these things, when people are using certain words in a certain context, in everyday use we have so many words, and we understand words in a particular context, whether it is an order, whether it's a request, whether it is a natural. The pragmatics of use of pragmatics, how it's underplay in our communication, we need to understand. When children are not able to, children with autism, children with HD, children with different disabilities, why they fail in understanding, in decontextualizing the language, we need to understand that part of it. So research need to focus many areas, which is very, very important. Friends, language issues are related, as I mentioned, to the cognitive dysfunction. Sometimes children fell and children met with accidents, and due to even there may be a number of accidents, not only children, adults also, And due to this, brain injury might happen. And also because of when children are in different difficult and traumatic conditions, brain injury also might happen, and also brain tumors. You see, there are a number of serious issues which can contribute for cognitive dysfunction. Traumatic brain injury can be caused by a closed or penetrating head injury. Somebody hits your skull, or there are a number of things. Children fight, and sometimes parents also beat children, and children met with accidents, and so many incidents happen in school environment. And because of this, lot of brain hemorrhage happens in the child's brain. We need to understand, when child is not able to talk, child is able not correctly speaking, maybe something wrong. Even which most of you are know that during pregnancy, during delivery cases, when doctors use forceps, there are so many gadgets they use to bring the child into the world. But that gadgets also may damage child's brain, and lot of cognitive dysfunction might happen during delivery cases. There are so many studies related to this. So friends, it's a very, very sensitive area. And when you are going to do research in language rehabilitation, you need to understand the case, and case history, you're in a multidisciplinary framework. This is what I want to say here. You all know that there are two parts of the brain, left and right brain. The left side of the brain contains language centers, according to neuropsychologists, and while the right side plays a crucial role in cognitive functioning. The right hemisphere brain damage often leads to cognitive communication impairments. If something happens to right or left, it is going to have a mutual effect, because the right side of the brain, has lots of cognitive functions. These cognitive communication impairments, when something is happening here, and child is not able to communicate properly. This we need to understand, you know, because when we study physiology, we know that these right and these two hemispheres play a role in mediating memories for habits, motor activities, emotional responses, and
It's 1 o'clock.
subcortical structures. Important for memory include hippocampus and the amygdala. Hippocampus is important for recent working memory. These are all new researches which are revealing this amygdala's primary role in forming and strong memories associated with emotional events. If something is getting damaged, amygdala, is it getting affected? How the hippocampus is getting affected? Language disorders, what is the cause for language disorder? We need to understand that part of it. And if possible, try to re-energize the entire cognitive mechanism of the child, along with muscular, skeletal, its language. When child is able to start speaking, the entire system, bodily systems, they get reconnected and re-energized. That kind of rehabilitation techniques, methods, people need to adopt. And a lot of research is going on in this area. Still, this area, as far as my knowledge goes, it is an emerging area itself. There are a lot of issues in this area. And this is most of you know that great discoveries which happened in the recent past, people have identified certain language areas in the brain, that is Brachy's area, Rinke's area, motor cortex, and acute fasciculus. Some of these areas, which is, I don't enter into these physiological structures, but most of you are aware that scientists have identified now that a specific areas in the human brain, and certain areas or Brachy's area is, it is the production, and Rinke's area for comprehension of language. Some of these things, are there in the, brain research, and most of you are aware of this, I know. I don't want to spend much time on this. And I would like to, place before you certain important critical cases in human history, 4 or 5 cases from where people are drawing insights into language rehabilitation. Because language rehabilitation, a lot of research is going on. For that, there are certain cases which I would like to place before you. And some children known as feral children, you might have heard this word. Feral means wild or undomesticated, children who are away from society, away from family. A human child who has lived without human contact from a very young age and has no experience of human care, of loving or social behavior, of human language, and how such children behave.
Like Tarjan,
This is
sir.
very interesting cases. I just, because this is before lunchtime, I would like to, yes, ma'am.
Like Tarjan.
Before, yes, ma'am. Yes, ma'am. You are right.
Okay.
Yeah. Before lunchtime, so I would like to place before you certain cases so that we can have some dialogue and a discussion even during your lunchtime. No, that's the is the reason, and I'm just to place before you, and there is a critical age when you talk about the language. Many linguists like Noam Chomsky and his entire team have been doing a lot of research in this area, and they did a lot of work in this area. Most of the student linguistic background, they are aware of that. And the critical age hypothesis, which has become an important idea. See, what it talks about may have human contact, but were so deprived of interaction that it did not become socialized. When can the child learn language? At what age the child should be exposed? Most do not learn language and have trouble with basic motor skills. Those who are not exposed to society had hard to definitely study due to how nature of the child rearing. These are the things which are happening. Most of you are aware of this. Factors that govern language learning, the age at which exposure to language began. If child is not exposed to language before 5 or 6 years old, then it is very difficult for the child to pick up the language of his mother tongue. This you all know. And once mother tongue is not captured, then even second, third, and other languages also, it's very difficult for the child. And sometimes it is not possible also for the child to learn the language. Now, some of these interesting findings, which are very, very important for language rehabilitation are I just would like to place for you, and let us think about a child who is popularly known as Ukrainian dog girl. This girl, Oksana Malaya, and Oksana Malaya, Ukrainian dog girl, was first found in 1991. She could hardly speak. But in 2006, at the age of 23, Oksana
Hello. Sir, we can't hear you, sir. Hello. Hello. Hello.
Hello, madam. Got
Sir, we
disconnected,
can't hear you.
I think. Can you
Yes,
hear
sir.
me
You
now,
are showing
madam?
the dog girl.
Can you hear me now?
Yes, sir. You are showing dog girl and
My
about
presentation is
Anaya.
the presentation is visible, madam?
No, sir, not yet. No, sir.
If it is visible, please tell me, madam.
Yes, sir. Yes.
Yeah. So this Malaya child, most of you might have studied, but in spite of so many years spending in the, rehabilitation homes, the child could not pick up. It's reported she was living in a home for the mentally ill, where her speech had difficulty. It's very difficult to why to such children. Yeah. And
Sir, voice is so
my
much
Our voice
disturbing.
has breakdown, sir.
as Madam has mentioned.
Sir, your voice is not clearing, sir.
System and it is visible to us, sir. I think you are using two systems, phone and your this thing.
The internet connection is not.
Okay, sir. Okay, sir. Carry on, sir. Try again, sir. Yes, sir. You unmute yourself, sir. Yes, sir.
With internet connection, sir. I'm very sorry.
Yeah, now you're very audible, sir. Please carry on with this, both the things, integrating both the systems, right?
Thank you very much.
Yes.
And this Sujit Kumar case, most of you might have heard. In April 1976, Kumar's mother committed suicide. His elderly grandfather, not knowing, it's again a problem, Can you hear me, sir?
Yes, sir.
Hello?
We can hear you, sir.
Hello, can you hear me?
Yes.
There is my presentation. This internet connection is very unstable, madam. Today, I am very sorry. I don't know why.
But we can cooperate,
visible, sir. Visible and audible, no problem.
Yeah. Sujit was found one night in 1979 by the side of road picking up for food. He was taken to a old age home and people's home in Suva, where because of his destructive and violent behavior, he was frequently tied to a bed. This occurred for 22 years before Sujit was put into therapy. See, it's very difficult to understand children on whom there are a lot of emotional, disturbances, trauma which they have experienced. And Sujit's case, most of you might have heard, it's a very important case for language rehabilitation specialists who are struggling to understand. A sister in home said, Sujit would mostly hop around like a chicken, peck at his food, perch like a chicken, and make noises like a chicken. She said he would prefer to roast on the floor to go to sleep rather than sleep in a bed. However, and the start of 2003, a visitor to the home initiated a rehabilitation program. Although he still cannot speak, he is now learning human behavior and the ability to communicate. But how difficult it is, you can understand. And what is happening in their brain, we need to understand before you start any kind of language rehabilitation techniques and processes. You might have heard another important girl, Victor. She's very interesting case. A wild boy captured in the woods near the village of Lacan, France. The boy was taken by his captors, kicking and struggling to be displayed in a village square. The wild boy managed to escape, but a year later, 1798 case, he was caught again in the vicinity of the city by 3 hunters as he was climbing a tree. He was then taken to a local widow's house who fed and clothed him for a week. Victor's language learning, it's a very interesting, when he was admitted in a rehabilitation center, very interesting cases were, results have come up. And when they start teaching speech, and there are so many issues which I have placed in this slide. And when you come to the Jenny's case, which is a very popular case in United States of America, most of you know, because students of psychology know very well about Jenny. She was discovered in 1970. She was born in 1957, I think so, 57, 58. But she was discovered in 1970 when her mother brought to a hospital in Los Angeles, and people came to know about this Jenny, about the family, what happened. And for more than 13 years, she was placed in a cell by her parents. No contact with anyone. Experience she had, and we can't, imagine such kind of experiences she has undergone. So, and when she was brought to the hospital, somebody reported to the police, and police immediately filed a case, and they started investigating the case, and they came to know very interesting things about the Jenny. She was confined, uh, controlled by father, but father, we need to understand why father did like that. Father had a different kind of experience in his childhood, very disturbed childhood experiences father have undergone. And all such experiences have a lot of impact resulted in Jenny's case. And he was abusing, and she was placed in a cell, no contact. And, it's a very difficult to imagine such kind of, life of Jenny. When Jenny was first found, they could not tell at first whether or not she had already acquired language and simply was not using it. She was not speaking to, in the hospital authorities, hospital doctors and nurses, because she did not respond to a simple command, but did respond to words that were clearly out of context of their environment. This is what, very interesting. It was determined that Jenny truly had not yet acquired language. That is very clear. She has not acquired the language, but she was responding to something else. So what is that? Very difficult. Jenny's first basic words, when she started learning, it was monosyllabic. I don't want to enter into the details of this thing. And after that, from single words, she was just uttering spontaneously certain words. Her entire early vocabulary was different from the first words of regular children, which are typically nouns, plus particles like up and down. And she was very interesting case. The tests that were created to show Jenny's progress in learning showed that Jenny was acquiring language, but not through imitation or prescribed rules. Applied linguists have different methodologies, different rules which they talk about when they think about language learning. But all these language learning rules, Jenny could not acquire. Her language learning processes are totally different. And this has led to many neurocognitive psychologists to understand Jenny, and to study Jenny in a serious way. These are the things which happened in United States, but this Jenny's case has become a public case, and media reports and court interference, police interference, and many organizations also was interfering, and people were talking about human rights violation. It's a very, very popular case in United States, which has got a lot of implications to language rehabilitation specialists, because it's a very, very interesting case. When she was first discovered, most of the sounds that came out of her mouth were voiceless, because she doesn't have any contact with people. Whereas normal people like most of us, we naturally will learn. But her nature is totally different. She was confined to a small chair, There are a few major differences between her and regular children who acquire language as babies. Her vocabulary was different and much larger than that of children at the same stage of syntactic development. The rate of her syntactic acquisition was much slower than normal children. These are some of the findings which people started teaching language to Jenny. And the results were Jenny eventually learned to produce immature sentences like Mike paint, applause by, certain words she was uttering which did not have any meaning, but that they might have meaning to her, but not meaning to us. Some hypothesize that the reason why people like Jenny never learned to speak successfully is because they have emotional scars that interfere somehow with their ability to learn. So dreadful emotional experiences which greatly damage the cognitive functioning of the child, and the entire muscular system, which is in the brain itself, in the skull itself, that muscular neurosystem itself, when it is getting damaged and child is not able to speak, such kind of cases, people started, understanding them. So friends, isolation of young children has devastating effects on social function, including communication skills that are massively diminished and usually not retrievable. You cannot retrieve once it is damaged. This is clear case in Jenny's, if you understand Jenny's life history. So when you are getting involved in this kind of, cases, then you need to study the entire history. And language development is greatly affected with isolation. When you are not in the discourse, in the culture, in the society, then children cannot speak. So whether it is first language, whether it is a second language or a foreign language, if you want to teach children, then the idea is that you need to place them in the discourse. You have to place them in that particular culture. You have to immerse them. Then only, the child can learn. Language learning is possible for that. And friends, I'll just show you the Jenny's mother and all his father. He committed suicide when he was brought to the court because he was a very problematic child. And I just want to show you this is where Jenny, the room where Jenny was locked for 13 years. You just imagine, what kind of living conditions were there in the Jenny's case. How these conditions greatly damaged her brain and cognitive system. And because of that, she is not able to speak. So the basic idea is the learning is that any kind of language rehabilitation specialists, they need to understand how cognition and cognitive processes happen in the human brain. For example, attention, memory, executive functioning, uh, perception. Some of these things. How these things contribute for effective production of speech and comprehension of language. Friends, even about Helen, I'm not showing all the details, uh, but when you come to, Helen Keller, which most of you are aware of, because a celebrity in disabled sciences, Helen Keller. Uh, Helen was born a healthy child, which we all know in Alabama. Her parents were Kate Adams Keller and Arthur Keller. At the age of 19 months, Helen became deaf and blind. As a result of unknown illness, perhaps we don't know what that illness. People say it is a scarlet fever. As Helen grew from infancy into childhood, she became wild and unruly. If you read the life history, we'll come to know at the age of 7, she was introduced to Annie Sullivan Mackey, which her great teacher. Mackey's effort to teach language were touching senses that succeeded. It is a kind of rehabilitation, how she played a vital role, a significant role in bringing the child, Helen Keller to learn the language, the entire journey with her. That's a great contribution of Mackey's in the life of Helen Keller. Helen learned via touching, speech articulators, and even learned to speak, able to produce somewhat strange words. Speech learned to read and produce braille. she was graduated from a university and acclaimed as, a good writer in the service of handicapped people. We all know, we all celebrate Helen Keller and her writings. Friends, any kind of relationship between wild and isolated children, the critical age is very important. We need to understand at what age, children need to be exposed to language. We need to understand. For example, in Helen Keller's case, at the age of 7, Mackie introduced the language to her. That's why Helen Keller could recognize, learn the words. But whereas in Jenny's case, it not happened. 13 years. So there is a critical age period. That's a very important finding in, by the researchers. And age of exposure and extent of any physical and psychological social trauma prior experience, there are some of the things which are very, very important to understand. So any kind of language disorders, when you're talking about, which involve processing of linguistic information. When somebody is speaking, when I am speaking, you are listening to me. But your entire linguistic mechanism, that which involves your cognitive mechanisms, neural mechanisms, and skeletal mechanisms, they coordinate and they come together to function. And people may experience problems when children are facing cognitive deficits with respect to grammar, with respect to meaning making, semantics, or other aspects of morphological aspects, pragmatic aspects. These problems may be, sometimes it may be receptive problems. Children are not able to receive. This reception may be due to attention issues, because child is not able to, make any kind of attention on what you speak. So there are so many, this attention is a cognitive function, So how to make the child attentive, how to bring that kind of, cognitive ability into the child. These are the various issues which language rehabilitationists need to address. When child is having problems with expression, so how do you combine with culture, arts, music, whatnot, and how do you integrate these things, drama and many other fine arts, in bringing child's expression out? And these are some of the important issues which we need to understand. Friends, there I have prepared so many other slides uh, which have a lot of implications to this particular subject. And
Yes, sir.
I'll stop it here, so that, with this kind of new areas which are emerging, emerging areas, I request all of you to be in touch with some of these new subjects to understand language rehabilitation. And also there are some language rehabilitation laboratories which are people are also in Temple University, for example. They have established very interesting aphasia rehabilitation research labs.
Sir, where, sir?
Aphasia rehabilitation research laboratories in Temple University. You might have heard about these universities, and they involve many people in, in their entire collaborative work in supporting children with aphasia and some language difficulties. And these are the things which are happening. Rehabilitation research laboratories are established, and unfortunately we are not moving in that direction. But there are many universities in the West which are picking up, because there is a lot of funding available, though they face a lot of fund crunch and fund issues. But in spite of that, there's a lot of work going on in the West. And we need to learn from some of the practitioners from the West and try to uh, develop our indigenous models of language rehabilitation techniques. And that is our own indigenous Indian models of language rehabilitation we need to design. For that, we need support from all of you, and all of us come together and take up this divine work. This is a spiritual work. I should not expect any kind of commercial interests and all these things. We have to put aside, and because we are working for children, with that motto we should proceed. Thank you very much. I'll stop it here. And I thank Dr. Maniramna Madam and Dr.
Sir, feeling like a plate meal, sir, not full meal. We need much more information. Not the full meal. Enjoying the subject like anything.
We'll get bulimia, madam, because we are getting more more knowledge.
Madam is using example also lunchtime full meal and half meal example.
Yeah. Sudhakar sir, one more
So
time we
madam is
need your
feeling
lecture,
hungry.
sir. No,
Sir,
no,
Sudhakar
madam.
sir. Sir, Sudhakar garu.
Practitioners like you, all very serious people. I am nothing before you, because you are all experts. And
Sudhakar sir, enjoyed very much, sir. We enjoyed the subject
Sir,
very much.
Sudhakar sir.
Thank you.
Sir, Sudhakar sir. Hello.
Madam.
Sir, actually,
Hello,
I
madam.
am a
I can hear you,
I am a meditator, sir. Sir, I am a meditator. And while doing internal journey, I do research on this language, sir. Why in our tradition they kept some sounds very important. Like suppose Omkaram. And why some names of chanting of some names are good. This type of research I'm doing on myself while doing meditation. Then,
very great, madam. Very good.
Like now, sir, when we meditate for some time, we can know our vibrations. That is, they say Kundalini or something like that. It is power inside us. So all 72,000 nadis, they vibrate for particular sound system. If they say Omkaram is good,
right.
about 69,000 cells of the nadis will get vibrated. Oxygen supply will be there. And now people are asking, now sir, madam, due to even though it is COVID, you are talking and you are doing all this. But how to tell them, I don't know. I am meditating, sir. Only with the help of meditation, like now, sir, we can overcome many things. See, virus, we cannot get rid of that. But our internal power, we can increase by sound system.
Absolutely, madam. You're right. Absolutely right.
So when we speak in childhood, people used to say, sit straight and swachchanga matladu and speak with clarity and all, no sir. So all that is actually they have done a lot of research on that. And now we are doing research on language development and rehabilitation and all. But by keeping some sounds, last time we had raga therapy, sir. Like for particular raga, for some type of disability, they found fruitful results. This time I did not invite her. Next time I'll invite you along with her. So that that raga therapy, she's there in the Vizag, and you are actually now language is very important, sir. Sound system, Panchabhutas. Sound is one. So our body will react to all Panchabhutas, that is 5 sensory organs. So sound is one. It is Akasa, that is Panchabhutas Akas. Akash is responsible for sound system. So in our body, some cells react to Akash, that is sound. So sir, there is lot about language and also sound system and a lot of research. Actually, the research, suppose I am sitting and doing every day, morning 1 hour and evening 1 hour on the sound system, but all by sitting and doing meditation and observing myself. I make a different, how their bringing sound system is bringing change in my body. So, but that I can write, I can share with you, people like you, but I cannot produce as evidence. Like how Freud, no sir, he did lot of research, but later only he wrote books. Like that, if it is foreign country, like now sir, or in India also, any neurologist is there, I want to go them and sleep there, put electrodes and do meditation and show them how they are affecting me.
Yes, yes.
But that much scientific availability is not there, especially suppose Rajamandri. I cannot go to a neurologist and ask him, sir, keep my electrodes, I do meditation, you record. But I cannot do that. But it should be available, and internal journey by everybody. No sir, everybody can be a researcher on himself by doing meditation, yoga and pranayama. They can see lot of change, and they react to language, and also they react to words. Our body becomes so sensitive. If somebody uses bad language, we get weakness. If somebody is very negative, we get weakness. That is how the body cells react. So positivity always gives us energy. But this much research, all our rishis did, sir, but nobody is taking them into consideration. Anyway, let the circle complete again. That is what I feel. After I'm very much interested in cognitive development, sir. So very nice hearing you. And one day only about cognitive aspects, we will learn. We will do some things like a conference, international conference, along with some neurologists and psychologists and also language people, and we can have some scientific study on that. So that kind of webinars will definitely help us. Now COVID also, sound systems, sir, it is an internal journey and having confidence in the mind. Some sounds give confidence. They say మీరు కాన్ఫిడెన్స్ తో ఉండండి అని చెప్తున్నారు, కానీ కాన్ఫిడెన్స్ ఊరుకునే రాదు సార్. కాన్ఫిడెన్స్ సౌండ్ సిస్టమ్ తోటే వస్తుంది. వాట్ సౌండ్ మేక్స్ అస్ కాన్ఫిడెంట్ ఆల్సో మస్ట్ నో. So thank you, sir, for your very valuable message and everything. Nice sharing.
I must thank you, madam, for adding a lot of value to what I said.
Actually, language development is very important. Cognitive development, psychologists and language teachers go together in many aspects. Sir, Kishore, sir.
Yeah, thank
Please,
you very much, sir.
Give your valuable remarks, sir.
Yeah, what I can give, madam, you told everything, and you made your out of your introspectional meditation and all. You what sir has said, you are telling him again about them and in action, and beautiful and extraordinary good presentation, Sudhakarji. Language integration and how it is going to correlate and coordinate with people. And as madam is rightly saying that it's cooperative coordination, cooperation, coordination, collaboration of intellectuals like you in different fields to come together to address the problems that have been faced by people with disability. And also we have to look into the language skills of the special educators. They have to they need not have vocabulary or fluency or whatever it is. The one language they should have is the flow of the language, the fluency of that comes from the heart, tone and tenor. So if they speak loudly or something like that, you wanted to command and all these things, with MP it has to come. And the special educators have to monitor and internalize a self confidence, concentration, and అంటే తెలుగులో చెప్పాలంటే నిర్మలత్వంతోనూ నిజాయితీతోనూ తర్వాత నిశ్చలంగా నిర్మలంగా ఉన్న చోట ఏంటంటే వాళ్ళ భావావేశాలు కాకుండా ఆ పిల్లలకి తెలియదు కదా, డిజేబుల్డ్ చిల్డ్రన్ డోంట్ నో ఎనీథింగ్. అండ్ ఇఫ్ యూ హ్యావ్ సహనం, ఓర్పు ఉంటే, కృషి పట్టుదల ఉంటే అన్ని జాగ్రత్తాయి సార్. మీరు చెప్పిన దాంట్లో అదే ఉంది సార్. హ్యాట్స్ ఆఫ్ టు యూ వన్స్ అగైన్. అండ్ on behalf of all the special educators, on behalf of Adikavi Nanda University, on behalf of Vice Chancellor.
Sir, really, last time also I have observed, sir, no?
Yeah.
He wants to say something. After that, he thought, okay, sufficient for today. Like that, he stopped. Krishna Kumari madam rightly said, plate mill. He gave us plate meal only.
మేడం మన
He's
లంచ్కి
having
వెళ్ళిపోదాం
lot
మేడం.
of
ప్లేట్
knowledge.
మీల్ అంటున్నారు వాళ్ళందరూ. లంచ్ అంటున్నారు పాపం.
ఏమైనా పాసిబిలిటీ ఉంటే
lunches,
తర్వాత మళ్ళీ కంటిన్యూషన్ ఇవ్వండి సార్.
He's having full meal also, but he's not giving full meal. He's giving plate meal to us.
The subject itself is
Sudhakar
like
sir,
that,
thank you
madam.
very much, sir.
Sir, we will stop for the lunch over here. Being a host, I can't unmute you all. And once again, Sudhakar gar, God bless you. And you have uh, language skills and technical knowledge, and you have abundance of knowledge with you, sir. I should say that one of the sessions par excellence presentation.
Sudhakar
par
sir,
excellence.
many queries are there. I'll post my questions in your mail, sir.
Yeah, yes, madam. Krishna Kumari, madam,
Okay.
you do that.
Okay. Because of time scarcity.
Yeah. Time scarcity, we had to think it different angle also, madam. Krishna Kumari,
Yeah.
madam.
Yeah, I
Because-
can understand, sir.
No. I'll just let me submit to you, madam. Because the depth of the knowledge you persons are having, Sudhakar garu, Mandramna madam garu, and others, and me and the other special educators are having is lesser. So we can't come up. We have to come to your wavelengths. So in order to do that, Sudhakar sir has come down to the wavelengths of the educators. So this gap can be, if you have any doubts at your level, at your intellectual level, you can contact him directly and get them answered by Sudhakar sir.
Thank you very much, sir. Thank you.
Thank you, sir.
Sudhakar sir.
Namaskaram once again.
Sudhakar
Madam,
sir,
Madam,
I'll
Madam,
contact
we'll
with
go for
you
lunch.
personally.
Quite
Namaste,
a
sir.
good guest.
Sudhakar sir, namaste.
Thank you, sir.
Namaskaram,
Thank you,
sir.
sir.
Namaste,
Miగతా
sir. I'll
వాళ్ళందరూ
contact
వెళ్తే
you personally,
Namaste,
sir.
madam. Namaste. Thank you.
2:15 the sessions will be resumed, sir. Thank you, Sudhakar garu. Thank you, Dharanija garu, Lakshmi garu, Josna, రజని, వెబ్ మాస్టర్ గారు అండ్ అదర్స్. వెబ్ మాస్టర్ గారు మీరు వెళ్ళిపోవచ్చు సార్. మీరు వచ్చేదాకా ఉంటాను నేను సెషన్స్ లో. కనకదుర్గ మేడం,
థ్యాంక్ యూ సార్.
థ్యాంక్ యూ.
Really eye opening for your session, sir, as a special educator. So thank you. How we important for language
Great.
our students. Thank you so
Wonderful.
much, sir.
Wonderful response. Because we were feeling that we don't know what you are feeling. So whether you are able to understand or not, good. God bless you all for your services. You are the frontline warriors, I am telling.
హలో
కృష్ణ చెప్పండి. చెప్పండి మేడం.
సార్ మాది 26th 27th సర్టిఫికేట్ ఒకటి రాలేదు. తర్వాత నిన్న మేడం గారు ఫోటో గురించి అన్నారు, అది ఎలా పంపించాలా అనేది.
మేడం గారికి వాట్సాప్ చేయండి మేడం. మేడం గారి నెంబర్ ఉంది కదా, మేడం గారికి వాట్సాప్ చేయండి.
ఇప్పుడు ఇక్కడ కనెక్ట్ అవ్వరా?
ఇప్పుడు మేడం గారు ఉన్నారు, లైన్ లో ఉన్నారు, అడగండి మేడం గారు.
అందుకు మేడం గారు
సార్ ఏం లేదు మేడం, మీరు స్క్రీన్ షాట్ చేయాలంతే. స్క్రీన్ షాట్ చేసి పంపించుకోండి.
అదే
ఒకవేళ లేకపోయినా మేము తీస్తున్నాం, ఫోటోలు మేము తీస్తున్నాం, మీరు భయపడక్కర్లేదు. మీరు కూడా ఏమన్నా స్క్రీన్ షాట్ తీసుకుంటే, అంటే ఈ పక్కన 2 బటన్స్ ఉంటాయి కదా సెల్ ఫోన్ కి, 2 కలిపి ఒకసారి నొక్కితే ఫోటో వస్తుంది.
ఓకే మేడం.
ఓకే మేడం. సార్ థ్యాంక్ యూ సుధాకర్ గారు, కిషోర్ గారు. లెట్ us have lunch and come back again.
మేడం మీరు ఎవరో లంచ్ కి వెళ్ళి వచ్చిన తర్వాత నేను వెళ్తాను లంచ్ కి.
సార్ మేడం అందరూ లంచ్ కి వెళ్ళండి మేడం. అందరూ స్క్రీన్ లో తప్పుకుంటే కానీ కిషోర్ గారు భోజనానికి వెళ్తాం. సో లెట్ us go for lunch.
Because being a host, I can't stop it here. Okay.
Sir, let us have lunch, half an hour lunch time, half an hour. Okay, because afternoon there are 3 or 4 presentations and also valedictory is there.
Okay, madam. Thank you, madam.
Kamaraju sir is there, Rajshekar garu, Lakshmi Narayan garu, and valedictory registrar sir is coming.
Madam,
so
kindly confirm with them, madam. Kindly confirm with them, madam.
Yes, sir, I already spoke to him.
Okay.
Rajshekar sir's profile I have to get still.
Okay, you kindly contact with them, madam. Okay. Thank you, madam.
Sir. Okay. You ask Rajshekar sir's profile. I will need, sir. Sir, okay, sir. Have good lunch.
Okay. Thank you,
full meal and come back. Thank you.
Hello? 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 Webmaster గారు నన్ను నా మాట వినబడుతుందా?
వినిపిస్తుంది సార్ మీకు.
Okay, okay. Good afternoon, all of you. Let's wait for Mandaramna madam to come in, and we'll start for program for another 10 minutes. We'll start. As the number is only 29, we are waiting for you all. Mandaramna madam?
Sir, I am here only.
Madam, good afternoon. Namaskaram. Next session, next session, madam.
అదే ఇప్పుడు రాజశేఖర్ గారు అనుకున్నాం కదా ఫస్ట్, ఆయనకి ఏదో ఆక్సిజన్ సిలిండర్ కావాల్సి వచ్చింది వాళ్ళ అనుకునే ఎవరితో, అందుకని ఆయన బిజీలో ఉన్నారు అన్నారు. అందుకని లక్ష్మీనారాయణ గారిని పిలిచేశాను సార్.
ఓకే, లక్ష్మీనారాయణ గారి ప్రొఫైల్ చదివాలి మేడం.
ప్రొఫైల్ ఉంది కదా మీ దగ్గర?
నా దగ్గర లేదు మేడం లక్ష్మీనారాయణ గారు. We'll start in another 10 minutes, madam. ఎవరు రాలేదు, 29 మందే ఉన్నారు. దేవి అత్తిలి గారు, వెల్కమ్ మేడం.
సార్ లక్ష్మీనారాయణ గారి ఉంది కదా ప్రొఫైల్ మీ దగ్గర?
నా దగ్గర లేదు మేడం.
లేదా సార్, ఉండండి పెట్టినా మీకు.
పెట్టండి మేడం. ఆయన రెడీగా ఉన్నారా మేడం? Thank you, Webmaster garu. We are on the second day. There's a final penultimate session of research and disability and rehabilitation RCI-CRE status accredited. This is we are very grateful to Adikavi Nana University, NIPMET, Sproha Psychology, Sahai, Tapai, and RCI. Rehabilitation Council of India for giving a wonderful opportunity to talk about research and disability rehabilitation. So far the sessions are going very smoothly with initiative of Professor Mokka Jagannatharao garu, who has emphasized the need of humanistic approach, and Nachiketa Raut garu emphasizing the need of qualitative research, and he spoke about Florence Nightingale. Today is her birth anniversary.
Sir, you see, sir, I kept SARS profile.
Okay. Florence Nightingale is today's her birth anniversary. So we are going to start our session within 10 minutes time, please.
వెంటనే తీసుకెళ్ళిపోవాలి అయితే.
Good afternoon, madam.
సార్ వెల్కమ్ సార్, వెల్కమ్ టు యూ సార్. లక్ష్మీనారాయణ గారు.
నమస్తే, నమస్తే మేడం.
సార్ కిషోర్ గారు. హలో కిషోర్ సార్.
లక్ష్మీనారాయణ గారు నమస్కారం సార్.
నమస్తే సార్, నమస్తే.
Sir, we will wait for 10 minutes, sir.
Okay,
10 minutes wait చేద్దాం మేడం.
No problem.
సార్ అంటే టైము మీకు 2:30 అయిపోయింది కదా, స్టార్ట్ చేసేస్తే మంచిది సార్. ఆ తర్వాత మళ్ళీ కామరాజ్ గారు ఉన్నారు.
Okay. So, good afternoon for the second session of today's national webinar on research in disability and rehabilitation, RCI-CRE status accredited. As I was telling you, this has been initiated by Dr. Mandiramna madam in technical collaboration with NIPMED, Adhika Nana University Department of Psychology, Sproha, Taipai, Sahai, and with accreditation of Rehabilitation Council of India. And initially, Professor Mokka Jagannath Garu has emphasized the need of humanistic approach and the pathways that has to be followed, with special focus on reaching to the disabled and rehabilitation personalities with a humanistic approach. And Nachiket Raut Garu has emphasized the need of qualitative research, and he has mentioned about Florence Nightingale. Today is her birthday anniversary. Let's all pay our tributes to Florence Nightingale. Incidentally, this is today is my birthday anniversary of my sister, Dr. Jyoti. She was also a very well-known academician and a service personality. And as Director NIPMED has said that it is there is an imperative need for qualitative research, and the impacts have to be done. And we have beautiful sessions from Harish Singh ji, Ravati madam, and many others are here. And we have good sessions from Parekh in the morning. And now we are going to have the session with Dr. P. Lakshminarayana, Assistant Professor of Economics, Adhika Nana University. He has Department of Economics, College of Arts and Commerce. He has done his BA with first class, and he has done his MA Economics from Andhra University and PhD from Andhra University. And he is NET qualified in 2018 and APSET qualified 2016. He has professional appointments as Board of Studies member of Dr. DNRC PG courses Bhimavaram till date, and Economics of Government College Autonomous Rajahmundry, and special invitee and Board of Directors of Economics Adhika Nana University, and research investigator for Economic and Social Studies Hyderabad, research investigator Agroeconomic Research Center Andhra University Visakhapatnam, research investigator Agroeconomic Research Center Andhra University Visakhapatnam, research supervisor Indian Institute of Public Administration, and technical assistant Agroeconomic Research Center Andhra University Visakhapatnam. And teaching load is he has many hours of teaching load, and is able to sustain it, and doing a phenomenal role as an academician and as a teacher. And he has attended the national and international seminars Otherwise, every year he's attending national and international seminars and workshops. He has papers presented is more than 10, I should say, conferences and seminars. He has conducted 2 seminars in 2015, 1 seminar in 2018, workshops, national level workshops in one in 2016, 17, 18, and 19, and international workshop in 2019. And Dr. P. Lakshminarayana, as I know him, is very simple, but he has in-depth knowledge. Let's hope that we all will be benefited listening to him, listening to his presentation. He's, I should say that he's a very resourceful person from Adhikavi Nana University. Let's hope that he's going to address to all the special educators over here. A hearty welcome, sir.
Thank you, Kishore.
Over to Dr. P. Lakshminarayan garu to share his screen and all. Thank you, sir.
Thank you, Kishore garu. Thank you. Am I audible, sir? Am I
Yes,
audible?
sir. Audible, sir. Audible.
Okay. Thank you, Madam Garu. Thank you for giving me this opportunity. As a teacher of economics, I would like to share some views regarding the research methodology in social sciences. So today I would like to explain how to collect a data from primary sources and secondary sources. So primary sources data need some sampling techniques, and secondary sources data there is also some techniques are needed. So before going to details, we have to discuss how we have to collect data, and that's so based on the literature you follow. So what is data and what are the types of measurements we have to discuss first. So then after we will discuss about the primary data and secondary data. So first, what is measurement? So regarding social sciences, this is a very important topic. So measurement refers to attaching numbers of labels to objects or events. So we know how to measure heights and weights of individuals, and we measure height in say centimeters or weight in kilograms or grams, etc. So if you look at the, can I share my screen?
Yes, sir.
Webmaster garu konచెం help చేయండి సార్ కి షేర్.
Okay.
Raghav garu, please help him.
Okay. Okay, no problem.
Sure, sir. Webmaster
Okay,
unnara,
sir.
sir?
Yeah, okay, sir. Is it visible right
Yes,
now?
sir. Yes, sir.
Okay. Sir. Okay, if you look at this table, so here we consider individual and height in centimeters. So this table contains statistical data of weights per a class of 60 students. So individual from 1 to 60 in the left side column we are showing. The heights are showing. The first person is 170, and the second person is 168, and third person is 172, and the last 68th person is 176, and so on. So, and another table also we are seeing. So this table presents the data relating to the heights of a finance class. That is 30 students in a class. Suppose at the same time, again we are taking into consideration the 1 to 3 to 30 is the individual numbers, and the weight in the another column 75, 71, 82, etc. So through the measurement we can generate data. So data is a collection of measurements. Data is a collection of measurements. data is analyzed to yield some insights. So may describe the central tendency of the heights and weights data using mean, median, and mode. I hope you are all known these simple statistics. So why? Because I don't want to go to the in detail. So using mean, median, mode, etc. We can also describe the variability of the data using range, mean deviation, quartile deviation, and standard deviation, etc. So may also such tools as spooness, kurtosis to describe the shape of the distribution of normal curve, or it is abnormal or normal, etc. However, the choice of a particular measure of central tendency depends on the way we measure the data. Similarly, when we are trying to describe the relationship between variables and the choice of the statistical technique depends upon the way the two variables have been measured. So can we measure anything easily? That is our question. So can we measure anything easily? When we try to measure something, we realize that it is far easier to measure certain things so compared to others. So then only we can measure easily. So taking physical measurements like height, weight, blood pressure, blood sugar is much easier than measuring the constraints such as attitude, motivation, honesty, and punctuality. Just as we use a measurement tape to measure height and a weighing machine to measure the weight. So it is very easy to measure height and weight with some tools. But we need some instruments, popularly known as scale, to measure the height and weight. To measure constructs such as attitude, motivation, honesty, etc., we also need a scale. So before we understand how a scale is developed to measure construct like attitude, motivation, honesty, etc. So can we measure attitude? Can we measure motivation? Can we measure honesty? So let us devote some time to understand different levels of which something can be measured. Okay, different ways of levels of measuring to construct this type of behavioral aspects. We can measure a particular thing in different ways or at different levels. Let us say we are trying to measure the age of our respondents. So respondent means you all know those who are giving answers to the interviewer is known as respondent. So those who are collecting data from the respondent is known as investigator or enumerator. Investigator or enumerator. So investigator or enumerator is none other than is the data collector. So respondent is who is giving answer to the enumerator or investigator. Suppose we are trying to measure the age of our.
Teacher sir, somebody is disturbing the class, sir.
So
class, sir, coming. Just
here,
mute the other persons.
Let us say we are trying to measure the age of our respondents in a survey. So survey means a sample survey. So we measure the age in the following ways or levels. So we may just categorize the respondents. The respondents means already explained, those who are giving answers. So into three groups. They are young, and another one is middle age, and another one is old age. 3 groups. So may categorize the respondents into certain age intervals again. So age intervals means below 30 years of age is one group, and 31 to 60 years of age group and another group. 61 to 90 years is age group is another group, and 91 years and above is another group. So might also record everyone age is completed years, completed months, completed days, etc. So it is the different ways of measuring a construct. So what is level of measurements? Levels of measurement. So broadly, there are 4 levels or scales of measurement.
సార్ నా లక్ష్మీనారాయణ గారు మీరు అన్మ్యూట్ చేసుకోండి సార్. అన్మ్యూట్ చేసుకోండి సార్ లక్ష్మీనారాయణ గారు. అన్మ్యూట్ చేసుకోండి సార్.
Okay, na? Am I audible, sir?
You're audible now. Okay.
Okay. My screen is appearing now.
Yes, sir. Appearing, sir. Appearing, sir.
Okay. So, what are the levels of measurement? Broadly, there are 4 levels of scales of measurement. There, one is nominal, the second one is ordinal, and third one is interval, and fourth one is ratio scale. So there are 4 scales. So before we proceed, understand different levels of scales of measurement. Let us re-emphasize the choice of statistical tools to analyze the data primarily depend upon the way of underlying the construct variables or measure. So first one is how to construct a nominal scale. So nominal scale is nothing but nominal scale, when we measure something using a nominal scale, we use numbers as just labels or identifiers. For example, if you take a cricket team, each player in a cricket team is labeled with a number printed on their jersey. They are using a coat or banyan, etc. So their jersey to easily identify them when they are playing. These numbers are just labels and do not make any difference even when interchangeable numbers given to 2 players. So further, we may not assign consecutive numbers to players even when they are assigned consecutively numbers, say 1 to 11. So 1, 2, 3, so 4. In cricket team, there are 11 numbers. So we are giving 11 numbers to assign for each player. So the order will be not have any meaning. So I used to watch Indian cricket from some a few years back. I remember Rahul Dravid wearing a jersey number 5 and Sachin Tendulkar wearing a jersey number 10. Did these numbers have any significance? So can it be said that Tendulkar was twice efficient Dravid? Yes or no? There is no. Because by wearing the number 10 number jersey, he is efficient, or 2 number jersey, he is inefficient. No. So for that matter, Ganguly used to wear a jersey number 1. Can't be said that Tendulkar was 10 times better than Ganguly. Definitely no. So further, we can also again alphabets like A, B, C, D, etc. Instead of 1, 2, 3, 4, etc. So it too does the same purpose. Now we realize that when we are measuring something using a nominal scale, we are just assigning labels. So here on jersey, we are using 1 to 11 numbers. So otherwise another A, B, C, D, etc. So this is treated as nominal scale. Nominal scale. So we are just assigned labels. We are categorizing the subjects into predefined bins. So let us take another example. A market research firm to do a survey of brand loyalty. Let us say this survey in 3 cities, namely Hyderabad, Delhi, Mumbai, and we are interested in the city of origin of our respondents. When we try to measure the city of origin of respondents, we simply pick a respondent, note him or her, and put him or her in one of the bins of Hyderabad, Delhi, and Mumbai. So the investigator should ask the respondent about their gender, color, preference, nationality, personality, type, the native state, or some of the other examples of variables that are generally measured on nominal scale. So these are all, if we measure this type of information, take into consideration, this is called as nominal scale. So another important scale is ordinal scale. So ordinal scale, when we measure something using an ordinal scale, again we attach labels to the objects or respondents. However, here the labels can be arranged in an order. Consider the example of the designation of teachers in a university. So in a university, generally, there are in a university, there are some assistant professors, associate professors, and professors. The designations are like this. These are just labels. The assistant professor is a label, associate professor is a label, professor is a label. While we pick a teacher, we will be able to categorize him. I have three bins, either assistant professor or associate professor or professor. So these three persons are a teacher. If we pick up a teacher from a bin, so either he is a professor or associate professor or assistant professor.
Rehabilitation.
Sir,
So
others
these
mute, please.
are just labels. While we pick a teacher,
Hello.
we will be able to categorize him or her in one of the three bins. However, these
Vivo
labels
160.
have some order. When organized from the lowest to the highest, we will get order starting with assistant professor or associate professor and then professor, from downward to upward, or professor, associate professor, or assistant professor. This is another scale. Similarly, the designations in police or military organizations are an ordinal scale. So these designations have some order, This is treated as ordinal scale. Sometimes we also assign numbers as a labels. Think of ranks of the student in the NEET exam. So the label is first rank is assigned the student who has scored the highest mark. The next highest score gets labeled second rank, and the next the third rank, and so on. Suppose let us if you take the individual names are A, B, C, etc. Their ranks are for A, the rank is 1. For B, the rank is 2. For C, the rank is 3. But A got 98 marks. So that's why among the 3 person he secured highest marks. So they are 98 marks. So that's why he got first rank. So after that, B secured 96 marks. So the difference is 2 marks for A and B. And again, C secured 92 marks. So for B and C, the interval is 4 marks. So if we give a order for the rank or marks, etc., it is treated as ordinal scale. So another scale is interval scale. So an ordinal scale where in the interval between any two consecutive data points the same can be termed as interval scale. That means in an interval scale, the data points are ordered and the distance between any two consecutive data points is the same. The popular example of interval scale is temperature. So we know that difference between 10 degrees Celsius and 11 degrees Celsius is same. As 18 degrees Celsius and 90 degrees Celsius, the difference is 1. If we take 11 degrees Celsius and 10 degree and 11 degree, the difference is 1. If we take at the 18 degree and 90 degree, the difference is 1. Similarly, the difference between any two consecutive points on a Fahrenheit scale is also same. So the intervals are same. However, we cannot say 20 degrees Celsius is twice as much as 10 degrees Celsius. We can't say. So this is not possible because we do not have any absolute zero on a Celsius scale. So the Celsius scale was developed nothing to freezing point of water, 0 degrees Celsius, and boiling point of water is 100 degrees Celsius. And dividing the distance into 100 equal parts, that is where the Celsius scale was originally called centigrade scale. So that is cent means 100. On the contrary, on a Fahrenheit scale, the distance between freezing point of water and boiling point of water is divided into 180 equal parts. So this is the story behind the interval scale. So our main part is in front. That's why we'll forward. So likewise, suppose if we look at this table, freezing point of water Celsius scale is 0 and the Fahrenheit scale is 32. So at the same time, Celsius scale is 10 and the Fahrenheit scale is 50. So boiling of water, Celsius scale is 100 and the Fahrenheit scale is 212. So cannot the ratio of 20 by 10. So if you consider this 20 number divided by 10 number before number is equal to 2. If we consider Fahrenheit scale, 68 divided by 50, that is 1.36. So both are not equal. Both are not equal. So we don't consider these as an interval scale. As a interval scale. So here there is incompatibility between the ratios. We can take another example of data points on Fahrenheit scale is 68 by 50 is 1.36. We can take another example of interval scale is at time of the day. We have a 12 hours and 24 hours scale. We take in 12 hour scale, we are seeing time as 2 p.m., 3 p.m., 4 p.m., etc. In 24 hour scale, we are considered 14 hours, 15 hours, 16 hours. They suppose 4 p.m. is 16 hours in 24 hour scale. Like, so on the 12 hour scale, the difference between 4 p.m. 2 p.m. is 2 hours. Also on the 24 hour scale, the difference between 16 and 14 hours is also 2 hours. However, the ratio is 4 by 2, the 16 by 14. 4 by 2 is 2 and 16 by 14 is 1.414. So this is the reason why the ratios are not meaningful. The ratios are not mean. So when we calculating interval scale, we cannot calculate ratios. If you calculate ratios, they are meaningful. They are not meaningful. They are not meaningful. So, how we calculate ratio scales? So the interval scale wherein the ratios are equal is called ratio scale. So measurement of height, weight, distance, etc. are examples of the ratio scale. So the other examples include sales, profits, costs, etc. Also we can consider as a ratio scale variables. So let us take the measurement of distance in meters, that is from 0, 1000, 2000 meters, 3000 meters, etc. So 1000 meters equal to 1 kilometer, 2000 meters equal to 2 kilometers, 3000 meters equal to 3 kilometers. So the interval between any two consecutive positions, both the scales are the same. So 3 kilometers minus 2 kilometers is equal to 2 kilometers, 1 kilometer is equal to 1 kilometer. But 2000 meters minus 1999 meters, that is equal to 1999 meters minus 1998 meters is equal to 1 meter. At the same time, the ratios are also equal. So, however, ratios are not equal. 3000 meters by 2000 meters, that is equal to 1.5. 3 kilometers divided by 2 kilometers, that is equal to 1.5. In the same way, the ratios are sales, profits, and costs are so meaningful in the ratio scale. The ratios are meaningful for the exist an absolute zero. In comparison, the interval scale will have an arbitrary zero. So these four are scale. So what are the measurements in statistics or research we can consider? For nominal, we consider the choice of measure for central tendency is mode only. So for variance or spread, there is no measure for nominal scale. So for ordinal scale, choice of the measure for central tendency is mode and median. For variance, it interquartile range, IQR, is the variance. For interval scale, the central tendency is mode, median, and mean. Three can calculate. So the variance is interquartile range, variance, and standard deviation. So for ratio, mode, median, and mean are the central tendencies. And for variance, interquartile range, variance, and standard deviation. These four are the measure for variance. So what level of measurements are desirable? So where possible, it is always desirable to measure by the ratio scale, because the ratio scale data allows the application of many statistical tools on it. So here we come into our main track, that is the data. There are different types of data. The first is univariate data. Univariate data is the data that concerns only one variable. Only one variable. The data considering the heights of a finance class or finance class of 30 students presented in. So student number you cannot consider. So weight is the one variable. So for one for first number it is 75 kgs. For 30th number it is 78. So here the variable is weight. So that's why univariate data, single variable data. So if you consider a single variable, it is treated as univariate data. And the second one is bivariate data. So bi means two. Bi means two. So bivariate data is data concerning only two variables. So continuing with our earlier examples, if we add the weight of each student along with his or her height. So we are here we are taking two variables. One is weight and the second one is height. Here two variables we are considering. That's why it is bivariate data. For first number students, his weight is 75 kgs and his height is 172 centimeters. So it is bivariate data. So, and another data is multivariate data. Multivariate data. So multivariate data is data concerning more than two variables. More than two variables. So we take into consideration individuals, weight, height, their marks in exam, and their gender. So we are considering four variables: weight, height, marks in exam, and gender. So here more than two variables we are considering. So that's why it is called multivariate data. Multivariate data. So multivariate data means more than, if there is more than two variables, it is considered as multivariate data. So data can be divided into categorical data and numerical data. So in categorical data category, the data measured on numerical and ordinal scale is generally referred to as categorical data. If you data considered for what is numerical or ordinal scale, is referred as categorical data. Categorical data is also referred to as a non-parametric data. So it is also non-metric data. So the data measured on numerical or ordinal scale is generally referred to as a categorical data. So categorical data is also referred as non-parametric data. It is also referred as non-metric data. Non-metric data. So another category is numerical data. The data measured on interval or ratio scale. Interval or ratio scale is generally referred to as numerical data. In this categorical data, it is nominal data. So numerical data is nothing but the data measured on interval or ratio scale is generally referred to as numerical data. The words numerical data or metric data or continuous data or parametric data are generally used and interchangeable. So numerical data names are the data measured on interval and ratio scales, and these data names interchangeably: numerical data, metric data, continuous data, parametric data, etc. Okay. So this is a introduction about the data. Now would like to explain about the how we collect data. So I am worked as a research investigator at various places. So in CES, Center for Economic and Social Studies, and Agroeconomic Research Center, Andhra University. My job is data collection. So for data collection, I was able to collect primary data and secondary data at that time. So based on that experience, I would like to share some views regarding the what are the sampling methods and how to collect the data. So you're all basic background is not economics. That's why I'm able to try to explain related to your field. So in order to answer the research question, it is doubtful that researchers should be able to collect data from all cases. That there is a need to select sample. So the entire set of cases from which researcher or sample is drawn is called population. So here you have to know the two terms, population and sample. So population is nothing but universal. So every year, for every 10 years, Indian government and other governments also conducting a survey that is called census. In census, every individual is taken into account and every individual is considered into the sample. So it is called universe or population. If you want to know some information or some data from census, from sample, sample, we have to take sample from the universe. There are some, what is it called, rules and regulations to collect the data. Then, so before going to data collection, there are some steps. So first, we clearly define a target population and select the sampling frame, choose sampling technique, and fourth one is determine the sample size. Determine the sample size, and after that we have to go for collect the data. And after data is collected, we can assess the data. So the first stage of the sampling process is to clearly define the target population. Population is commonly related to the number of people living in a particular country. And sampling frame is nothing but, suppose I studied, I did my research work on contract farming. So for contract farming, I selected Andhra Pradesh as a state. This is a one frame. Within that frame, I selected East Godavari district. So based on some secondary data, so within the East Godavari district, I selected some mandals. So within the mandals, I selected some farmers with the help of some secondary data sources. So this is called sample frame. So another one is choose sampling technique. Which type of sampling technique is important? So prior to examining the various types of sampling method, it is worth nothing. What is meant by sampling? Along with reasons why researchers are likely to select a sample. Taking to subject from chosen sampling frame, an entire population is called sampling. Sampling can be used to make inference about a population or to make generalization in relation to existing theory. So in general, the sampling techniques can be divided into two types. Sampling techniques can be divided into two types. They are, first one is probability sampling and second one is non-probability sampling. So probability sampling also, we can say that random sampling. Probability sampling, another name is random sampling. For non-probability sampling, another name is non-random sampling. Non-random sampling. So here sampling techniques. In the sampling techniques, probability sampling or simple random sampling. In the probability sampling, there are some other sampling techniques. They are, first one is simple random sampling, and the second one is stratified random sampling. The third one is clustered sampling, and fourth one is systematic sampling, and fifth one is multi-stage sampling. Multi-stage sampling. But regarding non-probability sampling measures, there are again 4 sampling measures are there. One is quota sampling, and second one is snowball sampling is there. Third one is judgment sampling. Fourth one is convenience sampling. Or simply say, probability sampling is a very systematic sampling method. So what is probability sampling? So probability sampling means that every item in the population has an equal chance of being included in the sample. So probability sampling means that every item in the population has an equal chance of being included in the sample. So one way to undertake random sampling would be, if researcher was to construct a sampling frame first and then use it to random number generation of computer the program, pick up a sample from the sampling frame. So it is called probability sampling. In the probability sampling, the first technique is simple random sampling. Simple random sampling. The simple random sampling means that every case of population has an equal probability of inclusion in the sample. So some disadvantages also associated with the simple random sampling. So in this simple random sampling, a complete frame is required. In some studies, such as surveys by personal interviews, the cost obtaining this simple sample can be high. If the units are geographically widely scattered, the standard errors of the estimators are also high. So here, if you take any sampling method, there is positives also there, negative points also there. So regarding another measure is in the probability sampling measures, another measure is simple systematic sampling. So what is systematic sampling? Systematic sampling is where every nth case after random start is selected. So for example, if surveying sample consumers, a fifth consumer may be selected from your sample. The advantage of this sampling technique is simplicity. So this is also one type of sampling. Then stratified random sampling. So stratified sampling is where population divided into stratas. Stratas means layers or subgroups. And random sample is taken from each subgroup. A subgroup is natural set of items. Subgroups might be based on the company size, gender, or occupation, but name is often used where there is a great deal of variation within the population, etc. So that's why if we consider every group into data collection, so it is called stratified random sampling. So another one is cluster sampling. So cluster sampling is where the whole population divided into clusters or groups. Subsequently, a random sample is taken from the clusters, all of which are used in the final sample. The cluster sampling is advantageous for the researchers whose subjects are fragmented over the large geographical areas. It saves time and money. Excellent. So another data collection measure is non-probability sampling measure. So non-probability sampling is often associated with the case of study, research design, and quantitative research With regards to the latter, case studies tend to focus on small samples and are intended to examine a real life phenomenon, etc. So in the non-probability sampling, method is very easy when compared with probability sampling. So there is no required of any secondary source data, etc. So quota sampling is the first measure in non-probability sampling. The quota sampling is a non-random sampling. It is a technique in which participants are chosen on the basis of predetermined characteristics, so that the total sample will have the same distribution of characteristics as the wider population. So, and next one is snowball sampling. Snowball sampling is non-random sampling method, non-probability sampling method that uses a few cases to help encourage other cases to take part in the study, thereby increasing sample size. This approach is most applicable in small populations that are difficult to access due to their closed nature. So this snowball sample. If you consider anyone as a sample, so this is the advantage of non-probability sampling, and another one is convenience sampling. So convenience means based on your convenience, you can take sample. So convenience sampling is a selecting participants because they are often readily and easily available. Typically, convenience sampling tends to be favored sampling among students as it is no expense. So these are all the non-probability sampling or non-random sampling. And last sampling technique is purposive or judgment sampling. So purposive or judgment sampling is a strategy which particular setting, persons or events are selected deliberately in order to provide important information cannot be obtained from other choice. So this is also very simple. So, but what are the strengths and weaknesses of different sampling techniques? Regarding, if you take convenient sampling, it is less expensive. We can spend very less time and most convenient. But weakness is selection is bias. Sample not representative, not recommended by descriptive or guide. So there are so many strengths. Every sampling method has their own strength, and every sampling method their own weaknesses also. But as per my knowledge, you go for random sampling is the best method. If you are not in a position to take random sampling as a measure to your study, then you go for non-random or non-probability sampling method. That is convenience or judgment or quota sampling or snowballs. So otherwise, if you go for random sampling, they are simple random sampling or systematic sampling or stratified random sampling. So it is one of the best. Next is, so sir, is there any more time?
Sir, you can take 10 more minutes, no problem.
Okay, okay. I will explain to another.
Sir, if you complete it is okay, sir.
Okay.
Otherwise, you can ask questions. What type of research they are doing and how you can help them by
Okay,
discussion.
madam. Okay, madam. This is the time for discussion.
Okay.
You
any
ask audience what type of research they are doing, how
సార్
they
మీరు సెషన్
collect
కంప్లీట్
data.
చేసండి సార్. కంప్లీట్ అయిన తర్వాత దీనికి వెళ్ళదు సార్. 10 నిమిషాలు ఇవ్వండి మేడం.
okay. So regarding secondary data, so we are now so far we have discussed about the primary data. Regarding secondary data, there are so many secondary data sources are available. So for example, regarding economics subject and other social science subject, if you go for MRO office, go to MRO office in mandal level, there is a one ASO, assistant statistical officer is there. So he is appointed for collect data on the mandal level, their agriculture, industry and services, etc. And in all India level, the government is giving a single unique format to them, and they collect data for that particular year. So after that, the mandal level data is available with the ASO or MRO and mandal level. So at the district level, so all the mandal level data is compiled, and they make a book. The book name is what is it called? Statistical. What is it called? District handbook of statistics of. Suppose you take East Godavari, the handbook of East Godavari. So in East Godavari handbook, so you can also buy very simple with 100 rupees or more. You can buy from collector office, district collector office. So there is a chief planning office, officer office, and you can buy from them. Every year the latest data is available with them. So another state level, all the district data is compiled by state government, state NSSO office. So the book name is Statistical Abstract of Andhra Pradesh, Statistical Abstract of Telangana, Statistical Abstract of Maharashtra, Statistical Abstract of Punjab. So you can also tap from website this data. So this is up to state level. So for all states, Indian government compiles data. So on the name of Statistical Abstract of India, Statistical Abstract of India. So by using these sources, you can get secondary data. So secondary data is nothing but published source. You can tap this from websites or MRO offices or district collector offices or any published sources or unpublished sources. You collect data from municipal office. So you go and write. It is unpublished data. So, but that is secondary data. But there is unpublished data or published data never collected. That is primary data. So for primary data, we are already discussed. There are so many methods. Regarding secondary data, if you observe at the time of budget sessions, so every budget session before going to budget presentation by the finance minister, before 2 days or 1 day, in parliament, the finance minister will release some what is called economic survey. So by using economic survey, you can derive some data. At the same time, RBI is one major source for all over India. Reserve Bank of India. Reserve Bank of India every year publishing, and every quarterly they are publishing many number of RBI bulletins on various issues. Suppose COVID-19, impact of COVID-19 of Andhra Pradesh state. How can we are unable to collect primary data at this situation. So where the reliable data is available. So go for RBI website, and in the RBI website, you search impact of COVID-19 on COVID-19 of Andhra Pradesh. The Andhra Pradesh, so what is the financial status of Andhra Pradesh, etc. You can, so there is a more plenty of latest information. I'm saying about latest information, not old information. Latest information is available on the RBI website. At the same time, Ministry of Finance, Ministry of Agriculture, Ministry of Sports, the Ministry of something. If you go for any ministry website, there are some latest information on their website. So it will be useful for your research, for studies, etc. So the latest information. So based on secondary data, you can go for primary data. So based on primary, if you use secondary data is for primary data, it is very useful. So both are have their own merits. Primary data have their own merit, and secondary data have their own merit. But primary data has collection is difficult. Secondary data collection is simple. So in statistics regarding population, all members of particular group or people or events or objects you can take consider
అదే
as a
మాస్క్
universe.
వేసుకుని డబుల్ మాస్క్ వేసుకో.
For example, a relatively small group when compared with population. So that is observed in the research study. In every researcher should divide what is population, what is sample. So there are some systematic numerical or labels for population and sample. For population size, in statistics, population size is denoted with capital N. For population mean, denoted with mu. Mu means it's like m. For variance, sigma square. For sample, the same population sample size is small n. For mean, x bar. For variance, it is s square. So based on these symbols, we can easily identify whether it is population or sample. So why study a sample? Why not the entire population? Usually the population is too large to study. Hundreds of thousands of millions of cases. So nobody can take data of universe or population to their research. That's why only sample study is better. So, and another important thing is time, money, and patience limit studying an entire population is saving sampling methods. So the population may change by the time the generalization is made, making the generalization invalid. So So based on data, the statistical inferences, and it's two different classes of problems. So
సార్ చెప్పండి సార్.
then okay,
ఆర్గనైజింగ్ కమిటీ అండి దాంట్లోనే ఉంది కదా సార్, ఫ్లైయర్ లో ఉంది కింద.
ఓకేనా? If you after collecting the data,
sorry బాబాయ్,
the every researcher should go for hypothesis testing. So hypothesis testing is nothing but to test some hypothesis about the parent population from which sample is drawn. The testing of hypothesis begins with an assumption called hypothesis that is made about a population parameter. Then sample data is collected to produce sample statistics, and this information is used to decide how likely is that the hypothesis parameter is correct. So in the hypothesis testing, how to set up hypothesis? The first thing in hypothesis testing is to set up a hypothesis about population parameter, then collect sample data, produce sample statistics, and use this information is to decide how likely it is that our hypothesized population parameter is correct or not. Say we assume a certain value for mean of population. To test the validity of our assumption, we gather sample data and determine the differences between the hypothesized value and actual value of sample mean. Then we judge whether the difference is significant. The smaller the difference, the greater the likelihood. That is our hypothesized value. And so based on this hypothesis testing, if we will have to frame null hypothesis.
అరుచి భట్ గారు మీరు ఆపాలండి మీ మాటలో.
Null hypothesis and alternative hypothesis.
కష్టమైపోతుంది సార్ ఇది.
So null hypothesis is nothing but it is a very useful tool in testing significance of difference. This hypothesis asserts that there is no real difference in the sample and the population in the particular matter under consideration, and the difference in found is accidental and unimportant, arising out of fluctuations of sample. So the null hypothesis is akin to the legal principle that man is inconsent until he is proved to be guilty. So alternative hypothesis is against null hypothesis. The alternative hypothesis specific those values that the researcher believes to hold true. So the alternative hypothesis may embrace the whole range of values rather than a single point. Suppose we want to know whether the drug is effective in curing malaria or not. So null hypothesis is the drug is not effective in curing malaria. That is a null hypothesis. Alternative hypothesis, the drug is very effective in curing malaria. So that's why one is opposite case. Alternative hypothesis is opposite for null hypothesis. So based on this, set up a suitable significance level and selecting the test criterion, whether sample is related to Z or TA or F or T test, which test is better, doing computation and the making decisions, or you can like. So this is the story. But if you consider primary data is better or secondary data is better, so the beginning researchers have their doubt. Primary data is very simple when compared with secondary data. Some people are arguing secondary data is very simple when compared with primary data. So which data is superior or which data is simple? Hello ఎవరండి? సో కిషోర్ గారు ఆపేయమంటారా?
మండ్రమణ గారిని అడిగితే
Can you hear me?
అదే ఎవరు మాట్లాడు. హలో
Hello.
మేడం వినిపిస్తుంది, నాకు వినిపిస్తుంది. So okay, which data is superior, whether primary data is superior or better, or secondary data is better? So some of the researchers are choose secondary data is available with very simple, with by using net we can collect the data, but after that in the testing procedure it is very difficult. Why? Because in economics especially we have econometrics, economics plus statistics. Econometrics is nothing but it is a subject of economics plus statistics. If you take a secondary data, you can run a regression. So before you put it data into the SPSS package, so some results appeared. So but all results may not fit to the analyze. Why? Because there are some DW statistics are like this. So if your DW is not fit for the data is invalid. But regarding if you take primary data, this type of problem is not occur. So every data has some their own limitations. It is a very vast subject. I don't want to go for the details. So
Sir.
but sir,
Last 5 minutes, sir.
Okay, sir. Already I am over. It is a discussion time, sir. Any
Okay. Over to Mandramna madam for further proceedings.
Sir, actually, Kamaraju sir is already there, I think, sir. You have his profile. Lakshmi Narayana sir.
madam.
You just ask 2-3 questions to audience, sir, about how they are doing research. That only. You initiate because you ask any questions, sir.
Hello.
Okay.
Attendees, it is a very important subject which he has taught you right now. It takes minimum 5-6 hours lecture hours for to tell you, but actually, I should say that it's a very crucial and very important message, and I request sir to provide us with a PDF format so that we'll be sending to each one of them, so that they can learn in a process. If we tell them, I should say that as a psychologist,
whatever sir is presenting, that
okay,
we can provide.
The span of attention is not more than 90 minutes. Is span of attention is not possible. So I should request on behalf of all of us here, NIPMED and Nana University and Sproha and Sahai and all, I request you, sir, to kindly give madam the PDF format so that it will be reaching them.
Okay, sir. No.
Definitely it will be of use, because by hearing it they may not retain it, but once they read it again, then they can come back to you. And I hope the special educators will agree with me. Do they need it or not? Just say in chat. This is of importance to you all. You must learn.
Yes, sir.
It's
Important,
a basic one. Chat, nobody is telling. Yeah, somebody said that thank you very much for sharing it individually. Yes, need, sir. Sir, it is unanimous.
Okay. I will send definitely, sir. I will send.
Yeah, sir. Because whatever you said is.
Sir, these here they take individualistic nature of data collection.
Yes.
They study on each individual, sir.
Sir, shall I move on to no questions for you, sir? Because we are running short of time, sir. Thank you very much on behalf of all of us.
Thank you for giving me
Dr.
this opportunity.
Thank you very much.
Superb
and very elaborate and access to material which you are given, and to absorb it takes time. And as I said that it will get, we'll give them a PDF format so that they'll read. And I specifically tell the special educators that they must learn this. It is, though it is sometimes the arithmetics may be difficult, but once you start learning arithmetics, it is life will be much happier and easier, right? And may I request Kamaraj sir is there, sir? Kamaraju sir.
Yes, sir. Yes, sir. Good afternoon, sir.
Sir, namaskaram, sir.
Namaskaram, sir.
So,
Sir will come from some corner. He will not appear.
he's
He will be there ready always.
sir, I'm really happy for introducing Kamaraj sir, head of the department special education, NIPMET Chennai. He has done his BMR, MSc, MED, and is a net qualified person. Rendered, I should say that even 15 years of services at NIEPID Secunderabad as special educator. Rendering services at NIPMET Chennai as special educator. Honorary Technical Director for Special Olympics Program, Andhra Pradesh for last 13 years. Visiting expert for RCI, Rehabilitation Council of India. Organized several in-service training programs, workshops, seminars, and conferences of national and international program. Published articles in 7 international and 8 national journals. I should say that a small brief only has been given to me. I have been restricted to talk more about him. I should say that he is a ready reckoner and an encyclopedia of special education and a man of deeds, not of words alone. And over to Dr. Kamaraj Garu. Kamaraj sir, a person who I admire for all his interventions and positive and pragmatic interventions also. Thank you. Over to Kamaraj sir.
Thank you, sir.
Sir,
Thank
welcome,
you,
sir. Welcome to you, sir.
Thank you, madam. Thank you, sir.
Thank you very much for giving so many chance. And sir,
Thank you,
please
madam.
kindly,
Thank you very much, madam.
your presentation will be excellent. I hope everybody will pay attention, sir.
Thank you, madam. Thank you very much. So I thank Adikavi Nane University Vice Chancellor, Vice Chancellor, and the administrators, Dean, HODs, faculties, and other staff members who are behind the scene to conduct this program. And I also thank our director, our RCI chairperson, and RCI member secretary, and our colleagues for connecting Adikavi Nannaya University and NIEPMD and RCI to conduct this program, the Research and Disability Rehabilitation, that 2 days webinar. So my topic, the topic given to me is challenges and the role of institution in promoting research in disability rehabilitation. So let me address the role of institution in promoting research in disability rehabilitation. Then I'll come back to the challenges. So the disability rehabilitation started from that charity model to the medical model and then to biopsychosocial model. Now the model that we are practicing is biopsychosocial model as a holistic model. So earlier it was that charity model. Now it is a biopsychosocial model. So everything is clearly analyzed. The physical aspect, the functional aspect, and then the psychological aspect, the social aspect. The entire aspect is analyzed, clearly analyzed, and then understood the person with a disability in total for accommodating or providing opportunity into the society. This is because of the research and development. So earlier there was no accountability of providing services. Now it is very structured and then very scientific way of or method of providing services. So this evolving concept, that the disability rehabilitation program is an evolving concept. This evolving concept is this evaluation took place because of the research and developmental activities happen in the disability rehabilitations. So earlier there was no awareness, and now it is no more of increased level of awareness. We can observe more on the increased level of that awareness. Next slide, please. Yeah, increased level of awareness. This is because of the scientific approach. Earlier, there was no service. Now it is no high-tech or sophisticated services provided. So this is because of the innovation or invention. Due to this, research and development takes place in the field of disability rehabilitations. As you all aware of that, as you all aware that our beloved president, earlier president, Abdul Kalam Sahab, so he invented a lightweight caliper shoes from the waste material of that aeronautical or that space research, the waste material. So now the inclusive education or the inclusive society is looking forward from segregated program, because they understand the strength of the inclusiveness. This is because of the research activities conducted in the field of rehabilitation, disability rehabilitations. So earlier that no right or denial of life was practiced. Now, so right-based movement because of the human right activities. So the attitude of rejection was earlier. Now it is more of acceptance. So you can see that everywhere the people start understanding the importance of people with disability being in the society, and then they started accepting. The acceptance levels are increased at all level. So the denial of job was there earlier. Now it is that we brought the reservation. We brought the reservation like any other people, and then they'll be allowed to participate in all the sectors. So there was no voice. People were not allowed to vocalize or voice their needs earlier. Now, so they have been promoted through that self-advocacy movement. This all taken place because of the research and development taking place in the field of that disability rehabilitations. Earlier we had that no awareness on the types of disability. So in the beginning, the terminology of that intellectual disability, or the terminology of that multiple disability, or the terminology of autism spectrum disorder, or the terminology of that XYZ disability was not existing in the beginning. So they were not aware of or not identified with a particular the terms to address the particular type of disability. Now we have come up to 21 disability. This is because of the research and development. So this prior to this, there were only 7 disability included, and only 4 disability included in one group of act, and 7 disability included in one group of act. Now everything is now comprised, and then we brought into 21 disabilities, and we are also giving a scope to add more disability, and this is because of the research and development taking place in the field of disability rehabilitations. So there are certain policies, act that supports the research and development in the field of disability rehabilitation. So if you look at that the fundamental rights, the Constitution of India, so there are certain that directive principles given to the states, and in that directive principles there are 2 principles which has the strong evidence of promoting research and development, that I'll speak to you in the next slide. So that national policy on education, principles. There are 2 principles that is evident. Next slide. there are two principles that is very evident that that we have to strongly go for that conduct research and development, that to develop the scientific temper, humanism, and the spirit of inquiry and reform. This is one of the fundamental that directive principles given to the state. And then to strive towards excellence in all sphere of individual and collective activity, so that the nation constantly rises to higher level of endeavor and achievement. So this is another directive. These are all evidence for conducting more research in the field of the humanitarian aspects. So when it comes to national policy on education, 1986. So prior to that University Education Commission or Second Education Commission, all that University Education Commission and the Second Education Commission all had the focus on research and development, all had the space for research and development for the development of the nation. But whereas National Policy on Education 1986 focused towards the education aspects, including persons with disabilities. As a result, we have come up with a project called Project on Integrated Education for Disabled. So that is PIDE. So that is launched in the year 1987. So followed to that, the program of action, continued to that, the program of action 1990. So that had come up with various projects like DPP, SSA, RMSA, RUSA, Samagra Shiksha Abhiyan. Right now, that Samagra Shiksha Abhiyan, all these projects are continuation of that National Policy on Education and its recommendations. So then that RPWD Act that focus research on, next slide please, the RPWD Act 2016 that focus research and development in all the aspects, life cycle approach of development of persons with disabilities. That is, research should be there in early intervention program, ECSE program, inclusive education program, access, universal design for learning, and then skilling, that is vocational training program, and then that job analysis, job vocational program or the job placement program, and then support system for high support need. The high support need is identified, that is very severe and multiple disabilities. They have to be provide whatever the support they require. So that kind of understanding we have come up with the possibilities of conducting research and development. So next, that national policy, new education policy 2019. So that sets the standard of conducting research to meet the global standardizations. So it sets a multidisciplinary educational research universities. It is aiming to set the multidisciplinary educational research universities. And then the National Research Foundation. So that will be created as an apex body for fostering a strong research culture and building research capacity across higher education. This new education policy includes the inclusive education of persons with disabilities and its intricacies. The responsibility of undertaking, next slide please. The responsibility of undertaking R&D activities are directed from the beginning to the higher education program and other related programs, especially the universities, colleges, and autonomous bodies. They have been directed to establish the Department of Special Education and undertake the research and development activities pertaining to special education program. But unfortunately, few of the universities have come up, or few of the colleges have come up with certain programs and provisions, and hardly we can find people are doing the research in the field of special educations. So it is very significant that the people who are doing research in the field of special education, so they are very unique, and then they are focusing towards a particular segment, and it is not able to generalize. And the NIs and other sectors that also providing services to person with disabilities, the research and developmental activity also vested upon the National Institute and other sectors. But unfortunately, the human resource development is restricted to National Institute because of various constraints. But whereas they have to depend on universities for conducting that research program, that PhD scholar, producing PhD scholars, they have to depend on the universities. Whereas they also conduct the research and development program in developing the material, in developing the resource materials. If you look at the National Institute and the research activities, mainly they develop the checklist, mainly they develop some teacher's manual or professional manual or parents manual. So these are all some of the materials, offshoot or outcome of the National Institute products. The research activities conducted through MHRD. So the lot of research activities are conducted through MHRD. So it is not widely published. It is not widely published when compared to the other foreign universities. So the research activity, whatever that our MHRD program is conducting, is mainly focusing on the basic research. The applied research are yet to take place. The intensive program on applied research are yet to take place. The UGC program, the Educational Research and Developmental Organizations, the Indian Council for Social Science and Research. So they are funding agencies where will be, applying the project to these agencies, and they'll be supporting, doing the research activities through UGC programs. The Indian Council for Historical Research, the Indian Council for Philosophical Research, the central universities, state universities, autonomous bodies. So these bodies will be having their own people to undertake the research, and then they'll be encouraging the other people to take up the research in the field of education, in the field of school education and higher education and technical educations. Similarly, the research which is now taking place in technical education, like All India Council of Teacher Education or Technical Education, the Council for Architecture, Indian Institute of Information Technology, Indian Institute of Science Education Research, IIM, IIT and NIT, and then NITT, TRs and DST. So these are all various, that agencies which takes intensive program on technical aspects, developing research and research in the field of technical aspects. So when we talk about accessibility, when we talk about that universal design, so we have to entirely depend on these people, like that DST people, they'll be funding for development of the prototype, development of the or designing the tools. Research in language, so there are certain organization that promotes the research in language. So that Sanskrit universities, then Kendriya Hindi Sankatan, National Council for Promotion of Urdu and
Kamraj sir, your voice is not audible, sir.
Oh, sorry, sir. Am I audible, sir?
Yes, sir. Yes, sir. Yes, sir. Now you are audible, sir.
Yeah, fine. The Central Institute of Indian Language, CIIL, is in Mysore. So it has the provision of undertaking the studies on all the languages, entire languages, and it has come up with that software program of converting one language into other language. All our Indian languages are converted in a fraction of second. In a fraction of second, if you feed the program in one language. So that Commission for Scientific and Technical the terminology. So these are all certain provisions which is available for promoting research in language. So the opportunities are available for conducting research in the field of disability rehabilitation. So these are all various agencies which we need to collaborate and conduct research. The other organization that promotes research, that is IGNU. So they are also promoting research. And then UNESCO, UNICEF, UNDP, that all these agencies, they are also promoting research and development. And then that NEPA also promoting. Next slide, please. NEPA also promoting. NEPA also promoting. No, previous. Yeah, yes. NEPA also promoting research and development, but the opportunity are enormous for person with a disability. That disability rehabilitation, research and disability rehabilitation, the opportunities are enormous, but unfortunately, there is no linkage made in between all these programs. A variety of that active opportunities are available, like the school education. There is a lot of opportunity for doing that research and development program, and higher education, there is a lot of opportunities for doing that research and development program. And then that technical education, there is a lot of opportunities to conduct research and development. And language development, there's a lot of opportunity. And there is other sources to do a lot of research and development activities. But unfortunately, neither of this research, that the disability sector, neither disability sector nor those other sector having a linkage or understanding to facilitate the research and activities in the field of disability rehabilitations. Then our Ministry of Social Justice and Empowerment, we have a separate department, that the Department of Empowerment of Persons with Disabilities, that facilitates R&D activities. So that has a bureau, that has a separate bureau called Project Research Evaluation and Monitoring Bureau. Project Research Evaluation and Monitoring Bureau. So that the organizational structure of our department is having statutory bodies, national institutes, public sector undertaking, composite regional centers, and then public-private partnerships. So these are all various agencies which is responsible for conducting or promoting research and development activities in the field of disability rehabilitations. So statutory bodies are like the Commissioner Office, Chief Commissioner Office, National Trust, RCI. So these are various statutory bodies. So they are responsible. The commissioner is responsible for undertaking research in the field of that self-advocacy, policy matters, and other things. National Trust, so that is responsible for the research and development in the field of multiple disabilities, autism spectrum disorder, and then intellectual disability, and then cerebral palsy, the care and other welfare activity related to all this disability, they have to undertake the research and development activities. The RCI, the manpower development, or the quality ensure of quality of service delivery. So these people have to ensure, these people have to undertake the research and developmental activity on manpower development and quality of service delivery by the professionals. And then the national institutes. So there are 9 national institutes established for developing appropriate service delivery model, developing appropriate human resources, and then conducting research and development in the field of their own expertise. So these people are, the national institutes are responsible for, it is one of their objective, to undertake the R&D activities. So all the national institute, so National Institute for Empowerment of Person with Hearing Disability, Visual Disability, Locomotor Disability, Multiple Disability, Intellectual Disability, and then there is a separate National Institute for Rehabilitation Training and Research, and there is a National Institute for that physical disability. There is a National Institute for Indian Sign Language. There is a National Institute for Mental Health and Rehabilitation. So there are 9 national institutes. So their one of the prime objective is to undertake the research and developmental activities. So other public sector, they are also promoting certain facilities for persons with disabilities. That is National Handicap Finance Development Corporation, NHFDC. Next slide, please. NHFDC and Alimco. So NHFDC, so they are also responsible for promoting finance for empowering the person with the disabilities. So they can also conduct research and development. Alimco, so they are responsible for developing the material for the locomotor disability and other disabilities. Now the responsibility given to Alimco for developing material for all the disabilities. So their prime objective also to undertake research and development and improve the material. Say for example, they have manufactured that tricycle long back, but other countries they come up with advanced technologies, and still Alimco is exists with the old model. So but no takers are available. So they have to go for update, and they have to go for the improvised one with cost effective improvised one with the latest technology, and that can be achieved through that R&D, research and developmental activities, or innovating the things. The CRC and public-private partnership. The CRC, we have that the composite regional centers for person with skill development of person with disabilities. So that also has the objective. Of research, conducting research and development like any other national institutes. The PPP partnership, public-private partnership, now that all the activities are undertaken through public-private partnership. So one of the center is established, that spine injury center, Indian Spine Injury Center. They also have the prime responsibility of conducting research and development for betterment of the spinal injury cases, spinal injury patients. Next, so that our Ministry of Skill Development, earlier it was that Ministry of Labor. So now the National Skill Development Mission is now taking place, because just possessing a degree, just possessing a diploma, just possessing a paper will not be sufficient. So they understand that skill is very much important. So they undertake the research and
Sir, is there any problem with your audio, sir? Kamraj, sir?
Hello, am I audible, sir?
Now audible, sir. Yes, sir.
Yes, sir. Yes, sir. The skill development program, earlier it was given by vocational training centers. So, and then IITs, some of the ITIs. So the skill development program through IT or vocational training center or NGOs, it was carried out. Now the same program, that is no skill development program, given to or attached to that ITIs, NGOs or VRCs to empower the person with the disabilities in the sector of skill development. But that also needs a lot of research and development for updating the skill, because the development is taking place. Today one program, tomorrow some other program. Today one that occasional program, tomorrow some other occasional program emerges. So that we need to keep on update in the field of research and development, through research and development in the field of skill development. Next. So now we are coming to that threats or the challenges to conduct the research. So it is a theoretical background. So all you know that there are certain internal threats and external threats or challenges to conduct the research. So the internal threats, the history, maturation, testing, instrumentations. The history is one of the threat, internal threat, that is identified to conduct the research. Like the repeatedly, if you go and ask repeatedly the information with the clients, so the saturity will be there, so they will not cooperate, so that affects the research. The maturation, so if you conduct a program for a longer period, if the duration of your research is a longer period, so there will be a obsolete, so the subject will get bored, they will not cooperate, so the research will not be very effective. Testing, so the test and retest, if you keep on testing the children, so they will get bored and they will not cooperate. So these are certain internal threats. Then instrumentation, if you keep on change the material, if you keep on change the people, if you keep on change the place for testing, so that also make the people non-cooperative, make the people non-participative. So see, these are certain internal threats. That internal threats continues, like statistical regressions. If you are more confident and putting all the low profile people to your your studies, that regression that goes into or shows a negative result. Selection of subjects, so if you show bias, in the subject, so that will that also give a challenges to your studies. Then experimental mortality, and if you add certain subject and if the subject doesn't turn up, so there is a issue in conducting the challenges of conducting the research. Then the maturation, selection, maturation, interactions. So if you allow the people to interact with other group, so that confounding the outcome. So these are all certain internal threats or challenges to conduct the research, and external threats like that reactive or interaction effect of testing. So the people will be very sensitive. If you do it in front of others, if you test the people in front of others, so that that may increase or decrease the performance of the children. So the people may be, some of the subject may be very sensitive for testing, so that may not be, giving a proper result. Interaction effect, that also that selection bias, so that also affects. And a reactive effect of experimental arrangements, so that that also affect or brings the challenges to conduct the result. Then multiple treatment, if you involve into various that programs, same subject given with various variables like treatment. So that also that interferes, one treatment interferes with other treatment. So we do not know which makes the effect, or which one is more effective. So it is very difficult for us to find out. So these are all certain challenges to conduct research. The challenges on best practices in disability rehabilitation, there are certain challenges we have identified. The researchers have identified to make that the best practices, to identify the researches conducted by all the people as a best practices, so that the great breadth and complexity. One is the great breadth and complexity. Second one is emphasis on empowering people with disabilities. Third one is small sample size. Fourth one, difficulty or impossibility of complete blinding and placebo control, and difficulty in defining an ethical and practical control group, need for enabling technology including assistive devices, and next one is funding levels. Next one is need to address issues within large social systems, and the next one is the sustainability of the program. So the great breadth and complexity, so it is very difficult to understand the skill, feeling or behavior or the health issues or the biological factors of children with disabilities through the study of very small size of sample, because and it is limited to particular place or within the particular area or within the particular that races. So it is very difficult to generalize. So that brings a great challenge for bringing or showing that study as a best practice in our field. Emphasis on empowering people with disabilities. So that also brings a lot of challenges to show that study as a best practices, because it is inadequate method of conducting researches. Inadequate methods are conducting researches in the field of disability rehabilitation. So that makes uncertainty about declaring that study as a best practices. A small sample size, so that because of the heterogeneity, so we tend to collect sample, very small sample, so that makes the people to uncertainty about saying that study is best practices. So that gives challenges to declare that study as a best practices. So difficulty or impossibility of complete blinding and placebo control. So if you give one that tricycle or one material or device to one person, and you cannot expect other person will not be used. So it is very difficult to blind and do the research in our country. So it is very difficult to, hence, so that also very difficult, like that using assistive devices or guide dog. So that is very difficult to that come up that it is that evidence. And then difficulty in defining an ethical and practical control group. So ethical and practical control group, like that
Kindly check your audio, sir.
Ethically, it is unfair.
Yes.
It is very difficult. It is very difficult to declare that it is the best practice. So enabling technology, including assistive need for enabling technology, including assistive devices and environmental modification to improve quality of life. So there is a need. So if don't provide that assistive devices, or if you don't consider that universal design, so then that failure, that put a challenges to the study. Then funding level, so that meager fund. So the prototype we get fund, but continuous of study. So where there is a fund, the decline of fund. So scarcity of fund is come up. We experience the scarcity of fund. So funding, that also constraint, that also affect, that also challenges to best practices. Put our best practices and need to address issues within large social system, considering social, physical, and economic environment. So that the entire spectrum needs to be addressed. So it is very difficult for us to address the entire spectrum. So it is also very difficult to sense. Hence, it is also very difficult to, because of the heterogeneity, because of the diversity. So we are failure in, or we are unable to provide the entire the facilities to entire include the entire spectrum. So it is very difficult to make it as a best practices. So the sustainability also is also very challenges. So we take up a project or we take up a research. So it is not it should be put into practice for a long time. So whenever we develop a project, we used to drop and then go for the next project, or we don't improve the project. We go to the next project as and when there is a direction comes from. So the sustainability is a challenging. So there is a lot of way ahead to undertake R&D activities. So that is a lot of challenges, a lot of activities that is way ahead to conduct research and development in the field of disability rehabilitation. That prevention, yes, we need to take at all level, like primary, secondary, and tertiary level. Then awareness using the latest media. Certification. So certification, the assessment should be culture free, free from bias. Culture fair test. Culture fair test. Culturally fair test, non-biased. The certification, the evaluation of the test, that should be that locally or the culturally it should be adopted. So early intervention program, we need to develop a lot of best practices, and then interdisciplinary or transdisciplinary approach need to be strengthened, and ECSE, the best practice need to be identified. That education, that UDL, differentiated learning, then curriculum adaptation, best practices we need to practice, and then skill development. So across the level, we need to innovate the skill development activities. Transition program, we need to strengthen the transition programs. So we need to build the resilience. We need to build the resilience at our level, and then employment. So the adaptation need to be bring into, so that everybody will be accommodated to the employment programs. Family and community empowerment and self-advocacy program. Access in terms of communication, access in terms of transportation, access in terms of infrastructure, and then technology. So that needs to be improved. Then professional development, that needs to be refined and then updated. Supports, the level of supports from no support to high support, the level of support that also need to be strengthened. Then policy intervention, we need to keep on update with the policy makers. So these are various challenges ahead in front of us. So the agencies that promotes research activities, that is ISSR, we take help from ICSSR, DST, and then ministry projects, UNICEF, UNESCO, UNDP, CSR, and then disability and rehabilitation research projects. Disability and rehabilitation research project. So these are various agencies that promotes research activities through fundings. So these are all references. So thank you, madam. Thank you very much. Thank you for giving me this opportunity to share my ideas in the field of research and development. No, that challenges role of the various agencies of promoting research and challenges of conducting research in the field of disability rehabilitation. Thank you, madam. Thank you very much.
Madam, your voice is not audible. Hello. Madam, your voice is not audible. Could you hear me, sir? Hello. Some
Yes,
technical
sir, yes,
fault.
Yes, sir, I can hear you, sir. But
Yeah.
madam voice, I am unable to hear.
Yeah, she left off. Mali again, we had to get her in, sir. She's getting a call and she's going off. And webmaster, kindly see that madam enters in. Yes, she came in. So, sir, it is Kamraj, sir, it is highly exhaustive, and you have given a beautiful and elaborate information. I should say that the information is really, really useful for each one of us. Especially, I should say that from 2015 onwards, or 14, I think, 14 onwards, madam is making very good efforts with a positive impact that there is a coordination among all the persons over here. As a member of American Psychological Association, as a member of Society for Community Research in Action, as a regional coordinator of Asia, and as a student of Adhika Vinaya University, I should compliment each one of you for the immense services you are rendering for the welfare of especially disabled children, and I appreciate you, sir. And I just suggest that there should be some cooperation, coordination, and collaboration among all the institutions which are suggested, wherein if they can act in cooperation and collaboration with each other, there will be lots of programs can be taken up. The impact and utility for the concern and to reach to the targeted disabled persons will be more one. And second aspect is that there is an imperative need scope for further research in this direction. And as you are aware, as you are rightly saying, that universities have to come up, and as a student of psychology and as a person,
Manigamna madam ni lopalki
వచ్చేసారు. As a student of psychology, still I have some apprehensions. See, we feel, most of us feel, I'm sorry to generalize that, most of us feel that rehab psychology is not my cup of tea. See, everybody feels that we should have some skills, something more than ordinary persons. So the rehab psychology can reach to the people. See, even a 10th class student is able to take care of a disabled person, whereas a PhD student feels that it's not my cup of tea. So this apprehension is sort of a, if right now we are our vice chancellor sir is gave a 24/7 counseling center. Still somebody are feeling that if you are going to consult a psychologist, what has happened? So in rehabilitation psychology, I strongly suggest, sir, you people who are in the policy making stage have to make the more number of people aware, especially the academics part of it. And I should really appreciate our vice chancellor sir for his not only his academic, scientific, and administrative impact and interventions to create an impact for helping the people, sir. So for this, my question is, sorry, I'm a bit this thing is my question is, what are the steps which we can take for cooperation, coordination, and collaboration of various organizations to tackle not only the research needs and the other needs of the disabled children, sir? With your vast experience and expertise, you can tell us.
Sir, Karadaji sir.
Kamaraj
Sir,
sir.
regarding this, hello.
Yes, madam.
Sir, regarding this, what sir expressed exactly the similar way, what I feel is, no, sir, if a child is born, immediately, if we come to know at any stage, developmental delay or any stage, we come to know the child is a special child, immediately, it is not like no, sir, separate special educator school or speech therapy like that. It should be consolidated, national government, state government, and also NGO, all parents' eye, and also doctors' eye, everything should be rendered to the child automatically. So it should be like in the last webinar, we thought like how they are giving Aadhaar card, the same manner, each and every child identified as special child must be given a number, sir. That is that you people only can do that at national level. If you can provide them one ID card with a special number, that ID card and all the needs of the child will be kept in the website. That is what we are thinking of doing in our university. If you do it in national level, so every child will have identity. So what are their needs? So any circular comes to regarding anything related to them, suppose Down syndrome, automatically that goes to the parent, the teacher who is attending, and also the government agency taking care of that person. So as you said, no, sir, earlier you were speaking, you are telling it is global. It is not piecemeal wise, but it should be consolidated one. Oneness should be shown in helping the child, sir. Every technology must come together, and we have to be ready with take the child from parents and help the child to reach its levels of achievement in any area. So that is what I feel, sir.
Yeah, true, madam. Exactly true. What you feel is no correct. The networking has to be like that. Say for example, early intervention that is attached to Ministry of Health, that school education that is attached to Ministry of Education, the vocational program that is attached to Ministry of Labor, and the accessibility that is attached to Ministry of that other sectors, the transportation, access to transportation that is attached to Transportation Ministry, that communication that is attached to Communication Ministry. Yeah, unless there is a understanding or that networking in between or interconnection in between all these ministries, in between all these program, so it is highly not possible. Say there should be a platform. There should be a platform bring among the networking among the sectors, so each one of us will be aware of. So we should not feel that no, it is not my job. They should not feel that no, that is not it is not their job. Everybody should feel that, attend to that, and then everybody should come forward to understand the need and then extend the help on the spot. Unless there is a coordinated work to decide the support, to extend the support on the spot, it is highly not possible. And the person with the disabilities will be running here and there from one store to one step to another step or one door to another door, knocking at each and everybody's door. So that
Yes,
we need to bring a common platform. The ministry has to bring a common platform. So I think that it is high level meeting is not high level understanding is taking place now. So I think right now, if we address these challenges to know that government, definitely they'll be able to understand and they'll be bring a better platform to facilitate all such programs together for the benefit of person with the disabilities. It is not done by one person. So I can understand better. I can feel that that person can give. But if that person doesn't understand better, he will take time to provide the services. So everybody has to understand better in no time, so the services rendered or extended immediately with no time. So this is what we need to address to the government.
Yes, sir, I agree with you, sir. I fully agree with you. There should be a collaboration and cooperation. And I personally feel that, and there was somebody telling that there should be a corporation and autonomous corporation to make all these things coordinated efforts and cooperative effects and collaboration among all the concerned one step. And secondly, as you rightly said, sir, Kamaraj sir, there should be the gap between policy promulgation and implementation has to be bridged if we can have a corporation like that, sir. Thank you very much, sir. It's highly exhaustive. You are, as I was telling you, you are a ready reckoner and an encyclopedia of, you told about acts and responsibilities, acts, and what are the organizations that are doing research and what are the methodologies and all. It's highly exhaustive. And to the attendees, special educators, I strongly suggest that you have to read, reread, and see how far you can implement them in your day-to-day individualized education policy, to not only to the disabled children but also to the parents. So, madam, next Professor Teki sir has already entered in, madam. May I ask Professor
Sir,
Teki sir?
actually, sir, before we start our valedictory, I would
Yes.
like to know any resource persons are present there. Dr. Ganesh is there present? Visalakshmi, Dr. Ganesh, or any of the resource persons like
Dr. Mani and Dr. Kishore, I'm free. Don't worry about.
I am here, madam.
I'll be with you. Okay, don't worry.
Okay, ma'am. No, sir.
Yeah, take your own time.
Because the span of attention is 10 to 5 yesterday, 10 to 5 today. The special educators will be, I should say that there will be information overload, sir. So we have to.
Okay. No.
Kamala sir garu ఏమనుకోద్దు, నేను కొన్ని నిజాలు చెప్తుంటాను నేను.
What I'm meant to say, the cup, when the cup is already full, pouring more tea doesn't have.
Sure, sir. Sir, you don't
diminishing
know, the special educators are with a lot of patience, you know. If they deal
That's
with
what
one
I'm telling,
child
madam.
for 1 hour, sir,
Madam, I'm not
if you deal
talking
with
that.
a child for 1 hour, you think this kind of seminars they can do?
Madam, I'm not talking that they are not having patience. The span of attention, one they can take up. They are patient enough to be with you.
Yes, sir. Yes,
అలా
sir.
కాదండి, ఇంకోటి
So
ఏంటంటే
this is
తెలుసా,
like
లాస్ట్ ఇయర్ ఆగస్ట్ I have something to confess with you all.
కిషోర్
Last
సార్
year
నాకు
August,
ఆడిబుల్ గా రావట్లేదండి.
ఎవరిది, నాదండి ఎవరిదండి? మేడం ఈ సిస్టమ్
అక్కడ
చూసుకోండి,
నాదేమైనా
పని
మ్యూట్
ఉంది.
అయిందా ఏంటి? నాది ఏం చేసినా ఆడిబుల్ గా లేదు.
మీరు చూడండి మేడం, మీ సిస్టమ్ చూసుకోండి మేడం, మాకు బాగానే ఉంది మేడం. మేడం, I wanted to confess to all of you.
Hello,
Last year,
sir, Kishore sir.
Yes, sir.
నేను సార్ రాఘవన్. అది
రాఘవ్
హోస్ట్
చెప్పండి.
ఇవ్వండి సార్.
sir,
Host and host.
sir, any of resource persons like we have our Annavaram sir is present or not? Sudhakar sir, Parek, Harish Thakur.
I am present. Yeah, I am
మణి
present.
మేడం నాది నాకు
I am present.
వినిపించట్లేదండి అసలు.
Sir, hello sir. Sir,
మేడం, మీరు
say
మీరు చూసుకోండి, మీ
Hello.
సిస్టమ్
two
చూసుకోండి మేడం.
sentences, sir,
కృష్ణకుమార్
Harish
గారు.
sir.
హలో
Harish sir.
Yes, madam. Yes, please.
Sir, just say 1 minute something, because already Kishore sir is telling endurance test. Patience.
No, madam. Let
Already
me
worked on
complete. Madam, let me complete it, madam. I wanted to exchange an idea of mine. Last year, August, I was
కిషోర్ సార్
attending
నాకు
international
ఆడిబుల్ గా
convention.
రావట్లేదండి బయటకి.
మేడం, మీరు చూసుకోండి మేడం, మీరు మీ సిస్టమ్స్ చెక్ చేసుకోండి మేడం. మా దగ్గర రైట్ గానే ఉంది. ఒకసారి ఆఫ్ చేసి మళ్ళీ రండి మేడం.
log off చేసి లాగిన్ చేయండి.
Madam, okay, madams and sirs, I have to say something about, confess something about during, I should, first of all, before I tell something, I owe my gratitude to Adhika Nana University and Psychology Gurus. 2019, I had been to Chicago, and by virtue of Professor Madhu sir, I was able to attend Psych Congress Regionals and SCRA Society for Community Psychology conventions at Chicago. And by virtue of participating in lots of webinars, I was made a member of American Psychological Association. Last year, August, I attended APA International Convention. So I'll be getting points. So I have till August, I have time. Believe me, in August 2020, I have attended and I was following each and every sessions very thoroughly. So far I am unable to see all the information which I am having. It's excellent, superb information which I wanted to share with you all. So for that, what I am telling to attendees is that by virtue of you attending, you will be creating an interest, and there is an absolute need for you to take home the all the information that is available with you, to which will enhance your confidence and concentration. That's all. Over to Harish Singh sir for his comments. Thank you.
No. Today being lockdown declared, from today onwards, I was a passive listener today. So I had a chance to listen to everybody, and really I have enjoyed all the sessions. Being the other side, always I used to be on the screen talking or giving lectures. So today whole day I had a chance to be like the other side, and then I was just a participant, passive participant.
Yes, sir. Very nice, sir.
And when it comes to the patient, yes, please.
Sir, continue, sir.
Yeah, when it comes to the patients of special teachers, I think that is the first and foremost qualification of a teacher. Apart from the technical qualification and the professional qualifications, the patient stands first for the special teachers.
Yes, sir.
Yeah.
That is true. That is true, sir. Sir, Kishore sir. Hello. Madam Krishna Kumari, madam, you want to express one sentence, anything? Krishna Kumari, madam. I think Ganesh sir is not there. Hello. Can you hear me? Hello.
We are able to hear you.
Sir, Ganesh sir is there, Mr. Ganesh, Dr. Ganesh. Sahai. Not there, I think. Visalakshmi. Mrs. Visalakshmi also is not there. Sudhakar sir is there, Mr. Professor Sudhakar from Central University. Annavaram Garu from Usmania University. Krishna Kumari madam, Cheyuta.
Madam, madam.
Madam, say one sentence. Yeah, in valedictory time.
Yeah. It is very happy to participate in this excellent program, today's theory program. This is very fortunate for me. So just because of Dr. Maniramana madam and Adikavinana University also. చాలా ఇలాంటి ప్రోగ్రామ్స్ ఎన్నో రావాలి, ఇంకా అందరం కూడా మన నాలెడ్జ్ షేర్ చేసుకోవాలి, ఇంకా మనం డిజబిలిటీస్ కి ఇంకా మనం చేయగలిగినది ఎంతో ఉంది అనేది ఇంతమంది ఇంటెలెక్చువల్ పర్సన్స్ ద్వారా తెలుస్తుంది. I hope all the best to everyone, madam.
Sir, madam, so next time our Radhika Nana University Department of Psychology will join with you in conducting international webinar.
Definitely,
so be ready, madam.
Definitely, madam.
You will be the coordinator from your side.
Yeah, definitely, madam. Definitely, I am ready to.
I request Kamraji sir to sanction an international webinar to us again.
Okay, madam. Thank you very much, madam.
From Cheyuta, because your experience also should be shared internationally.
Yeah, thank you very much, madam. I am very much ready to participate in any aspect. As a participant, as a resource person, as a coordinator, whatever it may be, I am always with you, madam. Thank you very much.
Yes, madam. We'll write a letter to NIPMED and say they will follow up and help us. Okay. Sir, anybody else is there?
Sir.
Rajshekar sir is there, sir? Bhavani madam? Narayana sir is there, I think. Narayana sir, Dr. Narayana, yes, Department of Psychology. Yes, sir. Narayana sir is there. Sir, now Kishore sir. Kishore sir. Kishore sir.
Yes, madam. Chappan madam.
You start your valedictory open valedictory function, sir. Invite Teki sir. Because nobody else is there.
Namaste to all of you, the special educators, for the మీరు అందిస్తున్న మంచి సేవలకి శిరస్సు వంచి నమస్కరిస్తున్నాను. ఎందుకంటే మేమందరం మాటలు చెప్పేవాళ్ళం, ఫ్రాంక్ గా చెప్పాలంటే మాటలు చెప్పుకుని ఇట్లీ తప్పించి.
Sir, sorry for interrupting one more time. Invite any participants also to speak, sir. 4 persons.
Madam,
2 ladies and 2 gents.
మీరు పూర్తిగా చెప్పేసుకుని నాకు అందించండి, నేను చేస్తాను. ఓకే, మీ అందరికీ నమస్కారాలు శిరస్సు వంచి. ఎందుకంటే మీకు ఆప్యాయత అనురాగాలతో పాటు మీకు అన్నీ కూడా ఏంటంటే సహనం, ఓర్పు, నిర్మలత్వం, అన్నిటికన్నా మించింది ఏంటంటే ఎంపతి అన్న పదానికి ఏదో తదాత్మత ఏదో అంటారంట, నాకు తెలియలేదు. డిక్షనరీలో చేస్తే నాకు నచ్చలేదు. ఇంగ్లీష్ వర్డ్ బాగుంటుంది.
Telugu is not known to us, so please tell in English or Hindi.
Yeah.
I'm unable to understand because
I really bow down to the services which all you people, special educators, are rendering towards your maybe your children or maybe to others with your patience, tolerance, very highly impactable and positive interventions. You are doing very good services to the people who are disabled. I appreciate you all for that, and I appreciate all of you for your patient listening for the last 2 days. As I was telling you, you may not be able to absorb. Maybe I don't want to say the percentage, though I know. So you have to go back and read and listen to whatever the speakers have said, and I appreciate you all. And as madam is suggesting, we request the special educators or the attendees to say you few words about your experience or feedback or whatever it is. Be frank. You can criticize also. I love criticism. Being a sportsman, if somebody criticizes me, I'll improvise. So over to what I could shoot, Dharanija. I'll choose 4th person from each row. Dharanija garu cheppandi madam.
Namaste to everyone. I'm very glad to attend this webinar. I acquired more and more knowledge. I thank each and every person to share their knowledge. Thank you, sir.
Akbar Unnisa garu, మీరు మామూలు అప్పుడు అంతా మ్యూట్లో ఉండట్లేదు, ఇప్పుడు మాట్లాడండి. అశోక్ గారు. ఓకే, కృష్ణవేణి మేడం, ఇట్స్ ఎ ఫాస్ట్ సెషన్ ప్లీజ్, వీఆర్ రన్నింగ్ షార్ట్ ఆఫ్ టైం.
అందరికి నమస్కారం అండి. ఈ 2 days సెషన్ లోని మేము చాలా మటుకు కొన్ని టెర్మినాలజీస్ లో ప్రకారంగా తెలియనివి తెలుసుకున్నాము. అది ఇంప్లిమెంట్ చేయడానికి మాకు అవకాశం దొరికింది. ఇలాగా మళ్ళీ సిఆర్ఈ ప్రోగ్రామ్స్ పెట్టినప్పుడు మేడం మాకు కంపల్సరీగా ఇన్ఫార్మ్ చేయండి, మేము అటెండ్ అవుతాం. ఇలాగా మా నాలెడ్జ్ నేర్చుకోవడానికి మాకు అవకాశం ఎక్కువ దొరుకుతుంది దీనివల్ల. థ్యాంక్ యూ మేడం. థ్యాంక్ యూ సార్. అందరికీ నమస్కారం.
Sir, you're not finding anybody?
Ma'am, good evening, ma'am. Teachers are, I'm Kritika, Dipmate M.Ed student scholar. Very happy. These 2 days we got more information and innovative. For experience you are sharing, we are very happy, ma'am.
Very nice. Welcome.
Thank you so much, ma'am.
Kartika happy, and Shivaji garu. You can talk in Telugu also, if it's possible. Shivaji garu, unmute cheskondi sir. Shivaji.
See, before talking, tell your name, no?
Undandi ikkada.
Because recording will be there. So before talking, just tell your name and speak.
Madam Varalakshmi garu.
Varalakshmi
Yes,
madam.
sir. I'm waiting for an opportunity to. Yeah, madam. Good evening, madam.
Yeah,
Hello.
please continue, madam.
Sir, good evening. Yeah, I'm actually waiting for an opportunity to extend my thanks. Even it is 2 days webinar program, but I really acquired a great knowledge. I'm a PhD. I have completed PhD in education psychology, and I'm a diet faculty in Kadapa district dealing psychology, especially inclusive education paper. So this webinar is much useful for me. I really have acquired great knowledge, especially to understand. And also, I'm extending my services to the Bhavita school teachers by conducting orientation programs on behalf of inclusive education. So this webinar is very helpful for me. Thank you very much, sir. And it's really nicely organized by Kishore sir and Mani madam. Thank you, madam.
Thank you. Anybody else, please?
Welcome.
Madam, we are
Hello,
already
Mani
past 5
madam.
o'clock. We'll stop it here.
Mani madam.
Sir, madam చెప్పండి.
Madam, I want to ask you one thing, madam. This time, మనం inclusive education మీద very frank discussion ఒకటి చేస్తే బాగుంటుంది అనిపిస్తుంది మేడం.
Yes, madam. Actually, inclusive education we conducted one international webinar seminar actually. Basically calling all 10
చాలా ప్రాబ్లమ్స్ ఉన్నాయి యాక్చువల్ గా దాని మీద ఫ్రాంక్ డిస్కషన్ చేస్తే బాగుంటుంది.
Definitely.
అంటే దాంట్లో ఉండే ప్రోన్స్ అండ్ కాన్స్ అన్ని కూడాను మనం అందరం తెలుసుకుంటేనే మనం ఏమైనా బెటర్
మేడం మన deliberations లో we'll take this point also, madam.
Okay sir, thank you.
Madam, we are running short of time, madam. It's already 5 o'clock. Some people are calling me and telling that they have some other works. Kindly consider that. And shall we start with the program, madam, with your kind permission? Mandramna, madam.
Yes, sir. Start, sir.
Sir, I request before calling the Professor Teki Garu, for whom I am a fan and an admirer, and I should thank the pious Adikavanana University, which is making a beautiful strides in the direction of webinars, in the direction of enhancing the education and enhancing the skills of the students as well as the teachers. Here we have Professor S. Teki sir, the principal of Arts, Commerce and Management, Arts and Commerce, to deliver his address the gathering as the chief guest of this valedictory session on behalf of Adikavanana University, on behalf of SPROHA, on behalf of Department of Psychology, on behalf of him. Thank you, sir. Over to Professor Teki, sir.
Thank you, sir. Thank you, Dr. Kishore Garu. Good evening, August House. At the outset, let me thank the esteemed Vice Chancellor, Professor Jagannath Rao Garu, for giving the College of Arts and Commerce and in that the vibrant Department of Psychology for organizing the 2-day webinar on research in differently abled persons. So let me also greet my colleagues, Dr. Narayana and the Iron Lady and Dr. Mani Ramani. Today also, yesterday, Vice Chancellor said the confidence levels are very beaming, but today she is very gracious. And Kishore Garu and all other collaborators and the resource persons, I could join a little late for Professor Kamaraj Garu or Dr. Kamaraj Garu discourse, which I really admire. I can make out how fruitful and how informative the deliberations from the feedback given by 4 or 5 participants. So I really thank all the resource persons and the participants and ISPROHA and all other collaborators. About 10 plus collaborators are there. But as you keep on saying, yesterday also I mentioned, for an academician or a professional, research as a continuous process unless one do it. And as far as research in psychology or that to research in differently abled arena or area is one of the highly prioritized area. we keep on saying हिंदी में जो कहावत है कि हम किसी से कम नहीं है, ये केवल I mean this is not only a movie title, but really I keep on saying myself whenever I go down, I always lift up myself saying मैं किसी से कम नहीं हूँ. So हम किसी से कम नहीं. So that is the spirit of differently able persons, because I have 2-3 practical experiences with the differently able persons. I have a friend, and he's a senior theology professor in Spicer Memorial College, Pune. I can say his name is also Dr. Sarath Babu. Is a blind teacher. He did his education as a blind, and also his PhD, and now he's a senior theology, heading the theology department in Spicer College. So those days during 80s, late 80s, like 89, 91, when I was there, so he was from East Godavari, and only just you go and touch once and speak with him. So if you go even after 10 years, and if you say one word, he will identify. You are techie, so and so. So even it so happened with you and me, we have all abilities we keep saying, but even a new friend whom we just met 5 days ago again comes in front of us and tells, "Sir, I might have met you somewhere, but I'm forgetting." But you see, a blind person, even after 10 years also, by just hearing your voice, making who you are. So who has more ability? So therefore, I keep on saying they have more talent than the persons normal who are having all those things. So the research is the one that brings us all these talents. As Kamraj Garu made his presentation, and Kishore Garu and the Madam Mani Ramani, and since yesterday also she has been emphasizing the research, the support, both hardware and software, and especially funding support. It's from the government or global level. It is only, what is it called? Most of the time it is because of fulfilling some norms or some namesake or lip service like that. But as Kamraj Garu mentioned, the triple C. I mean, the Kishore Garu also said this thing. Cooperation, coordination, and also what is it called? The collaboration.
Collaboration.
Important collaboration. That our iron lady, and today she looks so gracious. Dr. Mani Ramani is the excellent collaborator. I have no doubt if she was given a chance to go to Prime Minister and ask to meet and get collaboration for our university, she can do that. So this is such a talented collaborator. And also suggestion has come to form a FX corporation. So the 4th C, collaboration, cooperation, and coordination, and the corporation. Yes, indeed it is, because when we have corporations for on a caste basis, and it's very trivial basis, but when the differently able talent, or I just mentioned the tip of the iceberg, how potential is the talent from a blind person or another person. So to tap all these things for the best of the policy making inputs, not only for the differently able person, but see, we don't have a data policy making. We don't have a data, I mean, the researchers and the think tank and all these things are there. Only thing what we say is the commitment what leaks from other things. It's partly sometimes largely from the government and government agencies, even to the matter, the multilateral global agencies also. They keep saying they have their own requirements to spend certain amount of money. So they spend it, but without bothering about the outcome. So we need, that is what earlier we used to say, it is the budget, then output budget, and what is it called, the outcome budget. What I mean to say outcome is, for example, the pulse polio drive, like, earlier, 300 crores are allotted. If 300 crores are exhausted, so the department is great because money has been spent. But what is the output of it? no concern. Then it relied, then it is linked to output. Not only 300 crores spent by a department or a state or a district, but 300 million people should be vaccinated for polio. So then from a spending money, it has come to output budget. So then, okay, fine. What is then merely administering the vaccination makes any substantial sense? Yes, it makes to some extent, but is it real? If you want a real one, so you have spent 300 crores, administer 300 million doses of vaccination, but what is the incident rate that has come down? What I mean to say is the outcome. The bottom line, what we are missing is outcome for anything and everything. Money is spent and forgotten. Doesn't make much sense. Given for research, I mean, want to say as a prototype protocol, developing pilot studies and leaving like that. But it should be continuous commitment from the funding agency, let it be government, multilateral, non-governmental organizations, voluntary organizations, and even individual philanthropists. It's a continuous. Then the commit from the our side, researchers, academicians, special educators, whatever call you call it. Both should go hand in hand and as a continuous process. I hope that is what has been deliberated from the little participation I made, I can make out. And the Department of Psychology is always ahead of other in the Adhikar Nanaya University for providing academic, not only academic insights, but the policy making inputs. You know, how do the bureaucrats or government get policy making input? Everything and anything comes from academia and the research. Now we do papers, publish papers, and then they simply read it and copy it and modify it, and it comes to a policy. So what I meant to say is, for the 4 C's like cooperation, coordination, collaboration, and also corporation, but the other 5th C is the continuous commitment by all the parties, stakeholders, largely the funders, let it be governments, local, state, central, or multilateral agencies, non-governmental organizations, and individual philanthropists, whatever, and the doers, research doers like the teaching community, academicians, research scientists. Everybody should have a continuous. Not only today I need 2 papers to be published for my promotion, then I do it and forget it. Doesn't make much. That has, what is it called? Maybe output, but we need what is it called? The outcome. Outcome comes only through, and it comes through a continuous process. That is what might have after have been done. Not might have been. I'm sure it after have been done for the couple of days. I appreciate fully and I congratulate the Department of Psychology and the alumni association Spruha and their office bearers like energetic Kishore Garu and also handwriting guru Rajesh Khanna and the iron lady, and today she becomes gracious lady also, the Dr. Mani Ramani, and the teaching faculty of our psychology. There are 4 pillars we keep on saying, 4 or 5, 4.
Four.
Dr. Narayana, Dr. Bhavani, Dr. Mani, and Dr. Rajshekhar. You know, this is a very distinct department with what is it called? All having a PhD from a renowned university, Andhra University, and they do a continuous service to the society, and that is what I keep on saying. We have a very rich alumni in Rajahmundry. No other department has this credit to that. So I congratulate once again, and thank you very much for giving opportunity. Keep doing it. We are always with the unconditional support from the Vice Chancellor and the college and other faculty member keep coming. Let's all commit for continuous research that should lead to outcome. Not only output, but outcome also should matter. Thank you very much. Take care of yourself.
Thank you very much, sir. I'll add on 3 C's.
Thank you very much, sir.
I am adding 3 C's, sir. Consistency, constancy, and commitment also.
Yes, yes.
with your kind permission.
Right.
Madam, Shall we proceed for vote of thanks, or can I have time to give the gist of?
Kamaraj sir must be wanting to talk for 2 minutes, or Ravati
Kamraj
madam.
sir. Ravati madam, Kamraj sir. Kamraj sir.
Okay, sir.
Good evening, madam. I think sir is here, madam. Or,
Please kindly you speak, madam, because sorry may not be there. Kamaraj sir.
he was there, madam. Before 10 minutes, I was seeing his name. Sir is here, madam.
Okay. Kamraj sir, మీ గురించి విందామని sir. Want to hear from you?
Of the subject.
Madam ఉన్నారండి కామరాజ్ sir?
I don't think he is there, sir. He's left in the participant list. He is not there.
Ravati madam?
Sir, Ravati madam will speak. Teki sir spoke very well, sir. He is always encouraging us from the beginning. The day we joined, no, sir, he always says develop department, so that individual development and also university development will be there. So he stands on that only always.
Sir,
so,
for every Teachers' Day celebrations, we have celebrated with him also.
4+1. That is very memorable. Still,
he always says, madam, don't bother about anything. You just do things. That's it. So I am following his principle only.
Madam, Ravati madam, మీరు మాట్లాడతారా మేడం? సార్ వచ్చారండి?
మేడం 2 days ప్రోగ్రామ్ ఇంత బాగా జరిగిందంటే డెఫినెట్ గా మీ ఎనర్జీ నండి, మీ కమిట్మెంట్ ఎనర్జీ.
మేడం మీ అందరూ కోఆపరేషన్ తోటే అవుతుంది మేడం.
మేడం రేవతి మేడం, do you like to talk,
sir?
Madam?
Please, sir, Ravati madam, she can speak otherwise on behalf of NIPMED.
Yes.
Ravati madam, please kindly say 2 sentences, no?
Any sentence.
You are available now, madam. Okay, sir. Ask Narayana sir to give vote of thanks.
Yeah,
maybe
I have
see they have other programs also.
Great privilege of hearing from Dr. VVS Narayana garu, a very highly resourceful person in the research and methodology and in the psychology, and he has toured abroad and he has extensive experience and expertise. And I request NVVS Narayana garu, our assistant professor, faculty of psychology, Adikanami University, to speak few words. He wants to say a few words about research, and then he will talk about vote of thanks. Thank you, sir.
Deliver vote of thanks.
Yes.
Thank you, sir. Can you hear me?
Yes, sir. Sir,
sir, not audible, sir.
Yes, sir.
No,
not audible, sir.
You leave that mic. Leave mic. Leave. Yeah.
Leave.
Sir. Just a minute.
Okay.
Can you hear me, sir?
Yes, sir. Yes, sir. Now you can hear you.
Yeah. Thank you, sir. Thank you. So, thank you, Nagendra Kishore garu, for your nice words. So, good evening to the Honorable Chief Guest, Professor Mokka Jagannath Rao garu, Vice Chancellor, Adikanami University, and invited guest, Registrar, Professor T. Ashok garu, and respected Principal, Professor S. Teki garu, and guest speakers, participants, special educators, organizers, and my dear students. So, very good evening to you all. And I just want to say a few words. As you all know, research is a process of systematic inquiry. And we can also say that research expands your knowledge, and research gives you the latest information, and research helps you to know what you are, and research builds your credibility, and which is also helps you to narrow your scope, and research teaches you better discrimination or judgment, and research introduces you to new ideas, and which will help you to problem solving, and research helps you to reach people, and finally research encourages curiosity. So as you all know, I just want to mention these few words So doing research is a kind of passion. So if you have a passion to do research, you can reach the people and you can help the people. And so I am very happy to part in this wonderful webinar, which enlightened us to understand research in the area of disability rehabilitation. So these are my few words about the research I just want to mention before going to the proceedings of vote of thanks. So now it's time for vote of thanks. Firstly, on behalf of entire institute and collaboration institutes like NIPMED, Sahai, Spruha, I would like to thank the Honorable Vice Chancellor, Professor Mokka Jagannath Rao Garu, for making this happen. He is an academician par excellence and great researcher. And sir, you have molded Adikavi Nannaya University in so doing more than 100 webinars. You have thrusted us towards the greater heights. We owe you in our every success. Sir, you are also a psychologist. We are very much happy for you for your inspiring words in inauguration. I thank you from my bottom of my heart. And I also thank, I want to express my heartfelt gratitude to our registrar, sir, Professor T. Ashok Garu, who have given enormous support for making this workshop happen. And my heartfelt thanks to Dr. Nachiketa Raut, Director NIPMED, for helping us to organize this webinar. And we are very thankful to you, sir, for your knowledge sharing in keynote address. And without your support, it may not be happen. I also thank our beloved principal, Professor S. Teki Garu, for his continuous support and encouragement. Thank you very much, sir. I also thank Dr. Rajeshekar, sir, head of the Department of Psychology, for his support. And I would like to thank all the resource persons for 2-day webinar. It's a long webinar, even though, so they have took the time and they have delivered their lectures in a what you call as a fascinating way, and they have shared their knowledge very much impressive. And I would like to thank all the participants, special educators, parents, and students who have participated in this webinar. And my sincere thanks to webmaster Mr. Srinivas Garu and web designer Mr. Raghav Garu for continuous support for making this event success without any interruption. And I thank press and media, especially University Press and Media Cell, Nanayavani and Media Cell. And I would like to thank 2 days chairpersons, and they are also joint secretaries, joint conveners for the webinar. Mr. Nagendra Kishore Sunkara, founder president of Spruha and member of American Psychological Association. He is also a community psychologist and a great sportsman. And I also thank Mr. Rajesh Khanna, founder secretary Spruha and founder of Handwriting Guru. So, and I would like to thank organizing committee members. So we have a list of organizing committees, no more than 6 here, Sahai, THPI, NIPMED, Spruha, and some other local NGOs. I just want to thank from one and each one, like I thank Dr. P. Kamal from NIPMED. I thank Dr. Harish Singh from THPI Hyderabad. I thank B. Ganesh Garu, Dr. B. Ganesh Garu, Director Sahai. I thank Dr. Co-Director B. Vishal Lakshmi, and co-conveners of this webinar, Dr. Rajeshekar Garu, Bhavani ma'am, and of course myself and madam. And joint conveners, as I said, Shankar Nagendra Kishore Garu and Rajesh Khanna Garu. And advisory and supporting team, Dr. Pushpa Nagini, Miss Bhagyankar Sinha, and Miss Harini C. So I thank each and every one. Last but not the least, I thank to Dr. Mani Ramana ma'am, who take this program as a challenge. Even she is in isolation in a couple of weeks. And I can say that as our principal sir said, she is definitely Iron Lady. and she has this enormous energy, and and she has a strong willpower to do all these kinds of programs. And she's fond of doing programs, especially in the area of rehabilitation. And hopefully, I suggest Madam to establish a rehabilitation center in Rajahmundry, which may be helpful for many people in and around Rajahmundry. And sorry if I missed any name, because this 2 days program is a long program. I have attended few sessions due to my some other programs. Thanks to all who have supported this webinar directly and indirectly on behalf of Department of Psychology and other organizing institutes, supporting institutes. So thank you all for your presence here and making this webinar wonderful and successful. Thank you. Thank you so much.
Thank you, sir. Thank you, Narayan garu. Chala baga chepparu, sir. Vote of thanks. Precise and excellent. It's penetrating. And Kamaraj sir, ఏమన్నా మాట్లాడతారు, sir? Do you want to speak few words, sir, from your side?
Thank you, sir. Thank you very much. So indeed, it was very good or great, or successful program. So we can give any kind of program to Dr. Mani Ramana with the help of Adikavai and Nannaya.